Senior, can you hear me? I need you to speak, bro.
Yeah, no.
Yes, good morning.
Oh, okay, awesome. Thank you.
You're welcome.
Yeah. So we'll just be doing these checks at intervals such that we know that we are still all good.
No troubles.
Senior, can you hear me?
Loud and clear.
I need you to speak, bro.
Loud and clear. I can hear you. Yes, good morning.
Oh, okay, awesome. Thank you.
You're welcome.
Yeah. So we'll just be doing these checks at intervals such that we know that we are still all good.
No troubles.
Senior, can you hear me?
Loud and clear.
I need you to speak, bro.
Loud and clear. I can hear you. Yes, good morning.
Oh, okay, awesome. Thank you.
You're welcome.
Yeah. So we'll just be doing these checks at intervals such that we know that we are still all good.
No troubles.
Senior, hello, Samson, can you speak again?
Yes, YouTube kept looping it, so I don't understand.
It's now saying your network is unstable. Give me your...
Okay, can you hear me loud and clear, Samson?
Yes, Chief, I can. Good morning.
Is it echoing?
No echoes.
So let's stop. So let's wait now. Hello, Samson, can you speak again?
Yes, I can. Good morning.
Who is talking to him?
Yes,
Yes. And it's not
YouTube kept looping it, so I don't understand.
Maybe you are talking, you can mute your own. Hello, Samson.
Network is unstable. Give me your...
Okay. Hello, Samson.
Yes, Chief, I'm with you. Can I be heard?
Someone else or nothing.
Can I talk from you now connected to the system and send it? Is it going to be
I must send this to Samson.
Samson?
Yes, I'm with you.
Yeah, I said earlier, were you talking to someone else or was there a sort of loop?
So the thing is, I'm on two platforms, the Zoom and the YouTube. So by the time we're done talking on the Zoom platform, the YouTube keeps looping it.
Oh, hold on. You are connected to Zoom and you're connected to YouTube.
Yes.
And that's why you're getting that now.
So it's fine.
You understand?
Yes, I get.
So connect to just one.
Yeah,
Mm.
it needs to be on Zoom.
So just be on one. You can't be
You
on two.
should leave YouTube.
The time it delivers to Zoom will be different from the time it delivers to YouTube.
Exactly.
So we don't have a problem.
Let's confirm. Let's give it a try.
Okay.
No, I see that
try connect to network. Let's see, because if network is like then it goes simultaneously.
I'm even happy.
That's how it is. Like this 5G is still slower than this thing.
So we are now come. What is your network?
Either honeypot or connect to honeypot.
Honeypot. We are come up with
Link this password. So your first instinct the moment you use your audience is to connect to the next network.
You understand? Don't panic, just connect.
So presentation, roundtable session 1, roundtable panel discussion, two girls presentation. I have that.
Okay,
I think they are just two presentations.
that's all.
So I'm just waiting for Dr. Emeka.
Beautiful.
Hello, you guys froze a bit. Hello. Hello. Can I be heard?
Come up and do
Samson, so can we confirm now?
Yes, I heard you clearly. No echoes.
Oh, okay, so let's just wait for a while and see if we still have echo.
Okay, but you froze for few seconds before.
Yeah, because we switch network.
Okay, okay.
Yeah, I'm trying to actually have two networks on.
Okay.
Yes. It's going to be opened on the screen, just a click the link and that's it.
Anyway, is this network for you?
We're looking ahead, it's just.
I say, is this network for you? My speed test.
What's up?
463.69 download. The RSI is very, very low.
That's what I want. So, with the Zoom, I'm going to.
Yeah, I'm coming. Let me go and change my shoes. I'm gonna change my.
Before we change to my.
My leg already. Oh, okay. Go to YouTube. Go to YouTube. They won't do millimeter. Go to the column. Go to YouTube.
90 meters,
At least in a millimeter.
60 seconds.
Yes, just continue
Very
playing.
millimeter.
That is. So let's so basically what I think.
So did you say
They have done this thing and show the user to look at four so please, let's do it together since you are away. So this is the number. Are you? I say it's around 4 AM. I can close this again. This is going to be if I want to present students, so yes,
If you want to present, you want to share your screen.
yes.
Click on share. What do you want to show? So you have Windows. So you've not opened it. No. You just have to open it and keep it. Right? This is maintaining it, right?
Should I close my mail, everything there, so it will be the only thing open?
Where's your Zoom? Wait. Where's your Zoom?
Why is it showing like that?
You don't have the app. You don't have Zoom. This is like Zoom. Please don't have the
So what I'm doing now is I'm reducing the quality of the document so that it's easy to send. No, what you'll be seeing is like, they're not paying it now. They're not paying it. They're not paying it now, but it's going to be clear. But what I did is see what I mean. This actually also reduces. You do your heart, Jerry, do your thoughts. So you'll be able to spot the difference. So this is what I sent. This is what are you doing? Media. Because the attendance sheet. Now, once you can, the left side, then okay, I'm just thinking you should just doing this.
Oh,
It's not a very big thing now. The team cannot do. It's not a time consuming thing. The snap picture, we're going to need these pictures later. As we don't get it, let's not Jerry. So sometimes you will not be able to, you will not appreciate all these things until you need it. Why do let me increase my
Because I don't understand the stuff that you are using. I don't know what you are using here that is not sliding.
yeah. I need the pathetic side to don't look at red shirts. Wait,
Your time is up.
in Jesus' name,
People like here already. Do that when they're seeing.
It doesn't have to app. And I don't understand what this has done with sentence. If I want to download the app. Because if you click on share, it doesn't give you option to share the screen. Like you won't see some applications that it's not one of you, Sunday. I've downloaded it. Sunday and something.
About that on cannot just yeah, it's really for me to laugh. It's very
From that
yes, from this end.
Can you manage it from that?
so on you can actually have a space. I don't want to have to interfere with anything in space. There are sites,
Yeah,
patients, and
I agree with you 100%. I agree with you 100%. I agree with you 100%. Can you do it for your person?
Let me whose this is
that is mine. I was thinking of using both before you came before, so I'll just shut this one down.
What you have to do. Yeah.
Share me the link. Share me the link. WhatsApp, email, anywhere. Oh my God. Just remember.
Sorry.
Don't share.
Yes, but I say same thing. But
I don't have the link to this meeting. Share.
I thought I just said it.
The meeting link.
Yes.
The meeting that in the name of
Okay. The PR is not good. That's what we want to experiment. But now that they are here, we have to project. Can I get that address? Can I get that address? Can I get that address? Let me move it.
this.
See after us, you send it. Alright.
Gala babe. Morning. Pamela, where you say you share that stuff?
I said I sent it via mail.
It's going to write something. That's perfect.
It's the email you sent for me.
You want me to add something else?
No, I've had this one when husband discuss when men dey combat. Now go see husband marry someone.
Listen, the Lord maintaineth my lot. In the name of Torosumi, honor, is the Lord maintain my lot. And I will not be because they are wearing shirts now.
Accept me.
But you know, go carry the one where you see now. They there, they find spec, God fearing, one thing.
Even this itself, cannot be the one doing all of these things. Now, why I won't make you join? Because I'm not.
Good morning. Thank you so much and welcome to CIHP's fourth annual scientific roundtable series. Thank you so much. And we're about to get started, but I'd like to just ask that, so what I'll do first of all is to call some key participants to the roundtable, and then they will come forward to the chair front. Then some of us who are way behind will have a chance to come a little bit further forward, so that those who come a little late can come and sit behind. I hope that's it for you. Okay, great. So thank you so much. So my name is Dr. Emeka Kanebi. I work with the Center for Integrated Health Programs as the grant manager, and I will be your host for this morning. So thank you so much. So great. Without further ado, I'd like to call on the representative of a special advisor to the President of Health to please come to the high table, the President Dr. Fatima Jibrila. A round of applause, please. Okay. So that's so she's representing Dr. Salma Anas Kolo, the special advisor to the President of on the Health. Thank you so much for coming. A round of applause for her again. I'd like to call Miss Ketty Regis, coming from the French Embassy in Nigeria, to come to the high table. Please, a round of applause for her. Excellent. I'm calling our guest from the University of South Carolina, also the high table. All right, great. I'd like to call on Dr. Banky Olatisi from the University of South Carolina. Dr. Sharon White, please, a round of applause as she comes to the table. Also, our guest from House, all the way from the United States, would like to call on Reverend Sean Torres Anderson. Please, nice to meet you. Carmen Julius to the roundtable, to the high table. Thank you. A round of applause, please. Please, to the high table. Thank you. And then I'd like to call on, this is friends of the family, but also working in a space that is so sensitive and very key to what we're doing today, and that is Dr. Uwen Essiet from Action Health Incorporated. Please come forward. Great. A round of applause, please. Let's have their time. Okay, so as we get ready to have others come up, and whilst we're doing that, like I said, please, I'd like that you come forwards. So those at the very back, please, if you don't mind, please, there are spaces right in front so that those who come after we've started officially can. So please do this.
The person is not putting the mic close to me.
Okay, great. So, I'd like to call on, Dr. Ayo Dolce or Rutula from CCRN, the Chief Executive Officer. Please come forward. Great. Please cue music. Whilst we just move back to the browser, do that quickly and so we can start. All right, without further ado, I'd like to welcome someone very special and she actually started in 2019. She is the leader of the health program up to the last year. Please a round of applause for Dr. Bolande Oyeledu, the chief program. That she'll come up and she'll give the welcome remarks to everyone. Please a round of applause as she comes forward.
Good morning, everyone. Can you hear me very well? I'm not sure the mic is working, but I think, okay. Good morning, everyone. So I'm going to first of all start by thanking you all for coming right on time so that we can start early because we had a long day. So thank you very much. And it's a pleasure to welcome you all to the fourth Scientific Roundtable series. It's now become a series for CIHP. And I remember that when we started the first one, in conjunction with our partners from the University of South Carolina, we were pretty excited and we said, we'll start small. And we still wanted to go really, really far. So when we started, it was just a small gathering, and we did have one panel, and then we had one presentation, but we had a lot of robust discussion, which led to the second, and then the second led to the third. And then the third, a lot of people said, well, why don't you make this bigger? Why are you not letting more people get to share from other IPs, from the states, and from other partners? And so this is where we are this morning at the first Scientific Roundtable. So thank you all very, very much. And going back this week, it's been the International Youth Day. And so we do know that the missing link, especially across a lot of the countries, whether it's developed countries or developing or in the process of developing countries, because we have different categories. The thing is, there's not been enough focus on young people, but then the potential of every single country, every single nation is actually the investment we make in our young people. So having this scientific roundtable, especially this week, is also to let us really focus on what we are doing for young people, what we can do for young people, and also to hear from young people what they want us to do and how they want to, and how they are helping themselves. So that's why we're here. So today we will be focusing on the theme, which is the missing link, reducing the vulnerabilities of adolescents and young persons through sustainable interventions. This is very broad, and as we walk through today, we will break this down further and also be able to talk through it. So through the day, there are different people here from different hemispheres, frankly, from different worlds, from different organizations, partners, and this is an opportunity for us to get to learn from each other, for us to be able to factor in the work that we're doing and how we can do it better, and how we can do it in a much safer environment, and also making sure that we foster learnings. And beyond today's conference, we also build linkages, we build friendships, we build relationships that can actually get us to do much more. So on that note, thank you for coming out, and I welcome you today.
Thank you so much. Another round of applause, please. Great. I'd like to acknowledge the presence of the representative from PEPFAR, in person of Nena Oyema will be representing the PEPFAR coordinator, Fumi Adesanya. Please come to the high table. Nena from PEPFAR, you're somewhere in the room. Yes, hopefully, thank you. All right, great. I also want to recognize the country director for ICAP. Where are you, please, in the room? Yes. Well, thank you so much, Dr. Wale Akijiji, for being here, and also a representative from ICAP, Dr. Remy Olandi. Okay. All right. Thank you so much. Thank you for being here. We have Dr. Oladi Gogo and Oladi Dolu. Please come to the front to just come sit forward, please. And Dr. Wale Akijiji, please come forward. Please, a round of applause for them. All right, so I know it's morning, I know the weather is a little cold, so don't worry, it will peak at some point. So let's just permit it for now. We're just trying to get the arrangements right and get people to sit closer to the action. All right, so thank you so much for your understanding. Yes, please. So we'd like to call the CEO from AHF, Dr. Echie Ejevie. Are you here, please? Thank you so much. Please come forward. Please come. A round of applause, please. So we have partners from, so representative from CHAI, Dr. Nere Otogo. Are you here, sir? Dr. Nere? Okay, you're representing. Well, please come forward. Please come this way. Yes, please. Great. Would like to call on the country director from 360 HSBC, Mr. Nonso Owondinjo. Please come forward to the high table. Please. Oh my God, I pronounced your name correctly. So please come forward to the high table. so much. So, before we get started, in between, I will introduce persons as they come, so that we know who is in the room. Again, beyond the science bit of business is also going to give an opportunity for networking, partnerships, and collaborations between organizations. So it's good you also know who is in the room. Excellent. So at this point, okay, great. So we have, he just came in and we'll be bringing him to the high table. He's representing the Director General, Dr. Telita Ilori from the National Agency for the Control of AIDS, NACA, and the person of Dr. Chigozie Ujang. A round of applause, please, as he comes forward to the high table. The CEO Enfuse just walked in, Dr. Andy. A round of applause, please. Okay. Great. As more people come into the room, I would, and I know and I'm aware of them, I would acknowledge them in the space. But please also, if you are representing your CEO or your country director and you're here and you haven't been acknowledged, please just let some of our ushers who are standing to know so that I can recognize you. But I'll do that during the course of the event. All right. Okay, great. So at this point, we're about to start officially, and so we would like to start with the national anthem. So I'd like to ask that the Nigerian national anthem, because we have multinationals here. I'll ask us to please stand, and then we would project it on the screen, and then we would be able to go through. Thank you. Amen. Okay, thank you so much. So we'll start. You have your agenda. We'll be going according to that. And we'll start with a couple of goodwill messages. We'll start with the representative from of the Special Advisor to the President on Health, Dr. Salma Kolo-Anas, represented by Dr. Fatima Jibrila, to give the Google message from the presidency. A round of applause, please.
Good morning, everyone. Good morning. I am Dr. Fatima Jibrila. I am representing Dr. Salma Ibrahim Anas, the SA to the President of Health, who is unavoidably absent. She sends her greetings and best wishes. So I will start by saying, yes, adolescents and young persons are one of the important group of the population. In Nigeria, about 60% of the population are between the ages of 25 and below. Adolescents may be vulnerable due to so many factors, which I can remind us. One of them is physical challenges, the rapid growth, hormonal fluctuations, social pressures like peer influence, the substance abuse, drug abuse, yes, family dynamics, and other life challenges. But then this administration has identified youth intervention in general, including the adolescents and young generations. Because of their importance in the population, we have to support them, we have to uplift them, we have to empower them. Because among the factors that contributes to their vulnerability, the most worrisome is the lack of effective yes, and accurate health information, and then lack of access to quality healthcare services. So this has been looked into, a lot has been done, and all processes are ongoing to see that we prioritize youth, including adolescents and young persons intervention. Very soon we are going to launch a program. President Bola Ahmed Tinubu Champions for Health, which is a very broad intervention that we look into most of the challenges that are faced by these adolescents and young persons. But I can assure you, we cannot do it alone. It has to be all hands on deck so that we have so that we achieve our desired goal. So I wish us success and fruitful deliberation in this discussion.
Thank you so much, Dr. Fatima Jibrila, representing Dr. Salma Ibrahim, the Special Advisor to the President on Health. Thank you so much. A round of applause for her again. We will now be calling up for his Google message, Dr. Chigozie Ujam, representing the Director General, Dr. Temitope Ilori from the National Agency for the Control of AIDS, NACA. Please, a round of applause as he comes to the podium.
Thank you very much. Good morning, ladies and gentlemen. I bring you greetings from the Director General of the National Agency. Quite pleased to be here. In the organization, I now have the desk of gender and human rights. And it's just nice to know that the topic actually speaks to the communities. We've been here and we've done many few scientific roundtables, but the topic this year is quite. I think it's best because we're speaking about the next generation of people. If we can protect them, I think that will be lending our voices and our actions towards ending the spread of HIV for future generations to come. So I'm glad and I'm keen to hear. I think the master ceremony spoke about networking. I think I want to learn from everyone else, and I think that we'll all learn together and meet a few old friends and continue networking. So I'm keen to hear and learn. We'll see how the day goes, but I wish us all the best. Thank you very much.
Thank you so much. That was Dr. Chigozie Ujam, representing the Director General, Dr. Tedito Lori from the National Agency for the Control of AIDS, NACA. I'll be calling up Madam Nena, who's representing Dr. Fumi Adesoya, the PEPFAR coordinator in Nigeria. A round of applause for her, please. Okay, we have to have a deal. We keep clapping till they get up. Okay, so just a good round of applause. Thank you so much. Yeah.
Good everyone. I'm here representing today, and I must say, working with young people is an important part of working for PEPFAR. We understand the vulnerabilities of young people in accessing healthcare, treatment, and also in interacting with older people, sharing their own lived experiences. The dynamics are different. And at PEPFAR, what we do is to listen, to support, and also to lend a hand whenever situations arises in this group. And I will say at PEPFAR, our work transcends not just young people, but also the community, especially around the HIV, what we do in the HIV, within HIV. This is coming timely, and I want to thank the government, the organizers, also young people for advocating and pushing this to the front burner. PEPFAR is happy to lend her support. Fumi wishes to be here also, and the entire team is backing me up to stand here and represent them as well. I must say thank you, and I wish everyone a fruitful discussion to bring out great policies and great discussions as well. Thank you so much.
Thank you, Madam Nena, representing the PEPFAR coordinator Nigeria, Dr. Fumi Adesoya. Great. So now we'll just move forward to the first presentation. We have other goodwill messages, but they are not in the room yet. So once they come, we'll give a chance for them to give their goodwill message. Oh, hi, how are you? Welcome. Please come forward, please, sir. I think that's, is that Uche? From APN, yes, please come forward, please. A round of applause, please. Thank you so much, looking dapper.
Morning, everyone. It's my great honor to represent my national coordinator, the person of Mr. Aaron Sunday from Association of Positive Youth Living with HIV and AIDS in Nigeria. I'm so excited for this program today because as APN, so we are the major umbrella of young people fighting HIV and AIDS in Nigeria. So where we educate them about sexual health and reproductive, and more about the contraception need to prevent from other diseases apart from HIV. So I think being here today to enhance our efforts in passing messages and also educating the youth in the community, so that they can also have more knowledge about the viruses in the community, and also to enable them to have a sensitive and quality mental health counseling as well. So thank you very much. It's my great honor. And also it's my great honor once again to meet Ms. Inena. I think we most met in Lagos 2 weeks ago. So it's my great honor to meet you. So thank you very much. And I believe that this gathering will make a great impact in the lives of the vulnerabilities of the young people in Nigeria. So your contribution and also what I'm going to get here from this discussion, it will also enable us to pass the quality and accurate information for more quality health and well-being of the young people. Thank you so much.
Thank you so much, a round of applause, representing Aaron Sunday from APIN. Thank you so much. I would like to call on a representative of one of the CDC IPs supported by PEPFAR in person of Mr. Andy Ayo from ECUS. Please, a round of applause for him. He's the Chief Executive Officer, ECUS. A round of applause again.
Okay. Okay. So I'm very grateful and happy to be here, standing on the existing protocol. We are colleagues doing great work with youths within the CDC space, and I think for me, I was really excited coming here. This is our week where we are celebrating the International Youth Day, and the adolescent and young people's challenge, the major issue. We see missing the link and a lot to learn with the great work that CIHP and a couple of us have done. I see my friend too doing fantastic work as well. And market engineer, I think it's the time that we continue to zero in on this challenge. When we look at the data is very clear. Making success with adults, particularly within the HIV and AIDS response, but we also see that real missing link. I think as a country, looking at getting data right, which we've done in recent times, is also really highlighted the need to be more innovative, be more, looking at the Gen Zs and the Gen Alpha, maybe basically it's a new dynamic reaching them. It's a real new dynamic, and I think it's nice that we look at the science and we really begin to think around best to communicate. Because I think we may be losing it if we use the old ideas with the young people now. I mean, even within the digital space, it's still further stratified. So where are they? How can we really zero in on them? And I think I want to congratulate CIHP for sort of being a pace setter here. I'll be willing to learn and listen in. My colleagues can also be listening in. And thank you so much for continuing to wish you well and congratulations.
Thank you.
Thank you so much, Mr. Andy Ayo, the CEO, ECUS. A round of applause for him again. Excellent. I'd like to also acknowledge some key persons who are being represented in the room. We have Ismaila Yusuf, who is representing the country director, Dr. Adetiloye Onire, the country director of GPIO. A round of applause, please. We also have Mr. Charles Bombiano, who is here. Thank you so much for being here. A round of applause, please. We have representatives from TechHer NG. TechHer NG. If you're here in the room, please, you can just indicate by wave of hand. TechHer NG. Thank you so much. Yes, we have representatives from APIN Public Health Initiatives. No, APIN Public Health Initiatives. Anybody? Thank you so much. Thank you so much. We have representatives from CCFN. CCFN. Just indicate by wave of hand. And yeah, okay. All right, thank you so much. We have representatives from IRELA, the Executive Director, Amba Itohan. Is she here? A wave of hand, please. Thank you so much. Okay, so some of you are in the crowd, but you're shy to raise your hand. Please, we are all friends here and we're partners. So please, when your organization is called, please just indicate you never know where the next grant is coming from. Okay, so thank you so much. And we'll move over to the next segment of our presentation, of our roundtable series on your agenda. And that is, we'll start with the presentation. So this is session 1. on the agenda. Again, we mentioned when our other guests it's basically giving an overview of CIHP Scientific Roundtable Series and objectives, and that will be taken by myself, Dr. Emeka Kanegi. So that's the next slide presentation. So we just cue that so that those who are online can see that. Great. So I think we should also do that quickly before we get started. Great. So if you're wondering what's going on, we just had Dr. Hadiza Kamofu from FHI 360 just walk into the room. Round of applause, please. Great. So I'll be giving the overview of CIHP Scientific Roundtable Series and the objectives of the meeting. Thank you so much. So Dr. Gola started talking about the journey so far. Again, this was, and I'm so excited to see that our partners from the University of South Carolina, who were actually at the first meeting, are still here. We've been for the past 4 sessions that we've had. And so we started, it just came up with, we need to have this platform where we're able to learn, where we're able to share ideas, where we're able to move the needle across different health program areas that CIHP and other partners in country are involved in. And so the first maiden event was held in August of 2019. So it's actually an August occasion. We're always on time for August, right? So the first was tagged Reaching Zero, Emerging HIV Dynamics in Nigeria. And this was just after we had learned of the results that had changed the HIV epidemic, or the dynamics in country following the NICE results that were being published in 2018. And so we knew that we needed to re-strategize, we needed to come up with new strategies to be able to close the gap and then reach HIV epidemic control. So that was held at the Transcorp Hilton here in Abuja. And so the second edition was in August of 2022. It was tagged Leaving No One Behind. And we're looking at innovative program recalibration, integration, and then the role of big data. Dr. Baki is here, and he loves saying that, reaching some population for HIV epidemic control. Again, this is about the time that we knew we had done so much work. And some of the states were already getting saturated, but there were still some populations that were being left behind in our HIV response. And so we had this conference to basically zero in on those groups and see how we can find children, how we can find those who are missing, and making sure that we're not leaving anyone behind, including our key populations. And so in 2023, just last year. So again, I wanted to explain why there was none, but do I really need to explain why there was none in 2020? Yeah, that was when the country, the world basically was hit with the COVID-19 pandemic, and then life as we knew it changed for a time. So in 2020 and 2021, when we're just getting back to business as usual, we didn't have a session, but immediately we knew that we could gather our colleagues from the University of South Carolina to join us and other parts of the world. Then we opened up again in 2022. And so last year it was tagged Time to Act, using the power of data to reach missing children, young people, and the most vulnerable towards universal health coverage. And one thing I have to say is that we moved on from 2019. It keeps getting bigger, it keeps getting better. The discussions are just amazing. And then we actually come up with resolutions that we're able to take forward. And this year promises to be another exciting event. It's tagged The Missing Link. You've heard it several times on your agenda. Reducing vulnerability of adolescents and young persons through sustainable interventions. And this comes at a very good time as Dr. Ballard mentioned, and also Dr. Andy had also mentioned at some point. Next slide. So great. So why are we doing this? What is the rationale for all of this? As mentioned earlier, adolescence is a critical period fraught with myriad of health challenges. We know that. I think Dr. Fatima also started mentioning that what are the challenges that we see with young persons? What are the challenges we see with adolescents, you know? And there are really crucial needs that they have. The good thing is that every single person in this room, including some who are still adolescents, right, have been adolescents. So we do know how difficult that time is, even for those who you could say are privileged. Talk more of those who aren't, you know. So there is just a very difficult time navigating puberty, navigating peer pressure, navigating just being in a world that you don't understand or a world that does not understand you. So just understanding those unique needs and trying to program for them. But also we have a special group of people, the girls, adolescent girls and young women who have additional intersecting vulnerabilities that they have to contend with in a lot of societies that are patriarchal and dealing with those and navigating through just a very, very unique dynamic. So how do we move them from that? How do we help them from that situation and then really significantly improve their chances in thriving in their health, in thriving in their careers, in thriving in the world today? And so that's why we're here. We want to facilitate dialogues. We want to have those difficult conversations. We want to see what is sustainable. What can we use technology to leverage? What is culturally appropriate? What can we do for adolescents here in Nigeria and young persons? And how can we make this impactful and improve the lives of young persons? All right, so what are the objectives? It would be nice if you stop with what you're doing. It's very distracting. Thank you so much. So what are the objectives? So we have an acronym there that's called, I really want you to feel happy as you're here. All right, not high in a bad way, but feel high in a good way. And so these are our objectives. We really want to foster collaborations, and we know we have the right people in this room, right from the government, right from NGOs, right from academia, and also even beneficiaries in the same space. So we're really excited that we get that opportunity, and that's one of our objectives. The second is we really want to see, because we do know that technology has its pluses and its minuses, but we want to focus on the pluses. How can we use that to get to our young persons and program better for them? We also want to ensure that in all we're doing, we're adopting, we're adapting, we bear in mind the situation, the environment, and ensure it's enabling the young person that we're working with. And the L of the field, we really want to learn to see what are those innovative community strategies that we can deploy to reduce GBV amongst these groups as well, gender-based violence. And then the how is that we really want to highlight sustainable approaches to empower these groups. We want to see what those are, bring them and start looking at how we can, through the science, implementation science, move this forward, deploy this, and ensure that we're able to empower these groups. We're looking at STEM education, that's science, technology, engineering, and math, vocational trainings, and also leadership programs. In essence and in summary, we want to inspire. That's why we're here. We really want to inspire. So thank you so much for listening, and I hope that you have a great conversation as we proceed with the program. So great. So just what I tried to do is to set the tone with that, but as we were speaking, we had very key persons come in from their friends of CIHT, and we are also here we have Dr. Prosper Nkoko is here. Please, a round of applause. The CEO of AP Public Health Initiatives around workforce training. We also have Dr. J. Wilson Samuels, a round of applause, please, sir. The deputy and CEO from APN as well. So thank you so much, sir, for being in the room. Again, like I mentioned, as we continue, some persons, and it's not because they are tardy, some people actually are out of, their busy schedules, had to carve out time to be here at this time. So we all know our schedule. So they had to be somewhere else, and represent and come here, and they informed us prior to this time. So thank you, sir, for making the time to be here. So great. So without further ado, to set the tone for our discussions, and seeing that we're doing pretty well with time, so that's good, and that's one of our hallmarks, and we'll keep to that. I would like to welcome the co-founder and director of Action Health Incorporated, Dr. Uwemedimo Uko-Estiat, to give the keynote address on the situation analysis of adolescent health and empowerment in Nigeria. Please make welcome Dr. Uwemedimo Uko-Estiat. The keynote speaker. Great. So Dr. Uwemedimo Uko-Estiat is the co-founder of Action Health Incorporated. Leading national NGO. He's a Pan-African Conference on Sexual Health and Rights, and is currently serving on the WHO Geneva Technical Advisory Working Group for the development of the WHO's self-care competency framework and curricular guidance for health workers, and the WHO Sexual Health and Wellbeing Advisory Group. He also serves as a member of the International Advisory Group of the Partnership for Child Development, Imperial College in London. He has worked extensively in the education and health sectors in Nigeria, and also with the African Union Youth Division. Again, let's make welcome Dr. Wayne.
Good morning, everyone. Not so excited with this rest. Good morning, everyone. Good morning. Wow. Thank you so much for being here, everyone. Let me adopt all the existing protocols. Let me start by saying that my being here is not by choice. You know, Dr. Bola Oyedekun and my wife, Adenike Essex, happens to have been childhood friends, and possibly, so she wanted my wife to be here actually. Nika is more brilliant, and she's the face of progress. And unfortunately, Nika cannot be. Somehow, she got a Emeka to reach out to me. And the Emeka said me something like scientific analysis. So I called the I'm not a researcher. I work in the field. I work with young people. And if you want me to come and talk, we need to change or adjust the title. And she said, just come and tell us about what you do. So I'm very pleased to be here to see a few old faces prosper. Let me acknowledge also that Dr. Bola Oyedekun in 1999, when we were having the first national conference on adolescent reproductive health, she was the focal person in the federal ministry. So thank you for putting this together. At least you have not left your first number. So I'll be gisting with us. And so I've been spending some time on a few slides. I have a few slides to share. but more importantly, to speak from the heart, to give my own, well, I would like to take now my own perspectives in some of this work. But let me start by saying this is the most important work that we are well neglecting. And it is unfortunate that we all passed through this phase, and we are not recognizing that unless we invest in that phase, our tomorrow is compromised. So now teach me how to use all the technology, and I struggle with something. So my objectives are the first two. The third point will be our collective to make. I'm not being restrictive. I'm just going to tell you experiences, things we are finding in the field, and then we all can begin to think through what we need to do next. Next slide. So the first assumption is that we really want to improve adolescent health, and we want them empowered in Nigeria. And this is very critical because it is easier said, but when it comes to the doing, then people will start telling you things like it is not in our culture. You know that thing you are saying is too sensitive. And the next assumption is that we want to harness the full benefits of the adolescent population board in the demographics of Nigeria. This is very critical. Next slide. I think this does not need any explanation. So what are we doing with 24%? So if you believe that we are 200 million, so how many, what will be this population? You know, when people talk about great countries like Rwanda, this, that, I just laugh. I said, do you know what it means when we unleash the out-of-school children in Nigeria on Benin and Togo? You know, if you combine the populations of those two countries, and you look at the population of out-of-school students in Nigeria, for instance, you know they are not as many as the out-of-school. And most of these out-of-school children are in the population that we are talking about. Next slide. So, who are these adolescents? We know them by their ages, but you know, we pretend as if they are not around. The truth is they are not homogeneous, and they are everywhere. I was having a conversation with one of the delegates in this meeting this morning at breakfast. And we were talking about child marriage. And the person was, I'm sure he knows himself. He was saying this part of Nigeria. And I just kept quiet. The truth is that there is no problem that is not prevalent in every sector of every part of this country. It is not that the differences in numbers make us tend to think that it is those people. So adolescents are listening. Some of them are doing great things. Some of them are great achievers. Some of them are underperforming. You know, and we will begin to see why programming has not caught up with them. You know, I had a member talk about technology. There's nothing wrong with technology, but technology for who? You know, so you will see how even in our programming we are discriminating. So let's look at the many classifications of adolescents, how we describe them. In school, out of school. Once you are in school, you have a better opportunity, isn't it? Guys, we are talking, you know, we are just right? And then some of them have not been to school at all. You know, when you are in school, you can step out, then you become out of school. But if I've never been to school, let me tell you, we did some work at EYL. EYL is the host community of the University of Lagos. And Professor Makiwa, they say he was the lead researcher. And she was shocked when she was finding that 3 generations had never been to school. And then we didn't wait for that research work to be completed. We ran to the Lagos State Ministry of Education and said, can you believe that in the wire? You see a grandfather. How do you get 3 generations? Grandfather, father, and child. None of them are going to school. And then the Ministry of Education called the director of Agency for Mass Education, and we have to quickly ensure that the government, not us, with an intervention in that community. In the same area, let's take Abuja. Last night I slept at Jabi. There are many estates in Jabi. So you would see your neighbor, the children don't go to school. But all the children in this other estate, they are all going to school. On our streets, if you look at total institutions, remand homes, prisons, or correctional facilities now, have you ever been to anyone? Once they open those gates and you look on the field, who do you see? Young people, adolescents. You go to our religious places, you find them. You know, how about the many of them that have disabilities? All forms of disabilities. How do we program for them? Do we take them into consideration? We may be shooting out numbers. You know, I like all these 90 by 90 by 90, you know, then you know, everything that we talk about, maybe HIV, zero tolerance, this, that. Who are you reaching? Why are we leaving others behind? Is it my fault if I have a disability? It's not. You know, next slide. Rural, urban, peri-urban. You know, the peri-urban people are the most unfortunate people. You are not in the rural, you are not in the urban. You are still in the city. And you know, with all these, you know, we are very religious also. We carry both. Those of them that are married, is it by choice? Those of them that are not married, are they happy with the quality of life that they have? Some of them are cohabiting. It's not because they want to, just for security reasons. Because if you're there living on the street and you are not cohabiting with somebody, it means you are permanently vulnerable to multiple sexual partners. What will be noticed? Do you know what it is to be displaced? Conflict. I also come from the south. Do you know what it is to be hard to reach? When if you need to have fuel, they need to put it in a boat to bring. In fact, I was listening to one of the Niger Delta activists who was saying that in their place, fuel sells for 3,000 naira per liter. You know, these are the realities. Then they are highly mobile, depending on how you look at them. The aspiration. Who does not want good life? We all do know. Is it not comfortable being there? We are enjoying this atmosphere. They also are out there and they are imagining what we are doing here. And let me digress. In Gombe State, last year, we got news. The workshop was taking place in the school. The school has a good hall in one of their GAs. And people in the villages around heard that food was available. So what happened? They migrated from their villages and came to the workshop ground and demanded that they wanted the food. So what did the people do? You know, you do 2 tea breaks and 1 lunch. So they have to prepare the 2 tea breaks while they do the lunch. So you can imagine how this thing is. So if they are employed, an adolescent that is employed, what kind of employment is that? Anyone below 18 years is a child, so that's child labor. I hope some of us in our homes don't get involved in this human trafficking and child labor. When you send to people from some parts of Nigeria to come and work for you and help you raise your own children when they themselves are children. Because you see, I'm talking to myself too. Everything I'm saying, we are not here yet, but we need to continue to conscientize ourselves. And when you are unemployed, you know, and we can go on and on and on. For you, am I hearing you? Are you feeling me? Thank you. Next slide. So HIV, this one, you know, let us give ourselves some data. You know, and I'm looking at prevalence is, they say, those 15 to 19 make up 2.9%. Human beings are not percentages. We need numbers. But the magnitude of the problem is diminished when we use percentages. The multiple indicator cluster survey says that young people, fact confirms that young people are sexual beings. And this is the problem in program. We don't want to accept that they're sexual beings. What is wrong in this section? If you are not sexual, you are not human. Because we cannot continue to have newer generations. Somebody gave birth to us. We must also give back. And the truth, we are all adults. Is there anybody below 18 here? Right? Whatever form of sexual expressions that we have, 99.999% is for pleasure. It's not for making babies, so we have been deceiving ourselves. And this is a major problem. And you want to program this to be culturally appropriate. Let me also digress. When we are doing work, when the World Bank program started, we got a grant to work in Borno State. The desk officer realized, put us in the hotel, helped us to find the hotel, the Jima Hotel. I went. And everything we were told is that in the north, no alcohol, no this, no that. How do you stay in your hotel room all night? It's not possible. I was still young, and I'm still young now. So I stepped out to go and buy suya. And I noticed that cars were picking and dropping people. And there were men driving the cars, they were picking the men and dropping women. But the following day, when we got to the meeting, I told the desk officer, a lady, was right here. Yes, I think it was very bloody. She said, what happened? So I told her. She said, no, you know, Yeah, people, I said, we need this program, we need to just come out. This is good. That is what she did. She saw it. And I said, so why are we deceiving human beings? Look, you don't know the kind of sexual networking that will be going on even in the school. So why are you deceiving yourselves? You know, it's a problem. Because data, this is what science does. It speaks to us, but we know what it's saying. You know, we just want to repeat what we are telling ourselves. Next slide. You know, because of adolescent employment, it's child labor. I look at the kind of thing that we are having. And then let's look at stress. You know now, the young people talk about mental health. Anything you say, they don't tell you stress. The truth is, we are not paying attention. The pressure on every young person now, adolescent, is so great. Technology is supposed to be an enabler, but technology is a problem. It's a big problem. We are moved on to it. And we know what you are doing. So as young people need us to understand their context. They need us not to be judgmental. They need us to be here. Many of us, we want to relieve our adolescence by dictating to their adolescents how to live their lives. And so we are not waiting. And unless we change, they can change, but they also will go through that phase. But we who are in the positions of power, but that's what we have about us. And let's accommodate them meaningfully. Let's listen to them. Don't let us problematize adolescents. Yes, maybe for programming purposes, it makes sense to do for adolescents that are living with HIV. That's all right. And I was asking a colleague in the vehicle, when he was telling me about all the programming things they were doing, I said, okay, so when this guy wants to have a relationship, how does the guy disclose to the partner? Or when she wants to have a relationship, because it is natural for people to be happy. Is it not natural for them to like each other and to want to take it further? At what point do I now say I am an 18-year-old living with HIV and I like you, maybe your real name is better than the name of my mom, and I want you to know that I'm HIV positive. That is a very, is it easy? The man from April, is it easy? Oh, that's not good. How do you move that slide? Non-communicable diseases amongst adolescents. It's real. Very real. And use of alcohol. And we can go on and talk about other things that young people use loud. And is there anybody from NDA here? Okay, please, next time, bring them into this conversation. You know, one of my sons went for one of these Christmas concerts at the hotel. And he came back. And I said, how was it? And he said, my God, that place was hot. I said, hey, what happened? He said, the atmosphere was all manipulated. Openly, these things in our time, you know, they can even abuse you. How many of us people right here? And when was our home that you take in their hand? So what about it? No, it doesn't mean anything. Like, if it's just something they pass around at parties, pass loud, pass this, pass that. And we are here programming. So ask me, how do you program? You know, we talk of IDUs. This one, they are not using injections. They are taking it, they are serving themselves. So what do we do? Now, buzzword, empowerment. Huh? You know, in Nigeria, everybody, once we pick one new word like this, the streets, the correct one is palliative. And when it's happening prosperity, so we will settle. You know? But empowerment is a concept that we have not included. And as it is written, empowerment is about how do we give power to the individual, to the groups, the communities. So let me speak to the power tool. The power tool is what you give to the individual. Are you telling me my time is up? Is that what you are doing? So let me understand. No, I don't know. Like for me to, I'm not a comedian to transmit knowledge. I'm just, if we give power to that individual, the person becomes a repository of power. Then that person moves from powerlessness to having power, and then to be able to dispense meaningful obligations expected of him or her at the individual level. And a collective of those individuals will help the community. So, to interrogate it, we now need to go dive deeper. What are the sociological context of young people? Say in my village, no one appointment in Akwa Ibom State. It's different from that of my wife, Ibefu in Ogun State. What may work in Ibefu may not work in mine. Just because I look at their context, understand the sociology of that place, I look at the psychological impact or the way things are. If in my place, or if in a place, there is so much power dynamics and differential, that the one that has power is called master, and the one that is powerless, called the one that has power master. You know that to please the master becomes the objective of the powerless one, including if the master is an abuser. So this becomes an issue. Of course, economics. Yeah. Who has money? It was certainly in one of those years when we started our work, when we realized that a young person, the girl in school, the only way she could have money to buy a good meal at school was that in the compound where they live, there was a downfall driver that gave her money on a daily basis because the parents couldn't afford it. And what was it that she gave back to the man was that he became a sexual object. And she kept reporting her youth training in STI. and said, you need to bring your partner. And she said, no. So by the time we followed her, home, we realized that the problem was something else. So what do you do? The girl wants to go to school. It's a question of the parents cannot afford it. And the one who's willing to sponsor says, me, I will continue to invest so long as we do this. We need to understand that there are inequalities. How are we programming to respond to each and of those inequalities that we are identifying? Not doing that. We just come with one blanket program. We make some record some numbers, contraceptive prevalence, 10 minutes, my brother. I mean, this, how am I using this contraception or contraceptive method? So, if we do empowerment very well, it must be able to get the individual and the community to be connected. If the individual and the community are not connected, then it's not empowerment. We'll have activities, we'll have programs. Our budgets may be large. 5 years, we will record fantastic numbers. How do you not wonder? When I was being introduced, it's been mentioned that I convened since actually 2002. I've been convening on the continent, only by any sexual health rights meeting. And this year will be the first one in North Africa in my part. And for me, it was a breakthrough. To the end that we can have a handshake across the desert. Another. But what do I want to bring out? We need to go beyond rhetorics. Migration is, do you know the population of Nigerians are in Libya? In Morocco? I mean, I went to Morocco, I've been going there for years, but now I'm going with the lens of programming. And I realized that historically, Senegal and Morocco, you can go to the 2 countries without a sign. So you have the large Senegalese population. So whatever you are seeing in West Africa, in terms of SRH, we are seeing the Morocco. And then people are using it across to Spain, and so the problem is there. And when our people interact, we need to be very circumspect. Next slide. Now, how do you empower when you don't address enabling environment, talk of political will, and all the breakdowns around it? It is not enough to do political will without putting resources. We need to think around capacity enhancement. Giving you some thoughts on each of these ones. And then resources. And under resource community, will have under-resourced persons. Under-resourced persons are vulnerable persons. So you have vulnerable communities. When ICPD 20 was going to take place, International Conference on Population and Development, the 20th year meeting, UNFPA came up with a global document. And that document gave the percentage of housing in my country, especially in Lagos and advanced. It was shocking. You know, what are we going to do? Are we not having the same thing even in Abuja, in the US, and I having that country? You have the simple estate somewhere, but once you drive out of the estate, don't have a flat tire. Then, or don't allow your car to break down, then you know that you're in trouble. Next slide. Now, policies and laws, we have many. Our colleagues from the federal ministries, is health here, is youth and sports here, women and peers, education. Who is implementing? Do we ever evaluate the implementation of policies? We'll be told that every 5 years we must do policy review, another round of workshops, another round of. I was looking at the National Adoption Policy 19. So that is supposed to be 1995. Sorry about that. Right? It was only 7 pages. I'm looking in 2024, we have the 100 and something pages. Yet, Nigeria is the headquarters of all the SRHR problems of young people. More writing, less action. Up to accept, I have another country, I don't carry another passport. I'm not going to Japan. I'm here. So, what are we doing? When we want to do anything, let's be very serious. Let's do it well. We've done too many policies, we have all the laws. Thank God 1 or 2 states are taking sexual and gender-based violence very serious. You know, I always like to be Lagos. Don't make a mistake. The lady says to me, your wife says the gospel. They catch you. It's like, I'm telling you, there is no remedy. No remedy. Someone in the system was talking to me, said, make a mistake. And sentenced to life imprisonment, all kind of mistake. That mistake, that lady is a life mistake. Trauma for life, suicidal ideation, things that will happen. Yeah? So why look, forgiveness does not mean to punish. Forgiveness is to make you reconcile spiritually with your creator. Me, you raise your hand against the woman, you go. I hope they are not, where are the faith leaders here? Huh? If you are a faith leader, please let us let people know that violence is not acceptable. In the kingdom of God, there are violence. The kind of violence, what kind of violence is as a Nigerian police, we read these texts, we read them in colloquially. Why don't you go and punch Satan? Some people have seen Satan punch. You know, those things, I think we are not circumspect. Eh? Don't join this bandwagon, man. Marriage is not salvation. Relationship with God and relationship with fellow human beings is not written anywhere. After all, we became one, we stand on judgment day individually. Is that not? So what is it? Marriage is not a pathway to salvation. There are many things that we have, and whether you are Mr. or Miss or Mrs. or hybrid or no breed, it's my business. Yeah? So let's move ahead. So what are the gaps? There are plenty of, because even the ones that we are not implementing. Don't worry. I will leave. I think we are just so that Nigeria has a backlog. Nigeria has this, Nigeria has that. I want HIV and AIDS. What is the consensus around consent for testing, consent for services, consent for life? These are things we need to deal with. Disparities among states. So who is empowering internally displaced people? Migration from the Sahel to Nigeria. Poverty. If you don't address poverty, the hungry man is an angry man. The hungry person is an angry person. Conflicts. Sometimes land demarcation. Land that came to me that we live behind. Sometimes you want access to property. So there are too many issues. And therefore, when we are programming, even with we have blanket policies, can our programming be a bit more specific? But let's be very, very specific. And let's tell donors, IUSI, to anybody, don't come and tell us to do the impossible. Let us do what is practicable and reasonable at this point. I think by now, the slides should be over.
Yes.
So I give recommendations to the House. Thank you, everybody, for listening.
Another round of applause, please, for Dr. Was that really setting the tone of what? I think that, so just beyond that, it was, like you said, it was a lengthy presentation. The meat of it was really what was important. I think for most people who were in the room, it brought some kind of soberness because people started thinking, what are the issues? What are the key things we are overlooking in terms of numbers, looking at percentages? He challenged the religious leaders. We went into the holy books. What did we do? Thank you so much, Dr. Wemes here. So just for 5 minutes, we'll just, if there are something he said, something that triggered you have a question you just really want to ask, at this point, we'll take maybe just one or 1.5, or a comment, just a quick one that, as he spoke, you were triggered and you wanted to make a recommendation. Okay. Any in the room? Oh, thank you so much, Liz. So over there, please can the mic be passed on to her? Please introduce yourself, your organization that you're representing, and then you make your comment.
Okay, good morning, everyone. I told you, Lisa, I work with FHI research, and I'm a young person, and I'm happy to be here. And I want to really thank Dr. Owen for his presentation. It was a real, he brought us down to reality. It was a real reality check for all of us. And I really appreciate the presentation. He mentioned the gaps that young people face. But what I want to add to his presentation is, as we talk about young people, we have to also see young people as not just beneficiaries. The world has moved, the paradigm has shifted. Young people are now seen as active contributors, as leaders in our own right. So when we're developing sustainable solutions for young people, and he mentioned, the population of young people and how we can really harness the power of young people. The only way to do that is to engage young people actively as leaders. The term now is meaningful youth engagement. And I look around the hall, I see big caps, I see directors, I see program managers, but I can count the number of young people I see here. And I'm not sure that a lot of young people get the mic to speak for themselves. So I also want to stand on this presentation, bring us back to reality and challenge everyone. Young people are vibrant, we're creative, we're innovative, and we're leaders of today and also tomorrow as well. Thank you.
Thank you so much. It's so interesting. I told you we have beneficiary in the room, so everyone is represented. So I hope we've documented that. That is a charge from the Young Persons Committee. So thank you so much for your comment. A round of applause again to you. Okay, excellent. So whilst we were having the discussions, and we'll have much more sessions to have our voices heard and have these debates and interactions and make great-led resolutions. But whilst we were we're listening to the presentation from Dr. Owen, you might have been distracted by my saluting and gestures. I apologize for that, but I was trying to indicate that a very special guest came into the room, and he's none other than the Assistant Inspector General of Police, the Nigeria Police Force, Mr. Dr. Idowu Owuwa. Please, a round of applause for him. Excellent. So, unfortunately, he has several engagements today. His invitation came at a very, very, very short notice. But we're so excited that he honored us to be here. As you know, there's a lot going on in the country. So he has to attend to another meeting almost immediately. So we have a segment that was supposed to come later, but we'll have to move that forward. If you look at your agenda, move that forward so that he can be with us for just a shorter period before he leaves us. So I want to invite the assistant, the AIG Idowu Owuwa, to come up to this stage. And then I'd also call Dr. Bola Oyeledu. A round of applause, please. Come up to the stage as well. So we're doing something a little different, something that has not happened at our annual scientific roundtable series before. It's quite special to us what we're doing today because we know that in the environment we work in and then also in the country that we work in, leadership is very critical for the work that we do.
And I would like Dr. Owen.
Yeah, Dr. Owen, please come up for a round of applause, please. Sorry, sir. Excellent. And as I was saying, that leadership is very critical for us. So when we see men, when we see women who go against all odds, against what society is saying, against the status quo, against gender barriers, against the economic situations, and whenever they're in positions of influence, they're able to really change the dynamics to basically disrupt the system and make things really happen for the people that matter, especially for the vulnerable groups. It is only bidding and fitting that we are able to recognize them and acknowledge that work that they do, so that it's inspiring to others who are coming to say, yes, this is what I should be doing to change this dynamic. Dr. Idowu is not just a man in the police force. When CIP started working in Lagos, we started interacting. We knew that the police were critical stakeholders. And so interacting with him was just really, and Dr. Bola actually led the delegation that went to his office a couple of years ago. And he, on his own, initiated that there's a lot going on. He was looking at the data, so he's a man of science. He was looking at the data and seeing the number of gender-based violence survivors that have been coming through, that the cases that have been reported, and he looked at where he worked. He was the Lagos Commissioner for Police in Lagos State, and he looked at where he was. He saw what the how the unit was organized, and he saw that this was not going to be sufficient to deal with the cases they were receiving and appropriately respond to the gender-based violence of survivors, which constitutes the greater number of young persons, particularly women and young girls. And so he took the initiative to expand the gene of this to say that we need to collaborate. We need to collaborate with the right responders. We need to be able to advocate. But we came to advocate, and the advocacy was already done because AIG here took that initiative. And we thank you so much, sir. So we'll be giving. Yes, and we also need to. So again, pro bono, and not just that, we are seeking funding advocacies so that the legal term of things take its toll. So I'll just be reading the citation briefly, and then Dr. Bola Oyedele together with Dr. Wengesiyet will present for the first time at the annual scientific roundtable series organized by CIHP. We'll be presenting the leadership award. All right, so please cue, into Q2. Great, excellent. All right, so I'll just read that quickly. So AIG Idowu Owohunwa, apologies, sir, hails from Kaba, Kogi State, and was commissioned into the Nigerian Police Force as a cadet officer, course 19/1996, on 15 August 1996, after graduating with a second-class upper division degree from Ahmadu Bello University, Zaria. He emerged as the overall best graduating cadet officer in professional studies at the Police Academy in Kano. A Nigerian, USA, UK, Israel, and Italy trained police officer, AIG Idowu is a Shevling scholar who holds a master's degree in criminal justice studies and policing from the University of Leeds, United Kingdom, a study he undertook on British government Shevling scholarship. He also holds a diploma in national security studies from the Center for Strategic Studies, Galilee International Management Institute, Kibbutz Mizrah, Israel, and a certificate in terrorism financing investigation from the London Metropolitan Police. He additionally holds a diploma in cybercrime studies from the University of Virginia, the United States of America. A round of applause. AIG Idowu holds the enviable professional record of being the only officer in the history, you're making history, sir, of the Nigerian police to have been appointed and reappointed as the principal staff officer to 3 different inspector generals of police over a period of almost 6 years, having served in that capacity under Inspector General of Police Solomon Arasi, retired, Inspector General of Police Mohammed Abubakar Adamu, retired, and Inspector General of Police Usman Alkali Baba, the incumbent Inspector General of Police from where he was deployed as Commissioner of Police, Lagos State Command. It is with great honor that we would like to present the Leadership Award in recognition of the strategic leadership in expanding the gender-based violence response during your tenure as Commissioner of Police in Lagos State. A round of applause.
Thank you very much, sir. Yeah, Chief, and I think on behalf of not just the IHU, I think partners, the government of Nigeria, but most especially people, women, men who are actually the survivors, who are and also the under the tip of their iceberg, the ones we've not been able to see, because the ones we see for every case that we see, we know at least 20 or more go unreported. You have, in the interaction with Lagos State, you not only expanded the desk, you actually identified the center, you galvanized partners to come together to make sure that the status quo, in terms of making sure that the Nigerian police force really becomes the forefront in terms of not just identifying, but also linking, because they are the primary people that when violence occurs, they are the ones that the survivors will go to, and it is their response, that first responder, that process that actually helps to decide or to determine the overall outcome. And when that first responder interaction is very poor, we have seen very, very adverse effects. So for us, what actually gives us more pleasure is the fact that as a man, you took this upon yourself to just say you need to change the status quo. And you did not just say it in words, you did that in action. And looking at a time in Nigeria where we really need to see more people, especially in government, take on this leadership, not just in terms of saying it in words, but really by action to say that we can change the status quo. And as I always say, it takes the power of one to make that happen. So thank you for being that one, and we expect this to be replicated across the entire police force in Nigeria. Thank you.
Well, I think Nigerians need to see this. Are you proud as a woman that this man is being? Proud as a Nigerian man. The people for shoes. You know, Dr. Bonnet, I was congratulating you. Identify how did you, your team, decide that you should have this? I think we should have also invited the leadership of the Nigerian Police Force, the Police Service Commission, and the Ministry of Police Affairs. Because this is unique, is historical, and is watershed for all of us. It is possible. The agency of each person, whether male or female, respected. This is so I will so Nigerian police getting this only from civil society. Because we are very practical. When we see one policeman making a mistake, we forget that the police force makes. Thank you so much. Listen. But I know that this is not good. This one that we are recognizing is the beginning of greater things, right? Our nation, and therefore, please can we rise together to honor him?
So in recognition of your strategic leadership in expanding the gender-based violence response during your tenure as Commissioner of Lagos, or Commissioner of Police in Lagos State, on behalf of all the women of this country, supported by the men, we want to say thank you. Keep that behind the line.
Thank you so much. So just pause for some pictures. Very important to mark this. Thank you so much. Joining them is Dr. Salami Bose, the Assistant Commissioner of Police in Lagos State. We'll be calling Dr. Fatima Jibrila, who's representing the Special Advisor on Health. We're inviting the representative from WHO, Dr. Prosper, please come to the podium. Representatives of the Director General, NACA is on the stage as well. Dr. Sharon Wiseman from the University of South Carolina. Reverend Sean. From FHI 360, Ms. Adobe, and the AP representative, Mr. Aaron Sunday's representative. Please come forward. Thank you so much. Please let us know, press and photographers, when you have your images. From my experience, you never have enough, so we just go that some point. So, thank you so much. A round of applause. So we'd like to invite, with a round of applause, as we welcome to the podium, the Assistant Inspector General, Medical Nigeria Police Force, Idowu Owowa. Please, can you pronounce your name correctly? I'm sure I'm messing it up. Okay, sir. All right, so please, thank you so much.
Thank you very much. First, for the time schedule. As mentioned, I got the invite quite late, and but I take responsibility still because perhaps I've adjusted my program a bit different. So I truly apologize for coming in late. I'm truly humbled and shocked by the recognition. It was the least I would say I expected. But there are two issues. The first is that no matter how strong, how well-intentioned your vision will be, if you do not have assets to assist you in translating into reality, I think it remains illusionary. So I'm glad to start with to see Dr. Bose Salami here. She was my head of medical in Lagos, and in conceptualizing the entire dream, in translating it into reality, she was pivotal. So I want to especially recognize that and want to believe that this is a shared recognition for us. And my pride is even more raised somehow because when I exited Lagos, you still stood to them and represented me well enough to make sure that the center we are trying to set up remains on stream. So I'm very grateful, and I'm looking forward to the commissioning of that center very soon. Secondly, nothing can be more motivational than or a space you have operated in, people that have acted within that space, to recognize your little impact and then publicly comment you in this manner. I'm so inspired, I'm so motivated, and I thank the organizers of this program. Looking at following the presentation, I followed an aspect where the presenter touched on gaps. And I was waiting for him to see those gaps. I think the most critical gap in the process got to do with law enforcement. You may put on laws, you may put on policies, if the law enforcement component is not strong, if they do not have the capacity to understand the depth of the problem, I doubt if we can find a sustainable solution. So I want to challenge us, Doctor, you have been very fantastic in supporting us. Please don't extend your advocacy, your support program to the entire police family. It can start off from the position of the IG. Let the system, the leadership of the force acknowledge that this is a potent problem in this country. So that together at that strategic level, what we did in Lagos can be replicated at the national level of policing. In the process, if you need me, I promise I will support that initiative. I want to thank you for this recognition. It means a lot to me. I've been privileged to win several awards. This one is quite special to me, and it will remain so all through my career. God bless you.
Please a round of applause again for AIG Berlin and take the lead. I'm really grateful. We really appreciate that you could take time to be here. Thank you so much, sir. All right, so we'll get on with the we'll get on with the rest of the leadership awards later during the event. Like I said, this was just to accommodate the AIG who so graciously honored us by being here and has to be at another event and representing the country at this time. So we'll get on with our schedule. I know it's been a stretch. Very soon we'll be going for our tea break. So we'll just have 2 more presentations and then we'll head for tea. But before that, I wanted to do some housekeeping. First, if you're trying to locate the loo, it's in a very strategic part of the hall. One that most people might decide to hold their pee for a longer time because it would mean them walking to the front and everybody seeing them and wondering, what are they going to do in there? Well, please, you have to be bold, all right? So it's on my left-hand corner, okay, and then just right there, the last person who walked in, never mind, is gone in there to do business, okay? So, great, so that's where that is. But if you are comfortable with that, you can also exit the building. And then this is also a hotel, so you can walk into the main lobby, and then you can see you have access to that as well. Thank you so much. And then also when it's time for we have our Muslim community here, and they usually have some prayers somewhere in the afternoon. There's a mosque just by when you step outside and go towards my left-hand side, you see a mosque there. There are also facilities for your regular activities before your prayers. So that's over there too for that. So thank you so much. So we're going to move forward to the next presentation before tea break. So I'm just going to move on with the next one, and it's on insights from adolescence-focused programming in the United States. Insights from adolescence. So we've listened to Dr. Webb has really taken us into the situation in Nigeria. It was something that we really wanted to see, to say, what is the situation somewhere else? We're going to hear and see, is it different? Is it same? Is there something about it, or is it the same difference? All right, great. So we're going to welcome Alisa Robillard, as well as Reverend Sean to give a presentation. So Dr. Alisa Robillard is an associate professor in the Center for Health Promotion and Disease Prevention at the Edson College of Nursing and Health Innovation at Arizona State University. Her research involves innovative and community-engaged approaches to promote health and health behavior across the HIV care continuum for women, youth, and individuals involved in adjustment and working in the HIV field. She's currently examining storytelling in prevention and care with a focus on Black women and older adults with HIV. Dr. Robillard is the board chair emeritus of PALS Incorporated, board of directors, and currently serves in the role of secretary. She received her PhD in health education and health promotion from the University of Alabama at Birmingham School of Public Health. Make welcome Dr. Alyssa Robillard. Also introducing Reverend Sean Torres Anderson. He is a Philadelphia native born in 1991. That's interesting, okay? As a distinguished graduate of the Philadelphia Military Academy and Benedict College, where he earned a bachelor's degree in child and family development. An ordained minister, he was licensed to preach in 2010 and has been a fervent advocate for social justice, actively working to dismantle systemic inequalities within the Black community. With a Master's of Divinity from Union Theological Seminary, his academic focus lies at the crossroads of spirituality and sexuality. Sean's professional journey in public health spans a decade, notably impacting 8 service organizations. He's currently pursuing a doctor of ministry at United Theological Seminary and a doctorate in public health administration, while serving as the board chair of PALS Incorporated. Make welcome Reverend Sean Torres Anderson. All right, thank you. So we have the presentation. Next slide, please.
Right, good morning. Yes, good morning, everyone. Thank you. I want to thank CIHP for the opportunity to be here, for PALS to come here. It's been a wonderful experience. That was a difficult act to follow. But I just wanted to say that I think that this model is one that should not only be replicated across Nigeria, but really across the world. It's a model that I think is so necessary. Yes, so I am Alyssa Robillard. This is Reverend Sean. And we represent the board of PALS. I think Sean will speak a little bit more about the board. We have today members of PALS, the contingent from PALS, that includes Carmen Julius, our CEO, Sarah McClaren, who is a program manager for care coordination, Mr. Alton Kyle, who is the program coordinator for Hope Housing Program, and Jonathan Julius, who is the honeydew bag carrier in +1 for our CEO. So today we want to just briefly touch on a few things, provide an introduction, talk about some of the challenges that sound very similar to those that have been mentioned thus far. Excuse me. We want to talk also a little bit about the adolescent focus programs from the work that PALS is doing in this area, some of the challenges that we face, but also some of our strategies for success. And then summarizing key points. This picture represents some of the staff along with the mobile medical unit. Along with the mobile medical unit that PALS has, which allows us a greater outreach. We're very proud of it, very, very proud of it. So PALS actually provides a number of services We talked about it as a one-stop shop, visited a one-stop shop on yesterday. And we talk about it as being a full service organization. And here are quite a number of services that are intended to be holistic, to reach out to the whole person and, you know, not just provide care around education, prevention, care around HIV, STI, HPNC, counseling and testing, but also things like you know, access to a food pantry so that people have food. Those basic needs are met. Housing is provided. Behavioral health counseling or mental health services. Critically important, especially when they align with you know, the key populations or the priority populations that are in need of those services. House provides primary medical care and pharmacy needs, but also budgeting, money management, and credit repair services, which I think sometimes are things we don't think about when it comes to financial, those determinants are really important to help support the whole person. Case management is also provided, and transportation, which in a you know, urban, rural, and peri-urban you know, state, transportation becomes really important for making sure that individuals can access care.
Good morning, everyone. So just a little bit about house and where we're located. Someone asked me yesterday, what is the difference between Columbia, South Carolina, and South Carolina? Columbia is the state, is the capital of the state of South Carolina. And South Carolina is located along the Atlantic Ocean, which is the same Atlantic Ocean that Nigeria borders, right? So we see the connection between where we're located currently and where we're from. So we're thinking about cows and we're thinking about young people in general. We know that there are 333 million folks who live in the United States. 42 million of them are adolescents, and which make up 13% of the United States population. However, 19% of all HIV cases are of folks between the ages of 13 and 24, which speaks around our need to provide services in the state of South Carolina and across the nation for adolescent folks. So PALS historically was founded almost 40 years ago as an AIDS service organization, the first one in the state of South Carolina. And provided a diverse and an array of services to all persons in the state of South Carolina. We have a staff strength of about 44 folks, and then we also have a board which comprises of 9 people. Myself as the board chair, Dr. Otis Robillard as our board secretary. But all of our board members have some impact within the work we do at times. Providing optometry, providing dental services to people living with HIV. Some of our key statistics. So adolescents between the ages of 13 to 24, 1 out of 4 people newly diagnosed with HIV in the state of South Carolina are under the age of 25. 46% of sexually active high school students reported not using condoms the first time they engaged in sexual activity. Adolescents accounted for 67% of chlamydia cases and 53% of gonorrhea cases within the state of South Carolina. And over 56% of South Carolina counties exceed the national rates of STIs, which correlates with higher HIV risk for young people.
So when we think about some of the challenges associated with, you know, the overall well-being and HIV prevention for prevention and care for adolescents and young adults, 13 to 24 years of age, we know the stigma is tremendous. It's it's difficult. Difficult is an understatement. Stigma stigma stands in the way of seeking services and stand in the way of people getting care. And if it's difficult for a full-grown, mature adult, imagine how difficult it is for you. We found that a lack of transportation is also a significant barrier to care. If you can't get there, you can't get care. And so, transportation is another barrier. I think many of us can look back and think about when we were adolescents, and we know that it's a difficult time. It was difficult then. Imagine how much more difficult it is for you today. And when there aren't services available to speak to the needs of you, like that aren't welcoming, open, friendly, and there are provider biases that are embedded within those systems that provide care, that also stands at a significant barrier. In South Carolina is also it's a conservative landscape in terms of morally conservative, politically conservative, and because of that, that does a lot. Adversity does a lot, but it also stands in the way of comprehensive health, sex education in schools. It's not the comprehensive part is not provided. And so because of that, PALS has to access or try to educate, provide services for you after hours or on weekends. And one of the ways we do that is through our late night events, after hours events that occur on Tuesdays and Thursdays in the evening and on Saturdays when youth and others can access them for at least. Lack of these trusted adult support systems that can include parents, but may not always include parents because you don't feel necessarily talking to parents, but those trusted adults are very necessary. And then because of higher rates of STIs and alcohol drug use, that contributes to the higher rates.
So, I really appreciate the last presenter talking about how our programming ought to respond to the individual needs of our communities, because that's what PALS does. We have implemented programming to respond to the needs of our young people. So I currently serve as the board chair, but at one time I was a client at PALS. So I received some of these interventions, and then I became an employee of PALS. So I implemented some of these interventions. And as the board chair, I get to see the results of the current staff members employing these interventions in PALS. So when I was a staff member, this is one of the interventions that I implemented that is currently in use today. So it was our trade department that used Proud, Responsible, Educated Youth was the name of our program. So what this is, what is focused on young people between the ages of 11 and 14. We used evidence-based intervention called Making Proud Choices. And then it was community-based after-school programming and summer camp. Because as Dr. Alyssa said, most of the schools were not allowing us to come in during the day because of things that are happening in the environment. So we have to be creative and when we were able to access these young people. So we did it through the summer camps and we did them in the after-school program. So our Making Proud Choices curriculum had all of these topics, but what was significant to us is we were able to see 350 participants in the summer and provide this particular curriculum to them. Out of those 350 individuals, 100 of them were participants that took a pre and post test to gauge their knowledge before the intervention and after the intervention. And some of the outcomes of this were 80% increased negotiation skills, around condom use and safer sex practices. 85% of them increased knowledge of HIV, STIs, and pregnancy prevention, and 85% increased their confidence and their ability to make responsible health decisions. So we thought that this was important. So these classes addressed the higher rates of teen pregnancy and STI infection rates within the state of South Carolina, which also speaks to HIV infection rates as well. So when we implemented this particular intervention, some of the topics were getting to know you and the steps to making your dreams come true, the consequences of sex, which can be STI and HIV infection, attitudes around sex, HIV, and condom use, strategies for preventing HIV infection, so stop, think, and act, the consequences of sex, the consequences of sex, either STIs and pregnancy, developing condom use and negotiation skills, but also enhancing refusal and negotiation skills as well. And then we had another intervention, which is called RISE, which stands for Risk Reduction through Innovation Screening and Treatment in Education. And as a recipient of services, I was able to receive these. So some of them were intervention for college age youth. So I'm still an adolescent, so I still identify as an adolescent, as a person who is 33 years old. But when I came in contact with Power, I was 18. I moved from Philadelphia to South Carolina for undergrad, and then you get to connect to services. One of the things POWS does is you become a client once you access any of the services, and then you're able to utilize all of the services in-house. So you come in as a testing client, and then you're able to access the food pantry, transportation services, and other services that POWS provides. So this is how we're able to capture our young people, because they come in for one service, and then we're able to introduce them to other services in-house that they may need. So intervention for college age youth, education to reduce HIV and substance use, HIV, STI, and Hep C testing. We go substance use screening, behavioral health counseling, linkage to care and referral services. This is where the department that I worked in when I was at POWS. So when I worked at POWS, I inherited a caseload in the linkage department of 7 individuals who were living with HIV. Out of 7 individuals with HIV, half of them were adolescents or college age students, right? So it became difficult because as a recent college grad who was working with college age people who I went to college with, I had to separate myself as someone who knew them and operate in the realm of a professional to provide competent, efficient, and ethical care to these young people who I once were in relationship with as a coworker in school. And then also HIV, STI, and substance misuse prevention education.
So RISE is a project that is still going on. And it operates in partnership. Partnerships are important, critically important to accomplish the goal. It's pooling not just expertise and resources, but it's also pulling together entities that might have different missions, different goals, different perspectives, to try to bring them together around the shared goal of reducing risk and supporting youth. RISE focuses on, as Shaw said, top college students, and so the partnerships exist with several HBCUs, historically Black colleges and universities, including these, as well as the Technical College and Job Corps, which is a residential career program. Individuals that have had some difficult present challenges. Yes, the partnership. And so RISE has implemented several evidence-based curricula, including basics, which is a brief alcohol screening in college students, curriculum, voices, and so you can see that after we touch quite a number of you can provide education, and we
resources. In addition, HIV and cholera awareness training is a significant piece of RISE, which focuses on, helping to bring those other entities that might not have those shared perspectives to the table so that they align, and that includes focusing on college administrators and college campus safety officers who have completed this training. Yes, I think the hope is also to include local law enforcement officers in that training. Because as we've learned, they're very important to supporting you and can be very important to making life difficult. Strategies for success. We make use of peer educators.
So when I came to House, I was a peer navigator. So someone who was a part of the community, engaged in the community to make better health decisions, which led to better health outcomes. And then we talking about training providers for youth-friendly care. So as someone who worked for the US CDC, I helped to create public health curriculum that is used across the country for HIV and AIDS organizations, which train staff members and other outside organizations to provide competent care to the clients they serve, which also included our youth. So as Dr. Alyssa said, the last slide, 3MB was an intervention that focused on youth and young adults that I was the recipient of and someone who trained that curriculum, and then also trained public health providers in the US to implement that curriculum. But also Voices was a video-based intervention for young people as well. And then we're talking about parental engagement and support systems. One of the things that we do now is we have collaborations with faith-based organizations within the state of South Carolina that help to provide some of these services to their youth groups. So Sarah McClam and the work that she does at her church helps to provide classes and support groups and cyclical support for parents to engage their children or their youth workers within their religious spaces.
In addition, providing those mental health services, making sure, as I said before, that they align with the needs of youth and young adults. Stigma reduction programs are incredibly important, and as are efforts within the agency, within and outside of the agency to respond to stigma, reduce stigma, make sure that there are safe spaces within the organization, and partner with others that are providing safe spaces. Stakeholder buy-in is also very important. I wanted to encourage and comment on the young persons who had the comment about making sure that there are and young adults that can take that is so very necessary. As public health folks, we also talk about problems within communities, and we have to also recognize that the solutions are there as well. And so, I do want to encourage you and others to make sure you're at the table, you have to know when you get there, or create your own table. And also community coalitions, again, incredibly important community partnerships. I think it was said, we can't do this by ourselves. Neither one of the entities represented here can do this work by ourselves. And so working together through coalitions are important. And then being mindful of the holistic approach, which PALS try to do with the myriad of services that we offer.
Some of our summary of key points. One of the things Dr. Alyssa just said is that we can't do this by ourselves. PALS does not operate in a vacuum. We need the support of our stakeholders. We also need the support of you all as well, even across different hemispheres, right? So some of what our key summaries look like, adolescent and young adult account for a significant portion of HIV diagnoses within South Carolina and within the United States. stigma and discrimination can prevent adolescents and youth from accessing prevention and care services. So when we're talking about faith leaders and some of the biases or irresponsible religious dogmas that religious leaders hold as it relates to sex, sexuality, that's some of the things that we're coming up against. Because we realize that we talk about young people as if they're half a person because they're young, but young people are full people who have agency over their bodies, their decisions, right? So how do we as folks who are a little older reduce our stigma and discrimination towards young people to recognize that they are full people and are worthy to be at these tables. We think about barriers to care, such as lack of transportation, financial constraints, and limited youth-friendly services hinder access to healthcare. So that's a similarity that exists within the United States and here in Nigeria, as we have been hearing.
And one of the things we do is to offer incentives for youth. You know, sometimes it takes a little something to help people, you know, get into the space to receive care. And so we have incorporated incentives, you know, and you know, incentives look different. They have to look different in different spaces. And so, you know, thinking creatively about perhaps how to, in some small way, incentivize you to engage is something that can be a successful strategy. More comprehensive sex ed is needed, and also consideration, acknowledgement, incorporation within our approaches of socioeconomic or you know, those broader determinants. We have to think about them. If they're very necessary, they have to the extent that we can be addressed in order for us to you know, end the epidemic.
And I think the last thing I'll say is our impact for young people is expansive, not just us, but everyone. I'm moving out of public health and moving as an educator. So I'll be teaching middle school starting next month. So I'll have 60 11-year-olds, right? But that is still a part of prevention work. How I show up as a human or as an adult in their lives is important for their health outcomes as well. And
lastly, we just wanted to share this photo of some familiar faces that you might see there when CIHP came to visit us. Thank you.
Thank you. So now to Lisa and Richard. Around the globe. Excellent. So I think the verdict is in. There are a myriad of similarities between what we're seeing in these parts of the world and then also from the United States. And so that's why it's very important that those cross learnings are shared, and then we have a platform like that to do this so that we know what we can leverage across the different populations. So excellent. So good. So the good thing about being a master of ceremonies is that you can pick the agenda and say things need to really change very quickly. So with the approval of my boss, at this point, and I know it's a shared decision by all of us, we'd like to pause on the next presentation, and then just after a quick interactive session, leveraging technology, and I'll be calling a young person to do that as well, before we transition to lunch. Some of us, sorry, before we transition to tea break, apologies. So something is wrong. That means of all of you here, might be the most interested in food. So we'll be transitioning to tea break just shortly. So I'll be calling on a young lady, just someone who the FHI lady would also identify with it. Ms. Kamala Oloroda, to take us through something interesting that we just do before we head out to lunch. But before we do that, whilst all those conversations were going on, there are some people who walked into the room that I would like to quickly acknowledge. And representing the executive director from Lisdell, there's Adegu Iwa Damilola. Please, a round of applause for him. Please, thank you so much. In the room, Plan International Nigeria, representing Dr. Charles Lucy, Dr. Aisha Araba. Thank you so much. Yeah, okay, and then other organizations that I'll mention as we move forward. So yeah, so let's welcome Ms. Pamela Olurda.
Good morning, everyone. It's good to be here. So we're going to do something really quick, and it's a very short survey. It's fun, actually. So it's called Mentimeter Survey. And we all have our phones here. We have our mobile devices, laptop, iPad, tablet, whichever one we have. So please, if you look at this agenda, you see a QR code. A QR code. So what you simply do is to scan it. Is to scan it. Okay, for those of us that will not be able to scan, the code is 45. Okay. Oh, sorry, please. For those of us that do not now, I will not be able to scan. Please go on your browser, type Menti to 5661. 46525661. So just fill in the response. Fill in your responses, type in your responses. We already have been some answers coming in. What key skill should an adolescent in Nigeria have for a sustainable future? What key skill is that? So keep your responses coming. We can see the responses coming. Some say technology. Another person is saying financial skill, life skills, okay, enterprise, okay. You see, say no, no. Problem solving, that is coming out boldly. So please keep the responses coming. We have resilience. Wow. Vocational, okay, that's vocational skill. We have math, interesting. Okay, friendly services, okay. I think that really applies to your especially the responses are coming in. Negotiations, emotional intelligence. Entrepreneurship, okay. Okay. Responses keep coming. You can still make your vote, can still send in your response. So if you're not there yet, the code is displayed on the screen: 46525661. Be happy. Attractiveness. Great. All right, thank you. And continue to send in your responses. All right.
Thank you so much. A lot of applause for Ms. Pamela. Great. So you can see the word cloud. Please don't take it up too quickly. You can see the word cloud that has been formed, right? And you can the bolder it is, it means that we have more responses, more people thinking like that. So what you're seeing is probably what we should be really thinking about. You can see things like technology is really at the center of it. So it should be a focus. Resilience, I think we all need it, both the young person, the adolescents, and even the older people. In fact, the world we live in today, we must be resilient. Vocational, life skills, communication, because sometimes just knowing you have an issue and then being able to let that out or let, Dr. Wayne talked about disclosure, etc. Very critical. So this is going to be something you're going to see come out in our newsletters. We're going to share this online so that you can remember that whilst we're in this room, these were our initial thoughts, and these were thoughts whilst fasting. So we can also remember that as well. So all our thoughts were on this at the same time. So I really want to thank everyone up to this point. I want to let everyone know, if you look around, virtually every seat is occupied, and you made that possible. So I want to really thank you for being here. What this means is that virtually everybody we invited is represented here. And we want to thank you, your CEOs, your country directors, but it's not over yet. This is just the first session, all right? One of the good things that CIP does well is that we have a very high retention of our clients on treatment. And we intend to keep to that even with our visitors and our guests right here. So we'll be tracking you. We know we have all estimates, we'll be ensure that there's no interruption to treatment for those of us here. So thank you so much. We'll head over to lunch. Lunch is at pray for me, okay? It's tea break, okay? So we're going over to the garden. So please, we're going to walk up to the beautiful garden with very green grass. As you know, we're in the rain. So we just go straight out and then we'll have our ushers to direct you. And it's a time to bond, network, interact, and form those collaborations and partnerships as well. So we'll just head out just for about 20 minutes. So we're back for the next session. Yes. Again, remember, now that we're going to be leaving the room, the access to the loo is better. All right. So it's right to the front, but now we're all going out so you can all have access now. And then, like I said, if you want to use the one inside the hotel, that's also available for more privacy. Thank you so much and see you in 20 minutes. All right. Thank you so much. Yeah. Cue music. Thank you so much.
No more editing. No more editing. I just want editing. I just want editing. What I was not around today. I just made like that. No. Because I always use the extension. It's like yeah. So when I extended here, the one that was so when I click on that, the next time this picture of the screen. It's okay. We only if you don't look at the don't make mistakes. The problem is like that's why I don't like surprise. That's why I pay she's not that big. That's my I believe my parents, she's not that big. She's here. She's not that big. So that's why I think that not because of something that's showing and fire. But you'll get to the my issue with this, so I didn't even practice it. So it's like there's little lag. There's no lag. So I was doing no lag. I'm doing, and then I was saying, okay, we did not give them. We did not give. You know what I mean? When we're here starting one. So that been good for me to because some of these things. So I don't mind some of them to like just for this thing. And then they tell you point to the system. So they say point to the screen. This one point to the screen. This is not like this one. It's very sensitive. Anyway. So sometimes I was pushing it, but sometimes it takes me to practice. But it doesn't want to. Then when I was not presenting, there was a lot going on. So that was I knew what you were doing, right? I didn't want to. I knew what you were doing. But the thing is that, but if you had allowed us that 30 seconds without saying anything, stop that. No, what I just, that's what I'm saying. One day, I think God puts you that much. Don't think that because I've done this about me. It's a different kind of thing. I thought that too, job is that I'm working. So that's my sharpest self. So something that you don't really like, sharp like life, maybe distracted.
So consciousness, you understand? Consciousness of what you're
And I'm still saying, please type on the chat.
Dr. Jerry? All right, thank you so much. As we settle down. All right, thank you so much. We also want to okay. Switching. I have an innovative way to get our attention. So I think it's good. So we're going to adapt something, perhaps from the United States. So can we settle down? Great. If you can hear me, clap once. You can hear me, clap twice. If you can hear me, clap 3 times. Excellent. Good. I guess that worked. Welcome back from tea break. I hope it was good. Trust me, I will be mentioning the L word until it's time. Okay? Because now I'm good. All right, so thank you so much. So we'll just get on with our program. But before that, we want to acknowledge we have a very vibrant online audience. So I know we're here in the room, but we have people joining us on Zoom, over 30 persons. And I just wanted to acknowledge some of them. Thank you, Stephen Adache, Daniel Estienne, Cheryl, Dr. Funke Lawson from Zantley is online. Thank you so much, Mark, for joining. Joffrey, Mr. Gabriel, Emmanuel, Marcelo, Echiku, thank you for joining. Ucheo KD, thank you so much for joining. Ucheo KD. Thank you, all the people who for joining. Obona, Roda Bello, this is Tolu Ario, Teso Ibado. Thank you so much, online participants, and then we'll get to you. If you have any questions, please put it on the chat box. You can also put up your organization that you're representing, and we'll acknowledge you appropriately. Thank you so very much. Yes. Okay, so we'll move on to the next session. I'd like to call on our next speaker. And the person of Mrs. Adeoluwa Akinlalu. Mrs. Adeoluwa Akinlalu. So please, a round of applause as she comes forward. Taking CIP experience, empowering young girls, the STEM Hub for Empowerment of Young Women. So Ms. Adeoluwa is a program coordinator of the Center for Integrated Health Program STEM Hub in Ikeja, Lagos State. She plans, implements, and oversees all activities and initiatives aimed at empowering girls in the hub. Adeoluwa creates and maintains a supportive and enriching environment for girls to explore and excel in STEM fields. She has excellent organization and communication skills. She has a master's in geology and has worked with adults and girls for over 7 years. She possesses the drive to see them grow and focus on their chosen fields. Ladies and gentlemen, welcome Mrs. Adeoluwa Akinlalu.
Taking us on CIHP's experience with AYP program. For this presentation, we'll be talking about the various AYP interventions, the SHE setup and processes up to date, as well as our next steps. I'm interested in adolescent girls and young women because about 51% of our OPC beneficiaries, they fall within this demographic, and they are prone to new HIV infections and gender-based violence and other social vices. This is our programs for under CBC and treatment policy programs. We have our OTC, where we encourage our adolescents to have zero disappointment, zero means drugs, and zero violence. We also do the no means no, where we train our adolescents to emphasize on the need to be assertive when they are not comfortable with sexual relationships. We also have family matters where we empower, where we foster parents to children, where we foster parents to children talks on sexuality and various background supports. Also for our young and adolescent persons, we have our All for Them. This is CIP's innovation for Cool Girls and She. So for She, how did we get here? As about this time last year, we had brainstorming and conceptualization of this vision for the STEM Hub for the adolescent girls and young women, and with support of our partners from University of South Carolina. We pitched in our approvals with CDC, and by September, we got the approval to begin the STEM Hub. And we started the first cohort of that same September, and until date, the hub is still running. We have digital library so that it's not going to just STEM. We also encourage our girls to have basic reading habits and basic reading skills. And to this effect, we have donations from all CIP staffs across the country, as well as our partners from the University of Carolina. Even as we're coming for this visit, they still brought more books for us. So if you are here and you have books that our adolescents can read, we are still expecting more books. We have places where we can keep them, and we're also encouraging our girls to have a good reading culture. When the program started, some of our girls from the first cohort, there was a number of dropouts because where they were living were far from the center. So we have to collaborate with Mary's Home to accommodate some of them to provide increase access to She. The basic courses we offer are basic coding, digital creation, tech engineering, and we also offer other referral supports like financial literacy, mental health support, and life skills. We also have mentors who are young persons, female with background in STEM, who are industry professionals as well as entrepreneurs, to come in, talk to our girls, mentor them such in their chosen fields and as they go in the career. We also our massive learning. We don't do all work and no play. This is where our book reviews come in. All the books that we are getting at the hub. We have a reading time where we impart the skills. We also engage in sports, music, and the likes. We see IHP as privilege of partnership with South Carolina and Action International as academic partners, and also blue chip industries. She Codes Africa, where we are looking at empowering our girls and partnering with them for internship support for our adolescents. And so far, we are going what are our results. From our pilot cohort, we started in September 2023 with 30 girls, and from January 2024 with 60 girls. We have seen that our girls have 80% completion rates. Also at the hub, we support our enrollees with the Harvard prep, and all of them are screened for mental health. And out of them, about 50% of them receive mental health support for depression, PSTD, and anxiety. This is a self-reported challenge. In the past 3 years, that CIP has been working with adolescents and young people. Through our programs, we can see that 45% of them have reduced rate of vulnerability. So this has shown us that the impact of our program is actually helping to reduce the vulnerabilities that were discovered in these adolescents. It has reduced their vulnerability to a great measure. Learning outcomes. These designs are some of the flyers made by the beneficiaries. And I can tell you that some of these skills, they don't have smartphones. But when it comes to the hub, we introduce them to personal computers, doing basic computer basic classes, and some of them were able to come up with amazing designs, and they are growing in their digital skills.
A documentary is still coming where you see the works of some of these girls put together by our communications team. So it's I'm able to impact the life of our adolescent girls in Lagos through these innovative approaches. We don't do this without getting feedback from our people, beneficiaries, parents, and even our donors. We hosted the donors in March 2024, earlier this year, where one of the US senators, Senator Korebuka, was also at the hub, saying what we do, and they were impressive with our results. These are represented from our CPOs and our beneficiaries are also giving good testimonies about how the hub has been able to help them in their life skills, mental health, and other background supports that we are providing. These are our stories from some of our beneficiaries. The communications team is going to come up with the documentary to show you much later. And how has this thing helped us? What have we used? We know that there is nothing for us without us. We need ourselves to work together. The girls need us, and as much as they are there getting support from us, we are also learning from them. Like Dr. Uwem said earlier, we are helping them, and they're also teaching us better ways to shaping up these programs and approaches to them. Distance is not always a barrier. We have virtual learnings where our mentors come in, and even during this protest time, we have online classes from our beneficiaries such that we are improving their own skills to do online classes and perform online, do online interviews and all that. It's a full-time commitment, but you can say the reward on investment is highly amazing and rewarding. And what does she need from you? Why are we here? We need it because through these measures and through these stakeholders meeting, we look out for internship support for our girls. Some of our girls, they have these skills, but we need them to have hands-on, practical, real-life experiences. And this is where you come in to collaborate with us. We also need you as mentors in the industry and as trainers across all STEM-related disciplines. CIHP is gender inclusive and gender transformative, and I'm sure we have been asking where are the boys. We also have a Young Achievers program for the boys in Mushin, where they also have their own mentorship programs. They teach them on coding. The Young Achievers program is multidimensional, not like the STEM of SHIP. This has vocational trainings with it as well. Now, what are our next steps? Looking at the future, we are expanding the STEM hub in Lagos. We are also looking to have a boys hub in Kogi State, as well as a SHIP center on Lagos Island, because some of our girls who are on the island want to give them equal privilege to be able to have access to these learning opportunities. And this is just the beginning. Thank you for this.
Can we make the round of applause a little louder? Oh, wow. Don't leave so quickly. This is just a young lady who is just working together with her team and motivating the young girls to do what you see here. And that presentation she did, our slide so beautiful. And putting that together, working with the team and so interactive, I'm sold. I'm sure a lot of you here are also sold as well. So well done. Another round of applause for her. Very well done. We'll have an opportunity to hear more when we're having interactive sessions. But again, she will also be available during other breaks so that you can interact with her better to understand some of what's happening at the SHE. And when she mentioned to give an opportunity to those on the island in Lagos, I'm sure we heard Dr. Owen say that no matter where you think you are, the states, the Lagos Island, those vulnerable populations still exist. There are pockets, in that island, there are slums, urban slums, and people that are deep in a lot of intersecting vulnerability. Some is just so terrible. And so those are our target groups, even in those areas that seem to be more urban. So that's quite interesting. So thank you so very much for that. We'll be calling on our next presenter to talk about one of our innovations in reaching young persons across our program areas, the states that we work. So I'll be introducing the next presenter, and that is Dr. Dorcas Magba. I don't ever get it right. Initially, I thought she was from Mexico, but apparently I was told she was indigenous from Nigeria and from the West. She's the Associate Director, AP3 CIHP, her profile, please. So Dr. Dorcas Magadelo serves as the Associate Director, AP3 of the PEP funded CDC project, IRIS, working out of CIHP's country office in Abuja, Nigeria. She's devoted to public health and health promotion, and Dr. Dorcas has spent the past decade working on 2 USAID and 3 CDC-funded HIV projects in Nigeria, receiving multiple team commendations from donors, stakeholders, and government of Nigeria alike, while contributing to the rapid scale-up in ART treatment coverage in Nigeria. Skilled in HIV care and treatment service delivery, program management, and health-related communications. She holds a master's degree in public health from the University of Wolverhampton and several professional certifications from the University of Washington. A female leader in a challenging role, she remains a U champion, a gender champion, and is committed to closing the treatment gap for children, adults, and girls, and young women everywhere. Ladies and gentlemen, welcome, welcome. Martha Theus. Yeah, she'll pronounce her name herself. Oh, yeah.
Hi, good afternoon, everyone, and thank you for the honor and the opportunity to talk about the work that we do at CIHP. It's an old Chinese proverb that says, may you live in interesting times. And it's both a blessing and a curse. But actually, it's been a blessing for us. The past year has been amazing. And this is just an opportunity to showcase one more innovative approach that CIHP has taken to programming for adolescent girls and young women. So before I go deeper, the app is actually something that we've innovated to bridge the gap. And when we talk about reaching young people in their own spaces, I'm unapologetically Gen X. I am not Gen Z, I'm not Gen Alpha. But what I have noticed is that working with them, like I said, it keeps me young and it helps me know what they're thinking. So this is what we're doing. Our tagline for this is safe and connected. So in the peak of the COVID-19 pandemic, and I think most of us who are implementing partners here would know that while the focus of the ART surge was to quickly close the treatment gap, make sure that we put an end to onward transmission of HIV in our country, the pandemic with the shutdowns, with the lockdowns, with the restrictions, with the fear, with the challenges, was a challenging period for a lot of people. And while we were finding new cases, we were also very, very focused on the fact that we could not continue to allow young girls to contract or be exposed to new HIV infection. So we're looking at how do we reach these girls in this trying time. The messages of prevention. And so WhatsApp group was created, and so we had girls logging on from across the country. We were able to give them SRH-related messages and try and make sure that we're giving them the information. And people always wonder, why are you wondering or why are you concerned about communicating with young girls? And I give this example. I'm from a very well-educated family. My dad was a doctor, my mom worked in a hospital. All my siblings are graduates, they are all educated. But when our last sister was going off to uni, and my mom overheard me having the talk with her. By that time, I was already a doctor, I was already working in public health, I was already trying to tell her, look, safe sex and abstinence and do this and that. And my mom overheard. And I had this, because I'm still trying to translate this word, there's no English word that can give the weight to the meaning of the Yoruba word ashakasha. It's almost nonsense, it's rubbish, it's just, what are you talking about? I felt from my own perspective that it was important that we had those conversations. But this is my mom, well-educated woman. She was just having none of it. So if that's in my type of household, then you can imagine what's happening across the country. So we're thinking that it's a good time to have a space for girls. Now, most girls in Nigeria have phones. Most girls in Nigeria like to chat. Why don't we use the phones to chat about health? So that's the messaging behind the Cool Girls app. And for sustainable access and for scalability, we transitioned this to the Cool Girls mobile app. So it moved from that WhatsApp group into the mobile app that's currently available on the place. And our target population is HIV positive, HIV negative, status neutral, young ladies and adolescents between the ages of 15 to 24 who have an Android phone. Currently, for our user phones, they're still accessing the WhatsApp platform. We're trying to build that app, but there's a lot of health informatics related technicalities to getting that information out on the iOS store. So it's a virtual safe space. There's no judgment, there's no fear, and it's almost anonymous. So they're able to open up and ask those questions that might not be deemed palatable in our cultural settings across the country. It's rather simple, there's constant engagement, and we also make sure we don't lose sight of the fun factor. But we also keep our focus on providing sexual and reproductive health messaging and HIV preventive messaging on that platform. So we had a huge event in Lagos, December 2022. 92 girls from the previous WhatsApp group were onboarded onto the app at that meeting. And that's just a snapshot of some of my colleagues there and some of our beneficiaries holding up the sign saying they're safe and connected. And of course, we have amazing mentors. And I'm going to stop here and just fangirl for a little because my boss, she's amazing and I'm a real fan. We're also cascading that mentorship also to the cool girls across the country. And so the topics that we take on, what they're asking, and sometimes you'll be amazed at what they want to learn, and they're asking really heavy questions, and we're having those discussions. And we're able to involve those topics depending on what they want to ask about, and also highlighting that from the questions they ask. But sometimes they just drop a question and they want to know about this or they want to know about that. So why are they choosing us? Because there are lots of apps out there, and we still see that people are interested in this. This is not something that we just conceptualize and we pulled out, but they're using it. So why are they choosing us? So we do keep it fun. We do giveaways, we do quizzes, we do meetups, we do hangouts as well. So once in a while, almost every quarter, they will gather up the cool girls wherever they have, they just hang out. We also try to tie it to our previous program. So we're having an OTT meeting, that's a Mission 000. We're having other adolescent services in the States. We also do have those fun and games attached to it. And then like my team was said over today, we also try and make sure that mentorship, you also have the connectivity with peers of their own age, and of course there's no judgment. The numbers speak for themselves. We currently have 16 states that have users of above 20. Of course, the heavily weighted states are those where we program, like I said, we layer it on top of the intervention we already do. We currently have 821 users onboarded. I have been stressing the team, our target is 1,000 by the end of the fiscal year, and hopefully we'll get that. But the thing is that we're also able, like Emeka said, to keep them. So they're not just joining and opting out, but we keep on adding on to it. And so we're really happy with that. Some of our numbers have also aged out. So because we have that 15 to 24 range, or we've programmed for over a year, we've had some girls age out into the 25+ category, but we're not sending them away. They're still serving as judgment mentors as well. And we keep on getting feedbacks, like I said. They're enjoying the services. We continue to engage in iterative design, trying to see how we can make things better. So just to look at what we're looking at next, we want to set up the Cool Girls online radio where they can access programs and stuff like a podcast, where they could just get to hear more things that would help them. And then we're also looking to track our numbers better and have an interactive dashboard. So that's us. If you scan the QR code and you're resident in Abuja, please do share that link with your little ones. We don't actually have lots of signs from Abuja. Thank you.
Station from Dr. Dorcas. Another round of applause, please. So, some of you, when Dr. Dorcas may have mentioned that Dr. Ola is actively ensuring that we program for young lessons. It's a charge to all of us in this room. Like when we started, we said we have been here before. We have all been adolescents. We know what the challenges are.
And it should be with that passion, the kind of support, the kind of help that you wish you had access to, should trigger us to have very difficult conversations, to get the right investments, to be able to reach the people we need to reach. I think it was Dr. Owen said, this is our tomorrow. And if you don't believe that, then you see what's happening. The young people are the ones that are taking over. Like someone said, they are leaders today. And so they are in everywhere, they're in our offices. They're with your children, both young and old. They're in every space. So please, we need to pay attention to how we ensure that they have access to what they require, and how they require to be presented to them. So thank you again, Dr. Dorcas, for a brilliant presentation. So we're coming to the second session, in fact, most important session, because we're going to start having discussion, and our panels will be activated very shortly. But before that, CIHP has been able to do a lot of work and business with a lot of donors. We've worked across with several partners, but one that continues to be a continuity collaboration for a long time now has been the support we've had from PEPFAR through the United States Center for Disease Control in Nigeria. And we have representatives from that agency right here in the room. We have Dr. Jerry Werner, who is the Deputy Director right here, Branch Chief in the room. So please, we can acknowledge you right here. Thank you so much. We also have Dr. Johnson from Amide. I saw him in the room. See, he's just stepped out briefly. He's sitting right in front. Yes, and he works with pediatrics and the adolescent subpopulation. I'm sure he'll be right back. And always has interest in that. He's always been at our scientific roundtable series discussions, especially, and it's not by accident, where we focus even on finding the missing children. Always interested in those conversations. So thank you for being here. We also have, very interestingly this year, we also have, besides the WHO, and I have been here to be coming up onto the panel shortly, the representative from UNAIDS in the person of Mr. Gabriel Nduliko. Is he here, please? You can, yeah, thank you so much from UNAIDS. We have representatives from UNFPA. Are they in the room? Dr. Adelakan is he in the room? Babatunde? Okay, so it's not yet here. Actually, here shortly. So again, like I mentioned, as we get wind of those who are coming in, like I said, it's not because that they wanted to be late, they had other engagements, and they had informed us that they'll be here at this time. So thank you so much. So we move on to our first panel discussion, and this will be quite interesting. So I pray you to pay attention so that we can have the right discussions, and I'll be calling so the first panel discussion is going to be focused on leveraging technology and other innovative approaches to empower vulnerable adolescent girls and young women in Nigeria. Okay, so we've talked about our STEM hub in Lagos, in Ikeja. We've talked about our Cool Girls app, but we have several other digital innovations that are targeted at reaching young persons and young girls especially. So this discussion is going to feature those discussions, conversations, and I'll be calling out the moderator for this conversation. And that's none other than Dr. Bolande Oyeledu, who is the Chief Executive Officer, CIHP. She will not allow me to read this. She will refuse it, and I want to keep my job. So I will, just highlight that she's a wonderful person. That's where I'll start with that. So a round of applause. Yeah, but it's hard not to read it, but wonderful. Okay, good, no worries. So thank you so much, Ma. Welcome to please have your seat. So I'll introduce the other panelists so they can come up to the stage so we can have a conversation. So first up is Dr. Saywood Harrison. She is an associate professor in the Department of Psychology at the University of South Carolina. Dr. Harrison has a PhD in health psychology and specialization in the field of pediatric school of psychology. She currently serves as the director of the PhD program of the School of Psychology at the University of South Carolina. Dr. Harrison's research focuses on improving the health and well-being of the youth who are impacted by acute and chronic health conditions. Her primary research interests include psychosocial and behavioral aspects of HIV. She's currently funded by the National Institutes for Health to develop a mobile health intervention to improve engagement care and medication adherence to youth living with HIV in the South United States. Dr. Harry Recovery, which is going to talk about iCare, training center funded by the U.S. Health Resources and Services Administration, and aims to build capacity for integrated behavioral health in the United States. Thank you so much. A round of applause for Dr. Next up, we have a very special young woman who's in our midst, and again, she's attached to the Center for Student Health Program, none other than Miss Happiness Matthias, one of our peers. Welcome, Happiness. This might be still to read, but I want us to understand what our work has done and what it continues to do. So meet Matthias, Happiness, a resilient and determined individual who has transformed her life through courage and determination. She was once faced with challenging circumstances that led to her involved in sex work, but Matthias has since turned her life around with the help of groundbreaking programs that CIHP has offered. The STEM Hub in collaboration with CIHP recognized Matthias' potential and offered her a chance to rebuild her life through technology and empowerment. Today, Matthias stands as a testament to the program's impact. Having grown into a confident and skilled individual, she continues to thrive and inspire others with her remarkable life of redemption. Ladies and gentlemen, you can do better than that. This is something like Thank you so much. I can see some people in the room got emotional, but that's the work that we do. Well done. Next on the list is Dr. Lufunke Ileshomi Odulade. Oh, okay. Okay, so this is what happens when Dr. Mola, when one person takes this, we'll read it here. Okay, so Dr. Lufunke summarized is the HIV and he's done a lot. So there's a round of applause. Thank you so much. Next on the list is Dr. Olujumo Ibiloye. He's a medical doctor with more than 10 years of progressive clinical and public health experience. He's the man on the round of applause. Over the years, he has now experienced with various public health institutions in many states in Nigeria and is implementing partners for the Global Funds, USAID, and CDC. He's currently a senior technical officer in the pediatric care thematic lead at the AP Public Health Office. Welcome, Dr. Thank you. So last but not the least, we have Dr. Karima Yusufu. She oversees several portfolios ensuring effective communication with diverse stakeholders and compliance with donor policies. For over 6 years, she has led IHBN's efforts in CDC Nigeria initiatives like the Pediatric ERG Research Strategy, PASS, and Accelerating Progress in Pediatrics and PMTCT. That's the ABD program. With over a decade of healthcare experience, she specializes in infectious diseases, epidemiology, and implementation science, particularly in HIV, TB, and COVID-19. She's exhibited several leadership roles, her deep understanding of Nigeria's public health system, especially in the northern part of Nigeria, and with analysis for program design and data analysis that led her to this point. Ladies and gentlemen, again, welcome Dr. Karima Yusufu. Thank you so much. So over to you, Dr. Bola.
So thank you very much for the excellent work done, and I welcome all the panelists to this first session, where we will be looking at how to leverage technology and other innovative approaches to empower adults and girls and young women in Nigeria. I think I'm going to have some questions. I'm not going to ask these questions because I'm going to just follow the lead from our keynote speaker today, earlier this morning, and also the insights we have from Ms. Adeoluwa and Dr. Agadelo. That's the correct pronunciation in terms of where we are. And also when we had some interactive sessions with the press, there were some questions they asked. We have all these policies. We have all these laws. We have all the things that we've put on the shelf. They're there, sitting there, and we've continually kind of continued to make new ones. New ones, revamp, we'll do new editions of the old ones, new editions of other things. And that we spend these years, as Dr. Whoever said, and tomorrow keeps going. It keeps going, it keeps going, and now we have the growing population where there is a considerable gap. And I like the way that you had highlighted earlier in terms of the gap. There's no homogeneity when you're talking about young people. They're a very heterogeneous group with very intersecting vulnerabilities. So as Dr. Docas had even highlighted, you may think they have everything. They come from well-educated families, they don't have any issues. But I can tell you that I've seen very well-educated families where I've had calls like at 3 a.m. in the morning that says, look, we don't know what's wrong with our son. He has a cutlass and he's trying to kill everybody in the house. Obviously, this is loud and what's the other one? No, they don't take pure coke. They usually have like a mix. It's loud and yes, Colorado in action. So sorry, Colorado is actually, it's not Colorado in the US, but it's a name of a drug on the street. It's a mix of the drug on the street. So it's a lot of these challenges that we have. Well, we have a case of, I'll give you a classic example, and I won't name the scenario. We're in a class and we're like, okay, you need to tell us what you are going through, give an example of what you can search for on a website. And the person is like very recalcitrant, kind of, not engaging, very quiet, and then after you kept asking, and she says, okay, if you're so insistent on asking me what you can search for, tell me how to search for a rapist. So it tells you a lot that is going on in our society, that is going on in the minds of our young people, and then coupled with the fact that there is access to unlimited, uncensored access to social media. And the question is, how do we then use the power of the media, use the power of technology to really look at helping young people, especially females, especially because they are more and more left behind in a lot of the things you're talking about. How do we end up helping them to better their lives? So I'm probably going to ask those people first, maybe happiness, we want to share with them. And please, I want to say whatever you don't want to share publicly, please know you are not obligated to say anything. Please, this is the safe space, but you don't need to share what you don't like share. It's very important.
Good afternoon, everyone. My name is Madeleine Happiness, but a lot of people calling me Black Barbie. First and foremost, I would love to thank Dr. Bola for this great opportunity of having me here, because let me just start from STEM, because STEM has actually helped me a lot. I'm the kind of person that I don't like public speaking. Once I'm being called outside, come and address the public, come and address the crowd, I'm always rejecting, running to the back. I don't want to do this, I don't want to do that. I don't like anything public speaking at all. But me going into STEM, it has helped me a lot. It has helped my self-esteem, because I was a survivor of sexual abuse. I was molested at the age of 10 by my headmaster. So it has messed with my mental health. That basically messed with my mental health. I was traumatized. I can't count how many times I've thought of killing myself. Even got to a stage, I went to buy sniper and kerosene. I mixed them together, about to drink it. Before my mom came in and trust African parents, she beat the hell out of me. Instead of her to ask me, happiness, what is happening? What is really going on? Why did you go and buy sniper and kerosene? Instead, she beat the hell out of me, and I basically understood that she was like, I'm still a baby, so there's nothing I'm supposed to be thinking about. But that's not it. As a young adult, young adolescents, we need our parents' attention. We basically need our parents' attention, because if our parents are there, we know they're actually working for us to make everything good for us, to make everything perfect for us. But at the same time, we also need their attention. It's not going to be nice. You are going through something and you go outside to talk to a stranger. At the end of the day, the stranger is taking advantage of us. So we basically need our parents' attention at every point in time. Every point in time, we need our parents' attention. When I was being molested, till now, till date, my parents does not know that I'm being molested. I'm basically waiting for the right time for me to tell them. But me coming into the STEM world that helps me, and me going into prostitution, it was actually STEM world that also brought me out of that place. Because when I was into prostitution, my boss, if you go out in nights, let's say they are paying me 50,000 euro. From that 50,000 euro, the only money she will give me out of it is 5,000 euro. And out of that 5,000 euro, if the room that I stayed, that I had sex with the person that took me, I'm still going to pay for the room out of that 5,000 euro. So basically, me selling my body out for sex, it does not bring me anything at all. Anything at all, it does not bring. That's why I keep telling young adults that even if you are going through a difficult time and you know you want to do something, at every point in time, think of that thing. If you should come out of this thing and you look back, this thing that I do, am I proud of it? Is this something that if somebody asks me, happiness, talk to me about your past, is this something I want to talk to people about it? Like me, I will continue saying it because I want people to learn from my story. I want everybody, both young adults, young adolescents, adults, to learn from my story. I keep going out, telling them that, look at me, I was once a sex. I was once someone that sold my body out for sex. And I want you to sit and think, this thing that I'm doing now, is it something that in the nearest future, like proud to come out and say, okay, I did this, I did that. And that is what I'm trying to pass across. And with the help of CIP, they gave me a job as a peer educator in STEM, and I'm using that medium. Thank you very much. I really appreciate it. I'm just a small girl. Thank you. So with the help of CIHP, they gave me a job as a peer educator, and I'm using that medium to talk to young adults to make sure that even if their parents is not there, even if their parents is not giving them the attention that they need, and they want to do something out of their thinking that, okay, my parent does not love me, because I actually used to think like that. My parent does not love me because my dad is a police officer and my mom was a cleaner. So they basically don't have my time, and I'm the last child. They basically don't have my time, go to my siblings, they go to work, come back in the night. They're always tired, they get to bed. Next morning they wake up, they go to work. So I do think my parents does not love me, they don't care about me. And out of my thinking and all, it pushed me into doing prostitution. Until now, I know I'm not very proud of it. I'm not proud of it, but I will use the medium, and I also use the knowledge I have acquired in STEM, because I learned digital marketing, and very soon I'm going into content creating to create awareness, talk to people about it. For the fact that you are being abused does not mean you should kill yourself. Does not mean you should limit the opportunity of people learning. Because assuming I've killed myself, or I did not come out to talk about it that I'm being abused, or I did not come out to talk about it that, okay, I'm selling my body for sex, I'm selling my body for money, CIH will have not discovered me. They will have not brought me, thrown me in, and spoke to me, talk to me to calm down and think, do this, happiness, do that, you can do this, you can do that. At the beginning, I was thinking, happiness, this thing, you cannot do it. You cannot do it because I was, even if money was not enough for me, at that moment, I was at least little money to get myself different things that I need at that moment. But it brought me in, they were like, happiness, you can do this. I was like, no, I cannot do it. How will I be getting money? How will I be getting money to feed myself? How will I be getting money to do some other things that I needed to do? But they keep talking to me, and that has helped me. At the end of everything, I can boldly say that I am very grateful to CIHP for drawing me in, accommodating me, even though I was being stupid at a particular time. I wanted to run back to the prostitution, but they keep taking me in. Happiness, you can do this. No matter what, you can do this. Forget that one. That's your path. And you need to come out of it. You need to use this medium to talk to other young adults, other teenagers that are planning on going astray because they don't have their parents' attention. So you basically need to use this medium to talk to them about it. Thank you.
Thank you, Happiness. Thank you. You've done a lot of digital marketing and digital creation. I must also say that she also she did a SSC, and she has confidence. She so maybe what we then ask the question is for our digital life, it's really about girls looking at the experiences of the other girls and the STEM hub and everything. What are the challenges that you think they face most in terms of science, technology, internet, maybe 2 or 3, so that then the other panelists can answer.
Okay, for me, before I came into the STEM hub, me learning digital marketing in the STEM hub, I don't know anything about computer. I can only use my smartphone and I can access it very well. But me coming into STEM hub, I don't know anything about computer. I don't know how to navigate it. So I would basically say there are young adults out there that want to go into tech, but they are being scared of being, let me say, being pushed aside because they don't know anything about the computer. That's what I'll basically say, because after I learned this digital marketing, I was having a conversation with one of my friends. I was telling her about the STEM hub, telling her to come into it because she told me that she has passion for technology and she really wants to come into it. So I was kind of like, okay, you can do it. Once it's time for us to start enrolling in new girls, I will send you the link, you will register, and they are going to teach you. I told her, that even though she has passion for it, she doesn't want to come into it. I said, why? She said she doesn't know anything about computer. And I told her that I don't know anything about computer. But when I went in there, the thing is, it's one thing for you to have passion about it, and it's another thing for you to take a bold step to do it. That's what I told her. I think I have passion for it. It's another thing for you to take a bold step to do it. You know your background, you know where you're coming from, and now it's time for you to change the narrative of that your background. And I told her about it, I spoke to her about it, and luckily when the last word that was when the link came out, I sent it to her, and STEM actually brought her in, they taught her a lot of things, and after the graduation and she was appreciating me, telling me that thank you very much for bringing me. I told her she should not appreciate it because I'm actually doing my job. So someone that told me about this temple that made me come into it and gain this access, gain this knowledge that I know from me. So she should not basically thank me. She should just keep going out there, spreading the good news to other people. So I would say basically them not knowing anything about computer can actually stop them from accessing the digital world, and also some may say because they don't know English. because they don't know how to speak a good English. And I did tell them, you start from somewhere. You basically need to start from somewhere. It's not like these professors now, they pass through a particular level before they would actually get to the level that they are in. So you basically need to start from somewhere. If you need anything, you come to me. I do tell them, if you need anything, you come to me. That's my job as a educator in the STEM. If they need anything, they come to me.
Thank you very much. So now I'm going to internet and everything, and I'm going to come to Dr. Funke. Dr. Funke, you are representing, you actually represent the background in terms of policy, in terms of rolling out programs, in terms of sitting with government, knowing the look and cranny, looking at international community, looking at where we need to go. So why is it hard for us to look at coming up with programs, as Dr. Esset has earlier pointed out, and what are the limitations and how can we address that, especially regarding the girl child?
Good afternoon, everyone, and thank you, Dr. Bola, for this opportunity to be on this panel. And congratulations, happiness, you're on the right path. Down to the question, just like you said, you actually stated it in your statement. We have enough policies, we have enough guidelines. Oftentimes, what we lack is actually translating those policies to actions. And translating policies to actions is not a half-baked. It has to be from within, from the people that really need it, from the people that actually live the experiences. And then when we come together, we should be able to, after we put out the action, we should actually monitor and then go back to the drawing table because things do change. The world is dynamic and there is a need for our actions also to be dynamic. Like now, in those days, we used to know about cocaine or thereabouts. But now, the substance abuse now is no longer just cocaine. Now we have skunk, we have all the names that we can't even think about. We even have things would not be used as substance abuse. So going back to what I said earlier, action, not just putting things in place, but action. And that is actually our communication with the global community. That is our communication everywhere. And also when we have those actions, how do we bring it home? For the girl child, the experience out there is diverse. The girl child is, the experience is different from that in the Southwest. That has educated parents is different from that the parents are not as educated. But oftentimes, when we actually plan our programs, we lump everything together and we think that would address it. I like one of the programs that the colleagues from South Carolina presented about the one that they actually started young, between the age of 11 and 14. We should also have those programs, looking at the different population groups or the different demographics, so to speak, and address them from right when it's, when they are young. If we have programs even for children from 5 years old, of course, I think we will be able to make a lot of difference. Then it also now comes down to, oftentimes, okay, like I was saying, we don't have a lot of programs that Dr. Bola put on ground. I would say probably you are one of the few NGOs that are starting from health and looking towards STEM. It takes a lot of effort, it takes a lot of strategic thinking, for you. So oftentimes we could be fixated as well to say health is health. So even when you have the opportunity to intervene on other social determinants of health, we don't look in that direction. It has to be just health if you're treating malaria, HIV. But we see that even, for our young girls now, the vulnerabilities have that. And it's not until they have HIV or that infection that we really have to address it. We actually need to start as early as possible using all avenues, looking at things from different perspectives. not just health, you doing yours from science. Some might be doing it from the environmental perspective, some might be looking at it from the climate change, some might even be addressing the parents. Like the experience we had shared just now, probably we have programs targeting parents to look inwards. It's not enough. I know we all have there to work to get fed for our families, but at the end of the day, what really matters when we really lost those that we are actually trying to save. And lastly, I want to add, it's not just about the girl child. There is also the boy child. Thank you.
Microphone. So she talked about what are the limitations in terms of, taking the policies to action. You come from the field. And she talked about expanding beyond health, looking at all the other social determinants, looking at how the other areas really hit on this. What's your experience coming from the field, and how do you think that we can further integrate technology? And also why it's important to integrate technology. I always tell people that I used to read yoga. I'm sure everybody except our friends from, I learned new words, teas. And I'm funny enough, Mr. Steve, I actually have not seen him in ages. His sister and I were in Queen's College together, and I remember him as a small boy at King's College. So when I saw him Stephen, I was like, oh wow, what happened to this guy? So Stephen is, I have to tell our friends from the US, it's I think I don't know if I can explain it, but Steve means that you are like very up there in terms of being fashionable, everything. So this guy had gone to one of the parades, the parades in traditional parades in States, and all of a sudden he was riding the horse, and all the young people, and he actually practically broke all the social media, because they were all like, oh, this that thing is cool, is this, and it's really become an icon for a lot of things. So for me, that's the power of technology, the power of media in passing across information. How do we harness that more on a continuous basis rather than just a one-time thing, and use it to make impact in the lives of
delighted to be here. It's actually a complex field that requires a systematic approach. So I was coming, I was like, where do I start from? I'm happy when you said I should speak from the perspective of program. Because there are different factors that are influencing the health outcomes among recent girls and young men. And at the same time, when you look at technology as a tool to improve health outcomes among young people, you can also look at it from two angles. Getting them involved in STEM education and STEM employment, or you can also look at it from the diplomatic angle with interventions, using technology and the interventions to improve health outcomes. And at the same time, raise the question again of how do we translate policy to implementation. These are complex issues, so I will choose that. So from policy handle, I think it actually starts from the agenda setting and the inclusion of all stakeholders is setting the agenda, co-creating or co-identifying the issues and co-creating the solutions, such that when the policy is eventually to be evidence-based, there is ownership and there is commitment. If the government is on the table, when those ideas are being discussed, there's high likelihood that they buy into it. And if the young people are there to also speak their minds, tell us specifically what they want to change they need to see, I believe that if the policy is out, people will buy into it, and there will be commitment to the government in terms of finances to fund it. And then coming to implementation side, I believe a lot in research as well. I want to believe that our intervention in terms of the underpinning principles, okay, that governs the program we implement, I think they are under-theorized. We don't actually, I don't make a blanket statement, but the theory of change needs to be well elucidated, and then we don't borrow from the existing theories and improve on it in our programs, so that when we are implementing, we know what the set outcomes are. Okay, and we know how to evaluate them as well. So I think we need to improve on that going forward. Now, coming to engagement of adolescent girls and young women in STEM. No. I choose my words. Leveraging technology enabled interventions to improve young men outcomes. We need to do a lot of advocacy in terms of increasing the coverage. There are a whole lot of interventions out there, just like we have seen today, the Lagos intervention, the AYP ops, the SHE ops, and the likes. But how many people are actually aware that such interventions are going on? Okay, I think in terms of information dissemination, there's a limitation there. And then in terms of equity as well, because she mentioned that there are barriers, low education, use of technology as well, there's limitation. So we need to see how we can involve the target population that are not educated as well. How do we design our intervention so that it's not limited to only those that are educated or to only those that have access to that information? How do we encourage this other target population who are equally important in our intervention? And I believe that's where the government comes in and the systemic approach. We need to improve on poverty. We need to improve on access to educational opportunities. And then the big issue, again, when it comes to access to technology, the power imbalance, the power relations, I think it's also there which we need to address. It's an issue again, because it stems from our social norms, our cultures. So that's where the issue of advocacy comes in again, the issue of education, which is not limited to the target population alone. But when you look at the meso level, the family, the institutions, we need to target it as well for intervention, improving the knowledge base of parents, so that they see that STEM is not only for boys, but girls can also benefit from it. We also need a change in mindset. The population themselves who are disenfranchised, they need a change in mindset to know that the subject of mathematics, the discipline of engineering is not for boys alone. Women can also do it. And that's where mentoring comes in, which was well illustrated in one of our presentations. We need peer mentors, and we need mentors, okay, from who are doing well in their chosen STEM career, to mentor, to motivate, okay, the target population. So I think I'll stop there.
Thank you very much. So Dr. Juan also through the challenge. We have inequities, we have inequalities, education, there's poverty in the land, there's so how do you really grow a lot of these interventions from this pilot phase to really scale up and everything? And I'm going to ask Dr. Perry, you are exceptional in terms of programming, and such a huge population that you are reaching, you are working with young people. What can we do different?
Good afternoon, everyone. So I'll just want to piggyback
what the lady from MHI said. First of all, for whatever we're going to do, let's ensure that young people are carried along. They know what they want, and they know where they want to be, and they know what they want to expect. And as much as we're creating all of these policies and all of these strategies we're putting on ground, let's also ensure that as we're implementing, they are also involved in the implementation and looking on the level of sustainability. Once there's no longer funding and any of these things, the young people can carry on the torch like Happiness is doing right now. Thank you very much.
Thank you, Dr. Now, I'm going to come to you, say what? You come where to have. You come from that clinical background, you also do the implementation, and you've been involved with us, and you do a lot of these. And you come from a place where there is a lot of use of technology. What can we do? How can we leverage on the experiences that you have, both from that clinical perspective and that from the use of technology and knowing the experience? What can you share with us in terms of reaching them?
Sure. Well, first of all, it's such a pleasure to be here with you today. And I have to say, you saw my bio, I've done a lot of things in my career, but probably one of the things I'm the most proud of is taking part in partnering with the IHB to brainstorm that you have 1 year ago, and then being able to come back this year and see the incredible progress that has happened. To meet Happiness, to meet the girls who are there, having their lives changed through these STEM opportunities, it's really incredible. It makes me so excited. And I can't wait to see where it goes. I'll share a few maybe lessons from the US perspective. So we have made a lot of progress in engaging young women and girls in STEM, but we still have a ways to go. In the United States, right now, girls and boys take high-level math and science classes at about the same rate all through elementary, middle, and high school. But then at these movements, at these transitions into college, into graduate school, and then into professional careers is where we see this gap really start to grow. 30 years ago, we have in the United States a big test that our oldest students take in high school called the Scholastic Aptitude Test, the SAT. 30 years ago, when we look at the very top scorers in math, it was 13 boys to 1 girl. And today now it's 3 boys to 1 girl, right? So we see over 30 years, we have really started to close the gap. There's still a gap, but we've done that. Not our genetics didn't change, our innate capabilities didn't change. What changed was the sociocultural context, right? We began to say that girls and women are equals in science and math and technology and engineering, and we began to change those norms around it. So as we think a little bit about why girls are often left behind in STEM, we know that gender stereotypes, as was already mentioned, play a huge role. We continue to have biases thinking that certain areas of school, boys will be better, and that's just not true. There's not science that supports that. We know, especially in more patriarchal cultures, that again, there may be more limited opportunities, or again, different stigmas towards involving girls and young women in these programs. We know that the lack of role models is a major challenge, a barrier, which is why it's so wonderful to walk through the She Hub and see so many strong women, young women who are educated, knowledgeable, amazing mentors and teachers for the youth who are going there. And then in the United States, there's also been a lot of work around looking at our different perceptions that young women and girls are more likely to have anxiety when they're in math classes, right? Because these biases begin to get under our skin, right? They begin to impact us in different ways. We have to be on the lookout and make sure we're sharing positive messages to our young women, that we're making sure that we give them ways that they can reduce their anxiety without going into these spaces, a tech hub, that they may think, oh, can I really do that, as you shared? And you certainly have done that, right? It succeeded, but at first there was that fear and that anxiety. We have to address that confidence gap that really continues to exist. And then the last thing I'll say is that when you think about STEM in particular, our youth are growing up in a digital world. Now, a lot of the challenges they're experiencing are coming from that, these rapid changes that are coming about because of technology. We also have to see that now we cannot separate our economy, our economic development from STEM, right? Just as we say, like, health is wealth. STEM is wealth now in this new generation. In the US, out of the 10 top sectors for economic growth, 9 of those 10 require you to have high-level training in STEM, right? So we're not starting at an early age with our girls promoting math, science, tech, engineering, computing, all of these things. Then we know that once they get to an age where they can be employed, they're not going to have those same opportunities because those areas that are really growing are going to require at least proficiency and many times higher degrees now too to really take the lead. So I look and I come and visit here in Nigeria. We've made so much progress in improving health, improving education, and now in same in the United States. But we need to keep our eye on like where do we go forward? And I think that now we really need to focus on STEM and young girls and women because as we see that now leading the way, we want to make sure we're preparing this generation to be able to step up and be leaders and share in the economic growth and development that's to come.
Thank you very much. So I think we talked in terms of the challenges, in terms of the inequities, in terms of the pilot programs. Maybe I'm going to open this up for discussions from the floor. With a few questions or comments, so you can add to it, because definitely we have a long way to go. We are demonstrating from things like the STEM Hub, from other programs that are working that this can be done. We've learned now that as we do it, though, we need to focus on sustainability. We need to look at the social cultural norms. We need to look at the context. We do have the policies, but how do we translate this very quickly into action? So I'm going to open it up. I see a hand up here first. Dr. Banky, then my friend from Japan Road.
So thank you so much. I've heard a lot of comments today about the need to bring all stakeholders to the table, which makes sense. But in a very diverse cultural, religious society, how do you deal with the risk of bringing them to co-create when everybody wants something different? And they don't really want what the youths actually want. That is a challenge because what you create is there by the time it gets outside. So should we restrict the people we bring in? Should we just bring in only the youths? It's scratching my head saying, if you're practical, if you bring everybody in, you create more problem. If you don't bring everybody in, you can't do it. And if you try to make everybody happy, what you create becomes nonsensical. So I'm just curious.
I see Dr. Jerry vigorously shaking his head. So I'm going to give him the microphone because I give him the microphone. Maybe I'll just also say that co-creation puts all the ideas on the table. But then we also need to look at the outcomes we desire from that co-creation and then see what are those ideas from that co-creation that will take us towards those outcomes. Those are what we then begin to negotiate with stakeholders around the table. But I want to hear yes, he does that a lot.
Sorry, I didn't want to be like, I think you read me to, maybe I wear my hat on my sleeve, so it kind of comes out very. So my thinking about that is that, the African proverb that says you want to go fast, you go alone. You want to go far, you go together. I think this doesn't mean that going together is going to be easy. So truly, if you want to move policy and make it actionable, we definitely need to co-create. Now, it may take a lot of finesse to get to it. It may also take a lot of negotiation to have at least a framework that can be modifiable for every subgroup eventually of that general group that you want to work with towards achieving that goal. So that probably is what is required. Even though we may have different goals, we may have different socio-cultural background, but there are one framework that actually outlines the main goal that we intend to achieve
and others contribute to how we get there, but not completely, basically through these other means, and then these other areas are modifiable, and that can move forward. I think an example I want to give is when we started with a simple thing that was basically more of a clinical trial. We call it, once we started, we call it Safe Baby Initiative. They started in the East. Just an example, one of our professors who had been away a while in the US and came back and found that when he was leaving, there were a lot of health facilities, primary health care centers near the communities. But by the time he returned, he was seeing more churches than facilities, and the health indices were poor. And mothers were not going to facilities for delivery. So he decided to see if he could try intervening amongst those pregnant women with using the faith institutions, the churches, and they could do that. And so he did, and then some churches he didn't intervene. So he compared the results from the intervention stream and the non-intervention stream. And eventually he saw a marked difference that those women who participated through the faith-based and were able to come in for their pregnant, they call it baby showers, and eventually they came with their partners. They were able to access HIV testing and some other health services that were part of the package. The husbands who would ordinarily not be to a facility were also accessed there and offered testing, and they were part of the ball program. And the babies that emerged, actually, because they were linked after the testing, those who were positive were linked to care and treatment. That also brought out better outcomes for the infants that came out of that pregnancy, those pregnancies. So he used that to show that it could work, and then we now try to translate it into programs in Benue State we started initially, and the church there did well with it, and it became a very successful program. Now we've not stayed only with the church because we had a problem. We were telling ourselves, how does it work in the Islamic setting? Because they are not as structured as we think. And so instead of trying to solve it ourselves, we had to bring in the Muslim faithfuls and their traditional institutions. And they looked at the framework and told us this is the way to go about it. And we've started implementing to good results in Lagos that I'm sure Dr. Bola will tell you a little better what's happening there. So it may not be the same kind of service, but there is flexibility enough for them to turn it around. So there is one framework that women who may not come to facilities, we can access them through their faith institutions. And that has worked. So I think those are the kind of things you want to see in co-creating policies that can be translated into action. Thank you.
Thank you very much. So just to reiterate that co-creation can be challenging, but it brings all the relevant voices to the table. It's better for us to have those very hard discussions and then begin to think together how to solve them, than to leave those stakeholders behind. And I always tell people it's really about strengthening the system, doing the same thing. You have those hard conversations. If you don't have them earlier, you are going to pay for them later. So it's very important to do that. Thank you. So, Dr.
Okay. Let me start by, appreciating the panelists as well as the moderator for this insightful analysis and presentations. Institutionalizing access to technology, especially among young adults in Nigeria, has been an issue of serious controversy in Nigeria recently. And it got to a point where having access to a computer, for instance, it becomes like an eminent tool of danger. We all knew how the law enforcement were busy attacking youth or arresting youth. What are you doing with the computer? You are doing cybercrime, you are doing Yahoo, and the rest of that. Now, in terms of policy translation, how are we mirroring this policy in the direction that makes utilization a productive, a kind of like looking at it from the lens of a productive output in terms of effective utilization, to the extent that you don't dissuade youth, from having access to such kind of tools. So we need to engage at this point. How we engage in this policy policymakers, translators, how we engage them to look at this thing from a very constructive and positive angle. And I feel if we do that, we will be contradicting ourselves, because it will go a long way in ensuring that we have a balanced, approach to ensuring that we institutionalize this.
Thank you very much. I really want to go first.
Thank you very much for that question. Hey, a lot of things in life. There are just few things in life that doesn't have the pros and cons. We have the good and the bad. And depends on the side where we want to be. And also, it's about the public good. I don't know if, using your example, I don't know if there's that policy to say arrest you to the phone. I really don't think we have it. But basically, the law enforcement, we have my sister here who is from the police, they often take laws into their hands, and that is based on their own translation. Where this comes in is, it's not about the policy, because every policy would have the good and the bad side of it. It depends on how you translate it. It's about educating those that will implement the actions. And it's about putting our mouths to it, like being able to talk about it. There's a place for the policy maker, there's a place for the implementer, and there's actually a place for those that will benefit from that. At the end of the day, for us in Nigeria, that was what we saw. Sometimes they go where those that benefiting were actually the ones that, the answer issues. But things probably would have been better if across that line, the policy makers, the implementers, everybody comes together at different points to say, this is actually what this policy should be translated to. Not that because all kids or all young people have computers, then you have to arrest them. I think it's being able to talk about these things using different platforms, a platform like this, taking it to the media, the traditional media, the social media, I think is key for us. There is no policy that does not have different sides to it. We just need to focus on the middle of it and ensure we actually inform those that need to be informed about it. Since I have the mic, let me just add to what my brother Dr. Bankole talked about earlier. When we are co-creating, there are different stakeholders, and each of the stakeholders have their roles. It's important for us to get this in mind when we are fully working together, such that we don't leave some people out, and at the end of the day, we come back to what it is. Some co-creators, their role is basically for them to open the doors. If they are not on the table, even though you've done everything well, and when it comes to opening that door, it becomes that's the end of your implementation. So it's key that when we are actually conceptualizing it, we think of the role of each stakeholder and what we want them to do, and also prepare them in that regard. Oftentimes, when you engage people one-on-one or at this you actually realize that it's lack of knowledge that makes people to go against some things. And when you educate people appropriately, then they become the advocates that you need. Thank you.
Thank you very much. And just to build on that, I think earlier in the day, when we had AIG, when it came this morning, one of the things they said, it left us with a charge, which I think should be a critical outcome of this conference. It said, come to the IG of police, come and present these things. He is already a gender advocate. But these are all the issues that we collectively, and when he said command, I was talking to Andy who's left already. I said, we don't want to go as CIG. It is not, it will be right. We will go as partners in development with government, with everybody will go together to the IG to say, this is our own 4 points agenda that we want them to be involved in. And we can put computer into one of them to say, it's just as how he's educated and built the skills of the Nigerian police in Lagos State to understand that the fact that I've been raped is not because I'm wearing the spaghetti top dress or the way I'm looking, but this is a criminal offense that's being perpetrated against me, and it is not my fault. I have the right to say yes, and I have the right to say no. The moment you rape me, you violated me, and it's an assault, and there are steps to addressing an assault. So I think it starts education, because we do know that the Nigerian police force, there is that gap, and it is how to bridge that gap. And I'm glad Dr. Salani is here to also help us to facilitate that process. So this is one thing as we begin to look at this, because I've said we will do that advocacy to the IG with the support that we follow in and the will with us, so that we really are very clear what exactly we want from the Nigerian police force. How do we want them to be involved? What are the things that we need the behaviors to change on, and how are we going to help them to get to that? Thank you.
Maybe just to have, when we implement the programs, the intended outcomes, we just picture a scenario of one of the programs. But I think what is more important is also to identify the context in which those scenarios are playing out, and also the mechanisms of generating the outcomes. So that way we be able to speak in an evidence-informed way. So say, oh, here's the magnitude of the issue, but these are the areas, these are our recommendations. That's what program implementation angle. Because from my observation, that's when I got this invitation, like I actually went online to say what information we have out there. But then I see less or little of studies on the effects of as a technology based. What we have is more visibility study, utilization, acceptability. But in terms of the outcomes, we don't really know. And where outcomes are documented, it's either no effect or the effect is not as strong as we thought. So I think we should put on our evaluation cap and actually scrutinize what we do.
Thank you very much. Just one more question. Question. Short. So just to say, I think someone that also mentioned about parental communication in terms, and I want to say that one of the things that we also do, which we didn't talk about that a lot, is that CBC has also funded the Family Matters program, where it's really about parent, caregiver, child communication. How do we improve that, making sure they're working together? So for us, and I think maybe I'll just go around very quickly, maybe just one sentence. What do we want to see differently? We'll have some action points, and this might be a way to just wrap this up. But I'm just going to say, for us, having the STEM hub is not about changing everything. We're not going to teach the whole world technology. We're not going to teach all those, but we're going to say we can do things differently. Technology, you don't have to go to the university to be conversant with coding. We saw by some fantastic young girl in Lagos. In fact, I looked at her and I had to go back to the coordinator and said, that girl looks extremely smart. And I said, yes, she came in 4 weeks into the coding class or something. She gotten ahead of everybody. All she needed was that space to really be confident and know what she's going to go there, she's going to go places. So how we make sure that we take it out of the formal and really create that interest point so that you can explore and at the same time be confident, build your self-esteem, know that maths is not, it's not crazy. It happened to me in high school. I wanted, everyone knows, my family knows I wanted to be an architect and an interior decorator, and it's still my passion. But they told me to be an architect, I needed to do physics, maths, and another thing. Physics, I could weak because I could take out mechanics, I'll do lights, I'll do some things, I'll pass. But algebra, I could not weak. And so it took me and my guidance counselor, I'm serious, in my A-level class, I refused to go to the physics, chemistry, maths class because I said I was not going to pass A-level maths. I wasn't going to do algebra or calculus. Nothing would make me do it because I was so fixated in my mind at statistics. And then she kept counseling me. They want to say, okay, if you become an architect, well, if I want to do social architect, I said, okay, social architect, because I really had gone through everything. And I said, I'll do, I work with young people, look at, she said, oh, you love young people, then you become a good pediatrician. So you go think it. So that was, and I was like, okay, that's not a bad idea. Because she said there was no, because I came up with my own combination. I said I would do physics, chemistry, biology, geography, that maybe you could, maybe you are the best architectural school there. I said I could, that maybe, and they would take me with physics, chemistry, geography. So for the geography and the chemistry class ran together because geography was the social science, chemistry and science. So there was no way of between chemistry and geography at the same time. I would sound like I didn't attend those classes. So that was it. But I dealt with other girls who had that opportunity. So it just tells you that I've not regretted doing medicine because I still doing what I love to do and I'm still practicing my interior design. So maybe one word. So we still need to get people. And I ended up having to do math and statistics in medicine anyway. So at the end of the day, I found it myself to know how to get so this one is sent to
I mean, my work is that we all leave here with this message to try to share this awareness that girls are just capable in these areas. And that we really promote that growth mindset. We've heard an amazing story today of resilience and growth. And every girl has got an opportunity to contribute with that. So let's look for opportunities to get girls engaged.
Sure.
Thank you. Mine is engaged, listen, and adapt. Thank you.
We need to be more advocacy and communication around gender norms, not gender stereotypes. And then, of course, we need one agreements and to groups. Thank you.
For me, it's more of more involvement of young people, and also we need to do more on social behavioral issues that we have in Nigeria, because that's one part I saw that we're really lacking. We need a lot of social behavioral interventions, especially for the level of schooling from as young as you're starting to begin to learn the basic things. We need a shift towards beginning to see things not only from the family, also in the schools and also in the country as well. Thank you.
The other person comes the last, so she gives us the last word.
Okay, so for me, I'll say should do more in breaking the barriers that stopping other adolescents from going to the and also from
We have enough that we need to break the stereotypes. So the words that we say, I can't do math, they're afraid of maths in school. So thank you. I want to thank my panel members, Stewart, Dr. Funke, Dr. Chumo, Dr. Karimat, and of course, our dearest happiness. Thank you all.
Thank you so much. Can we have a photograph with the panelists? Ms. Peter, photograph with the panelists. What an exhilarating session, very insightful. And these are the people who made it happen. So just there are the conversations. Another round of applause for them. Thank you so much. So we've come to that juncture that I've been waiting for in my subconscious. And now it's just so exciting that we get to go and do it. But thank you so much for hanging on to this point. If you are seated right now, you'll be receiving a meal ticket, and that's what you would use to access the L word, lunch. I'm not making any errors this time. But before we do that, whilst we're going around the room and making sure that persons have their meal ticket, we want to have another mentee session that will keep us excited about the next session. Okay, I'm looking at the room, and I think we're keeping to our word. CIHP keeping it IIT, less than 2%. So that's good. So a round of applause for CIHP. Our intention is good. All right, so please, we want to retain that. We're still tracking, we're still following up after lunch for that. But I'll call on Ms. Pamela again. So she leads us on the second session of the Menti Meter. So we can just grab our phones, we know the drill, menti.com. Pamela will lead us through again. So we can put the code and see how we can get set up for the next session. So over to you, Pamela.
Okay, I'm back again. So quickly, let's go back to our phones and mobile devices. Type in menti.com, M-E-N, in case you were not here earlier, MENTI.com. And then if you have your agenda, the QR code is there, just scan it for the question above. What is the biggest gender-based violence issue that adolescents in Nigeria face? Yeah, so the responses are coming already. Menti.com, please. The code is on the screen 46525661. You can scan the QR code and type in your response. The responses are coming in the healthcare of disclosure, fear, rape, feelings of isolation, sexual harassment, sexual abuse in boys, okay? Stigma, that's another rape, poverty, lack of confidence, men, oh really? Okay? Emotional abuse is getting interesting. Consent. Wow, we deal with consent. So consent is there. So keep your response to consent. And then again, scan the QR code takes you to this question. You could also go online, type menti.com, MENTI.com. The code is there, 546525661.
The response is coming.
Lack of trusted mentors in the family. Male about male development. So online gender-based violence, power imbalance, okay, lack of knowledge, religious hypocrisy. Wow. All right. So final question. Being forced to withdraw legal cases, lack of support with medical relief. All right. So as we keep on sending our responses, are these really the biggest gender-based violence confronting adolescents in Nigeria today? Okay. I think we'll find out when we return. Oh, there's one here, cultural preference for males becoming the accused. Cultural norms. Lack of consequences for perpetrators. Education disparities. Poverty. Poverty coming twice here. Inadequate post-rape care. Really? All right.
All right, thank you so much, Ms. Pamela. Let the responses keep coming in. We're at 80, 81, so it just means that yes, we're good, and let them just keep coming in. So well done, everyone. So at this point, remember that this is just a sterile conversation. We have an interesting session. We have the Assistant Commissioner of Police from the Lagos State Command in the next panel. You don't want to miss that. So we're going to launch quickly. It will be, you're going to hear there's nothing you're not going to hear because, sometimes there used to be this program on TV, I don't know if you remember, Police Watch, a very long time ago, so you're going to hear a lot from that angle. And please, if you have any items that should not be in the hall, we have law enforcement here, okay? So please keep your contraband. Anyway, so I just wanted to highlight some of the key buzzwords that came up during the last panel before we get on. You just put them down. The need to continue. There was a lot of speaking from Ms. Happiness about the step of bringing people in. And I think our intervention needs to be focused at bringing people in. How our intervention is bringing people in. Coming from within, we heard Colorado. Wow. We heard from within, we had media, we heard inclusion, we heard co-identifying, we heard co-creation, we heard ownership, we heard commitment, coverage, equity, sustainability. We heard role models. We heard STEM is wealth and health is wealth. And the one that really hit me was some stakeholders are actually key holders. Dr. Fouquet, some stakeholders are actually key holders. So you need them in the room because they have the key to open doors. Thank you so much. See you after lunch. It will be at the lobby. Okay, so please, can we eat in 30 minutes? Okay, what that would mean? I know, somebody has been 30 minutes. Can we eat lunch in 30 minutes? What that would mean? Can we do lunch in 30 minutes? We can. So what that would mean is that we're going to have some brisk walking because it's quite a distance to the restaurant. Yeah, so we're just going to work. Dr. Zola is active, so for some of us, we're going to walk straight to the restaurant. You step out of this hall and then to the right. Now, what we're going to do, we do know you have your belongings here, and we're very, very mindful of that. So we're going to leave and lock the hall so that we all go on mats, so that you don't have to take all your stuff with you. So everybody's going to leave, and then the hall will be locked. You can just take what you think is most valuable to you, but your other stuff can be in the hall. The hall will be locked, so we're all going for lunch, and when we're done, we're all coming back. So Steve, we're going now at 2:40. And we'll be back for 3:10. 3:10, we're back. 3:10. So please go, the hall is going to be locked. Good luck.
Okay, yeah. Thank you, sir.
For literally all the cases you have been having one thing or the other, we'll have to hire a whole DG set to augment for something. It's good that this is in place.
Yeah.
Yes, I like it.
But the main things are the ceiling.
The main speaker.
Yeah. We put some at the ceiling, then some at the walls.
Good.
Thank you.
Skills, once you have this simple equipment sitting here, skills, maintenance is easy.
Yes.
If these speakers are bad, I'm sure there's a piping.
Yes, there is a
Piping
piping.
this set.
Yes. There is a pipe.
Yeah. Good.
Thank you.
And your meeting room upstairs,
yes,
where we have board meetings.
Okay.
We had a board, were you the one, I don't think you were at the board meeting. Last 3 weeks thereabouts.
Okay, I'm the one.
Oh,
Yes, last 3 weeks.
yeah. So it's a beautiful performance. I like it.
All right, thank you, sir.
We have building, like a new building for the organization. So I'm really, I'll speak to your manager. I don't know. I'd really like to speak to the guy that did all the yeah. I think something like this. I need to replicate exactly this. Yeah. Smart system in the conference room.
And it does make it, you not see why everything is done through the pipe.
You create a projection point where anybody that needs to project sits there.
Alpha. As I see your post, I know say you don't be around the yard. Fine. How? No, something that starts this morning. Since morning. No, the day of the lunch. Then go lunch. No, they will come back on lunch. Yeah. But they'll come. Like after lunch, they'll come for some kind of I live there when they never start and they my things are after prison, they will allow them. Start. Yeah, thank God, thank God. How do you have it today, but it's not the board first. What of outside, backside? And the same with the which happened back, that backside, they turn into the launch place. Another thing, because yeah, they make them free. So as we tell us space, they don't rent that place. So they got on that place to run. Both their breakfast on that plate. As it's break, okay. Bob don't die. How many one?
Okay, for your attention, we will be on the side.
Where did you keep
All right, all right, all right.
some rice?
If you have your colleagues that are in the restaurants, call them out. We're back.
This is
Yeah.
This is it. So this is where we are starting from. This is where we're starting from. Here. This. This is a company discussion. So this is the next thing. This is the next. This is the next. Second part. Yes. Just be cautious. Let's not really get that award. Next. Right.
Session, so please let's settle down. If you have colleagues that are still at the restaurant, please tell them that we're on the way with our next session. All right, so I'm holding in my hand. I lost a pair of spectacles, glasses, lenses. If this is yours, please come for it. It's right here. So the person is still not back from where they went. We're not identifying it. So please, this is yours. It was found at the restaurant. So if this is yours, it will be right here. You can come pick it up. Thank you. Well, if you know someone who was wearing these pair, it'll be right here. Thank you. Okay. So right about now, we're welcoming we'll be inviting and introducing the next session. Welcome back from lunch. I hope it was good. Was it good? Yeah. Okay, good. Thank you so much. All right, so the next session, and we'll do this very quickly, are community strategies. So you need to take the lunch break down, so people know we're out. So we're going to start with community strategies to reduce gender-based violence among adolescents and young persons in Nigeria. The next slide. Great, so that's the next session. So I'll call up the moderator next. It's pharmacist Shannon Hire. A round of applause for her, please. She's a dedicated and result-oriented public health professional with over 14 years of progressive experience in managing and implementing projects. Managing projects focused on health system strengthening, HIV, capacity building, and gender programming. She earned her bachelor's in pharmacy degree from Ahmadu Bello University, Zaria, and holds a postgraduate diploma in logistics and supply chain management from the Nigerian Institute of Transport Technology, Zaria. Additionally, she obtained a master's in procurement and supply chain management from Kaduna State University and a postgraduate certificate in public health from Roehampton University, London. She is a fellow of the West African Postgraduate College of Pharmacists, and in her role as acting state program manager at the Center for Integrated Health Programs in Kaduna, she provides strategic leadership for various public health initiatives, including overseeing a team of experts implementing comprehensive HIV treatment programs across 56 health facilities in Kaduna State, Nigeria. Being a congenital amputee, we never know, has propelled Samuel into advocacy with the vision of inspiring amputee children to the actualization of their fullest potential and igniting in them a strong sense of belief. We have a fully productive, exciting, and impactful life. Her hobbies include reading, writing, and sewing. And it's quite interesting, but I don't know why she didn't mention this, but her favorite color, and it's also a hobby, is purple. Yeah. So you always see Sanam in purple. Ladies and gentlemen, please welcome pharmacist Sanam Hayat. Excellent. So I'll call her able panel, and I'll start with Dr. Chukwu Gozie Uja. He's the Deputy Director, Community Prevention and Care Services, National Agency for the Control of AIDS. He graduated from the University of Nigeria in Nsukka with an MBBS in 1999 and proceeded on house jobs in the United Kingdom. Following on from his training as a colorectal surgeon, he commenced with subsequent admissions to the Royal College of Surgeons of Edinburgh. In order to increase the experience and further his career, Dr. Uja gained admission at the University of London, Queen Mary and Westfield College to study a master's in medical law and ethics. The area of consent and the Health Act were his areas of specialization. A scholar at the University of Oxford, Blavatnik School of Government, he returned to Nigeria in 2013 and has assumed several roles. Dr. Uja also oversees the development of the country's national strategic framework and plan for HIV/AIDS. He has gained experience visiting nearly all the states in Nigeria and understanding various cultures. He has continued to interact with people living with HIV, civil society groups, and healthcare workers, and continues to provide leadership in community prevention and care services. Ladies and gentlemen, Dr. Chukwu. He's also representing the Director General, Dr. Temitope of NACA, Dr. Temitope Lori. Excellent. So we have next on our panel, really a consistent face that we always see and always has insight. That's Dr. Jerry Guama. He's the Deputy Director for Programs, CDC, Division of Global Health in Nigeria. Dr. Jerry is a family physician and public health expert with over 29 years working experience in the health sector, ranging from clinical care provision to management of public health programs, including maternal, newborn child, and adolescent health, sexual and reproductive health, tuberculosis, and HIV prevention care and treatment services. He is, I mentioned that, he has supported both PEPFAR and the government of Nigeria in development and coordination of HIV and AIDS prevention care and treatment programs, including the development of program policies, guidelines, procedures, and strategies over the past 70 years. Ladies and gentlemen, let's make welcome Dr. Jerry Guama. Next on our panel, one of our guests, all the way from the United States. Okay, no, I have this first. We have, so scratch that. Now we're back to the Assistant Commissioner of Police, Dr. Jose Salami. So the lady in uniform, and isn't she lovely? She's a graduate of the College of Medicine, University of Lagos. She is the Assistant Commissioner of Police in charge of the police medical in Lagos State. Dr. Bossa is also the National Program Officer for Police Action Committee on AIDS and HIV-related cases, and the chairman of the Committee on Police Affairs, National Medical Association in Lagos. She is a member of the International Association of Chiefs of Police, Virginia, United States of America. She's also a member of the Lagos State Implementation Team on Harm Reduction Program, and a member of the Lagos State GBV HIV Response Team. Dr. Bossa Salami, ACP, is from Washington State and happily married to a Lagosian with children. Ladies and gentlemen, please welcome ACP, Dr. Bossa Salami. Thank you so much. Awesome. Next. Oh, yes. So this is the visitor from the West. We're calling on Carmen Hampton Julius. She serves as the CEO of Paul's Incorporated and Palmetto Family Service Center, LLC. In this capacity, she provides executive leadership to a team of health and human services professionals. Carmen is a licensed independent social worker with extensive experience in clinical and advanced practice. Mrs. Julia earned a Bachelor of Arts in Rehabilitation Counseling and Psychology from Wilberforce University, Ohio, and a Master of Social Work from the University of South Carolina. She has also earned certificates in nonprofit management from Winthrop University, South Carolina, and health executive leadership from the University of California at Los Angeles Anderson School of Business. Carmen's work focuses on vulnerable populations, including women of color, LGBT communities, incarcerated individuals, and unsheltered persons. She has authored peer-reviewed articles actively contributes to relevant research. Carmen has received several awards for her work with HIV, human trafficking, and community health. Ladies and gentlemen, welcome Carmen. Happy to be here. The next on board, next in line, is Idala G. Joseph Andrew. She's a dedicated health professional and advocate with over 7 years of experience in public health, focusing on holistic prevention and community health. Currently, she serves as the Prevention and Community HPS Key Population Associate at the Center for Integrated Health Programs, where she oversees initiatives aimed at improving health outcomes for key and vulnerable populations in CI3 supported states. Idala currently holds a master's degree in psychology from John Moore University, Liverpool, a certified project management professional holder, leadership in health management from the University of Washington, and a bachelor's degree in entrepreneurship and business management from National Open University. Her work has been instrumental in the development and implementation of community-driven approaches in HIV case finding, prevention, and gender-based violence among key and vulnerable populations, including adolescents and young persons. Idala is an active member of several health advocacy groups and key population collaborations, and has collaborated with various local organizations towards policy formulation, capacity building, and work on other projects. Ladies and gentlemen, make welcome Idala G. Joseph Andrew. All right, thank you. So let's get started with the panel. So
thank you, everyone, and you're all welcome to this interesting panel session. We're going to be talking about community strategies to reduce gender-based violence among adolescents and young persons in Nigeria. And I'm actually excited to be moderating or facilitating this session because I know that personally I'm going to learn a lot from the panelists, from the vast wealth of experience that I can see on this panel. And I'm also sure that by the end of this panel session, we'll have action points because I believe that we should be the change that we want to see. Yes, so we're talking about adolescents this morning. I remember recently one of the girls, adolescent and mentor, called me, and we usually have these checking calls like every week or on a bi-weekly basis. And then I was become sorry, she said she was depressed because was talking to her, making her do things, or trying to convince her to do things she does not want to do. And so that's what making her depressed. She was now having self-esteem issues. You know, he was trying to coerce her into some sexual acts. So of course I listened to her, counseled her, you know, and also linked her up with a youth counselor. So of course, adolescents can also experience intimate partner violence. That's where I'm going to. And research has shown that intimate partner violence still remains a key driver of the HIV epidemic in Nigeria. You know, from program data, we can see that. And then, you know, if there's intimate partner violence, will now can also prevent access to HIV services, treatment services, and even other support services like PEP or PrEP. So there's this intersecting vulnerability or intersection between IPV and HIV. And of course, we know that this vicious circle is harmful to our community. So I'm really excited that we'll be talking about issues on how to deal with these intersecting vulnerabilities. And you agree with me that we will need a multifaceted and comprehensive approach to this. So, social stigma is also an issue that adolescents face, and they also face gender norms, gender stereotypes, gender stereotypes that are perpetuated by gender norms, cultural norms. So I would like Carmen Ma, from your experience in the community, can you please tell us just talk about the role of social stigma in perpetuating both IPV and HIV within vulnerable populations in Nigeria, like the adolescents? Or just share your experience, vulnerable populations, yes.
In the United States or in South Carolina, I think that exactly what you said, that social norms often prevent persons from revealing that they have been sexually assaulted. And I think a lot of that is connected to the fact that we have an image of perfection. So if you were sexually assaulted, it is somehow your fault. Often the victim is treated worse than the perpetrator. And that prevents people from reporting, that prevents people from getting assistance. We know in the United States or in South Carolina, about 1 in 4 women between the ages of 14 and 18 will be affected by sexual assault or gender-based violence. We know that is only the tip of the iceberg because it's not reported. Because we have the social norms that the power dominance belongs to the masculine, that there's, you know, in any relationship, the power dominance belongs to the male, that the woman should submit, that the woman should be submissive. That also is a factor in gender-based violence. So those are some of the things we're seeing: social isolation, you mentioned depression certainly from previous traumas. Again, the trauma of sexual assault does not end when the incident ends. It follows the person sometimes for decades, sometimes for the rest of their lives. So all of those things have. And another social norm that we need to talk about is gender equity. That's something that is not being really addressed. It must be addressed systemically, that we have equity between genders.
Thank you so much. It's actually interesting to note that it's the same for us to hear in Nigeria. Some of these cultural norms, gender norms, actually perpetrate patriarchy, okay, which supports gender-based violence, and then now brings the social stigma so that people are not able to come out, like you said, because they now make themselves the victim. Meanwhile, they are survivors, and a harmful act has been perpetrated against them. Thank you so much for that insightful contribution. Now, Idala, what are some of the targeted interventions for key populations? I know you work in that space and you are an advocate for them. So can you just tell us more about some of the targeted interventions for key populations such as LGBTQ plus youth or individuals living in high prevalence areas that can help tailor prevention efforts to those most at risk?
Okay, so we are looking at private services that are targeted towards the LGBTQ persons and other population members. Now we need to know that in having or in providing services to them, it has to be tailored to different typologies or to different types of the population that we identified and to be in. Now, what we have to now start with is the engagement of peacekeeping-led CBO, train them to be well equipped to provide them the different tailored services. For example, the efforts of the outside the case finding, aside pre-exposure prophylaxis, we have services that like cervical cancer screening. We have services like menstrual hygiene. So even for the MSN, aside that of case finding, there are things that security issues that would also have to, so we also have to provide that kind of services to them. We have genital wax screening. For that with the PWID, there's also that of harm reduction intervention to help reduce cases or to help reduce the high prevalence among these typologies that we have seen. And also because we've also engaged this this community organization, they help us to give us a wider reach or give us a wider coverage in identifying them and also providing them with these necessary services to reduce their risk of HIV infection among the community.
Well, thank you. So can you just also tell us more about social stigma that are faced by these key populations and what interventions can also be done to address this, especially because, you know, when it comes to key populations, there are a lot of cultural norms surrounding, you know, key populations.
Social stigma is something that will continue happening, but unless we demystify this, the person or the perpetrators doing this stigma. Now, there's going to be, or we need to increase the awareness to tell them that in as much as we've identified the person to be members of the key population, there is no reason for you to stigmatize them, because we want to know that these people are human beings, first of all. They share blood, just as you share blood. So if you're human, just treat them as humans, see them as human first, than seeing them as just what they identify themselves to be, or who they are, or what they engage themselves in. So that's just how we have to increase the awareness, demystify the needs, because again, why we are stigmatizing them is because of the needs they have, or because you're a key population, you're going to die of AIDS. You know, not everyone is infected by HIV. Not every one of them is promiscuous as they see them to be. Most of them are even thinking, most of them are, as much as they can, they protect themselves to not expose or not put themselves at a high level of exposure to the HIV infection, or to even other triggers or other cases of GBV, or even let's say cases whereby we put them at risk of their own safety for themselves here.
Wow, thank you so much for that insightful contribution. Yes, you're right. Key population, you know, we need to educate people and empower people. People need to understand that. I like what you said about everybody has, you know, blood, everybody's flesh and blood, everybody's human, and human value is equal, and every human being is equal, of course. And so every human being should be able to have agency and be treated, you know, with the respect and dignity that that person deserves, simply because that person is human, irrespective of all the categories we may want to put people in, irrespective of all the labels, you know, all the boxes we may want to put people in. A human being is a human being, and that human being deserves dignity and respect simply because of that fact. Thank you. So let me come over to this side. Oh, wow. Sorry, I don't know. I have females here, ladies here, and men here. It was not intentional, please. Okay, I'm not biased. Okay, so let me come over to the side. Dr. Jerry Sam, you've programmed for years in Nigeria. So I will talk about the intersection between HIV and IPV and why we have to program simultaneously for both. So how can the intersection between IPV and HIV prevention strategies in Nigeria be leveraged and integrated? How do we do that to create more effective intervention?
Thank you very much for these questions, and good afternoon, everyone. So the thing about IPV is that it's the worst kind of gender-based violence because it's being perpetrated by confidence people who are supposed to be protecting the person, they're the ones actually committing the heinous crime. And so that is really a very bad situation. So what I see is that it has already, it impacts the HIV program in ways. One, it actually just reduces the partners or the survivors' ability to negotiate sex. Again, violence in that sense also kind of makes them reluctant to disclose their status for fear of further violence if they are HIV infected. That in turn perpetrates transmission of HIV, which makes the situation worse for the country as a national program because we are aiming to prevent HIV transmission. Again, IPV tends to also inhibit, discourage adherence to actually interfere with adherence for those who are on treatment. For fear of violence, people who are infected do not only not disclose, they can actually, they are afraid to even show their medication because that would make questions and eventually some other issues of violence. So that is very difficult. On the other side, HIV has a way of bringing more trouble for those more violence than the infected persons. In that, if they're infected with HIV and they just disclose their status, it's presumed that it's because of their promiscuity, and that partner may want to again beat them up. In some instances, we've heard of women actually being sent out of their homes, sent packing from their house. So again, that makes disclosure more difficult and really creates a situation where we can't intervene appropriately to stop or break the chain of transmission. So for us to really be able to intersect appropriately in programming, we have to design our programs such that we are able to screen for violence or signs of violence early. Particularly starting from the health providers, I will say that. Again, in that aspect of clinical care, whether it's HIV testing services, whether it's prevention services, PrEP, in other words, or post-exposure prophylaxis, we need to always think about asking those questions, whether it's in providing care and treatment. And healthcare providers have to be friendly and not create a conducive environment for survivors of violence to be able to talk about it, so we can intervene early and really break that cycle of violence. The other way is intervening, particularly for adolescent and young persons, to empower them to be able to speak up against violence if there is any sign from intimate partners. Empowering them means giving them good sexual education, giving them also some of the things we talked about earlier. Training, vocational trainings that empower them to stay into house, for instance, to be able to really think for themselves, and they are more independent of their spouses, so they can actually speak up. Because sometimes the fear of being thrown out keeps them from speaking, or being, receiving further violence keeps them from speaking because they are dependent on these persons for their livelihood. But if they have the opportunity to be empowered, they will not. And so those are some of the programs we can build into help empower them. The other part is, what about how did this violence perpetrator become one? Do we have a false? So we talked about socio-cultural norms. That means we need to address beyond the persons involved. We need to also address beyond the survivor. We need to address our socio-cultural systems. Who are the custodians of our cultural norms and values? Usually our traditional structures and our faith-based structures. And to some extent, government creating the enabling law environment. So we need to also advocate for those to make the change. We will also need to engage the law enforcement agents, as has been said earlier, to talk about how to handle cases of survivors of violence so that it's less difficult for them. It makes it easier for them to actually disclose when they are going through violence. And then that is something that will help us intervene appropriately across our programs that we are supporting to prevent both IPV as well as HIV transmission. So that is very critical. Thank you.
Thank you so much, sir. That was really profound. Yeah, early screening for IPV or GBV is cheap. You know, routine screening, and like we say, even for diseases, you know, if you cannot prevent it, okay, the next best thing is early detection. So I think, like you said, interventions that ensure that people have access to routine screening of IPV so that it's detected early and they are provided with the interventions that they need so that we can prevent, you know, fatalities and so many other harmful things, you know, that happen when we allow GBV or IPV to linger. This brings to mind something that happened like a few months ago. We're doing the drive for IIT, that's interruption in treatment, and a particular client was reached, you know, and upon counseling, we discovered that they were both positive, both she and the husband. But the husband, you know, again, cultural norms, gender norms, poor health seeking behavior of men, he refused to come to the facility to be enrolled. So each time she comes to the facility and she gets her ARVs, then she goes back, he will steal it. Yes, so it's either he steals it. Initially, he was forcefully taking it, but you know, because she was told about the importance, she started hiding it. So she will now look for where, you know, she hides it, and then also and then steal it. So of course, through counseling, she was linked up with a GBV focal person who counseled her, and through the faith base, because you know, you talked about breaking down those cultural norms through work with faith-based organizations, we were able to reach the spouse, and he gradually, eventually accepted his status and has agreed to be enrolled. So at least now everybody has his or her own part of ARVs. Nobody is stealing another person. So thank you so much, sir. Let me go here to the police. Police is your friend. Oh, and family. Oh, wow, they've added that. Police is your friend and your family. Yes, Dr. Salam was there. Yes. So my question for you is, we talked about importance of education, you know, and empowerment programs. So can you just shed more light from the angle of the police? What do you think we can do from that angle, you know, to educate and empower people in breaking that cycle of violence so that we can improve access to healthcare for individuals that are affected with IPV and HIV, or you know, both? Yeah.
Good afternoon, everyone. Just to say something, the moderator mentioned earlier on about a 16-year-old girl that was depressed. So I want to tell you a short story. Sometime last year, a 16-year-old girl was brought to the hospital. She attempted suicide because her boyfriend broke up with her. I think this was prior, some days before Valentine's Day. So we're able to resuscitate her. and she was fine. But before we could say anything, we saw police officers in the hospital. They came to arrest her. I don't know if we are aware that suicide is not a crime in Nigeria, but attempted suicide is a crime. Are we aware? So imagine that. So it took me going to the commissioner of police, now AIG, that I don't know. So this is somebody that definitely has mental health issues. So I think our police officers will obey everything in the police rules, police act, we obey. But I think also we should also work with the policymakers. These laws should be reviewed. I feel somebody that is attempting suicide is not okay, needs help. So that's just to diversity. So for interventions from the police officer's point of view, I would also like to say that you can't give what you don't have. A lot of police officers are actually not knowledgeable when it comes to GBV. Say for a few of us that, with collaboration with NGOs that have trained us. So I think there needs to be more collaboration with NGOs and organizations that promote GBV, promotes in forefront for gender and domestic based violence, so that you can teach the police officers to be more gender sensitive, to have a more trauma-informed approach in handling such cases, such as empathy-driven. They should respect them when they come. There should be confidentiality, and then uphold the human rights of these persons. So once you do that, I'm sure there's a change. We are taking baby steps now. We will get there someday. Then also as police officers, I think we should be able to use our community policing initiative to also contribute our quota to bring in interventions to this. Take, for example, as a police officer, we know that effective community policing advocates for trust. The community will be able to have trust in the police. When the police is seen as people-friendly, then these victims will be able to come to the police stations to report cases. They will know that they have an ally in the police officers. Also, we can also take it a lot higher. We can engage students in schools when we conduct town hall meetings. We do that actually, town hall meetings involving all stakeholders. When they come together, we talk about issues of GBV. From there, we'll be able to know which areas are high prevalence of GBVs. Then we can increase our patrol and surveillance to such areas. Then also in schools, we can have meetings with school administrators, teachers, advising them to include GBV in their school curriculum. We will also advise to include talks on sexual health, safe relationships, consent, and then teach them about the existing laws, about their rights, and then how to make reports when such happens. We can also engage the media by going on there talking about domestic gender-based violence, to talk about the consequences of GBV, to talk about the penalties, to talk about how to make reports of cases, and also give them emergency helplines. In Lagos State, we do have our emergency helplines. Currently, we're currently constructing and remodeling a SAC center where we'll be able to logistically attend to GBV issues. This center will both the clinic, the mental health unit, investigative sessions, administrative sessions, legal sessions, and shelters for the abused. So we hope that this is going to be replicated in other states in the country. So we're not there yet, we will get there. Please bear with us once again. This is your friend and family.
Thank you so much. So this is your friend and your family. And yes, I agree with you, we're not there yet, but the important thing is that we make progress. So and I think that gradually we will get there. Now just to, add to what you said, I remember when we started programming for GBV in Katsina State, when we started integrating it into our HIV programming. We had, trainings for police, and we had to, when we told them about the importance of PEP, PEP needs to be assessed within 72 hours of exposure so that we can prevent HIV transmission. A lot of them were shocked, so, and that actually changed the tide for us. We now have people that, once that rape or sexual assault is reported, immediately, after they do the preliminary documentation, they refer, in fact, sometimes they escort to the nearest facility for PEP before they now go back, to complete whatever documentation or whatever case they want to have against that person. So yes, empowerment and education of all these people that involved, we actually help us in this fight against IPV and gender-based violence. Okay, so, Dr. Ujang, this next question is for you, coming from NACA. Can you describe the potential long-term benefits for public health in Nigeria by taking a comprehensive approach to tackling the intersection of IPV and HIV among at-risk populations? We've talked about a lot about how IPV and HIV intersect, and we've talked about the benefits of this multifaceted approach. So, what are the potential long-term benefits for public health in Nigeria?
So, good afternoon, everyone. I'll start with that. Everybody at this table has spoken. The problem comes when you start to have a session after lunch, and most of us are still sleeping. So I'd like to gist the way Dr. S said to gist my response. I say that in jest. I think that, thank you very much for the question. When we talk about the long-term benefit, I think you need to start somewhere. Over lunch, I was having a chat, and I said with actually the family and friends, and I said, without knowing where she went to school, that if I want to institute change, I'll start by, and with all due deference to Dr. I'll start by abolishing single-sex schools. I think that we need to integrate, we need boys and girls to know each other from a very young stage of age. I went to a mixed co-ed school where, growing up, you had to make sure your shirt was man because you want that girl to talk to you. Yeah, you're comfortable in the other person's, the other sex's space. It helps because it also helps with, this gender imbalance and the power disparity that kind of exists at times. Because men will always feel thinking. But if, there's some girls I talk to now who went to my secondary school, what can you say? We all grew up together, we saw each other. We just it helps if you start at that stage. And, the long-term effect is such that people are confident, females are confident, males are confident because they know each other. There's that confusion that sets in, and I know we're talking about adolescents and young, the youth now. I don't want to say boys or girls because you've really boys on one side.
Sorry.
The thing is, there's always a confusion that sets in around adolescents when we approach puberty. I'm not quite there. And people don't know how they identify as. Am I pure male? Am I something between? I think that some people are alpha males, that some people are alpha females.
you want to be able to be comfortable to express yourself. Coming to the government of Nigeria, and if we talk about NACA, looking at HIV program and the long-term impact, I think it stems from, there's that saying about the little goat that looks at the older goat and how they chew. We need to start, and then they'll chew the same way. It's said in people, I don't know who the people folk are here. They say, or something like that. Yeah. So, did I get it right? Yeah. Okay. So remember, it's not so we need to institute change. We need to be able to say that we're going to put forward an enabling environment where people are safe to come and express themselves. We're going to protect them. We're going to believe them. I think one of the problems that we find is that people will report, and the first thing that they're told is, what did you do? Not how did somebody do that to you? How did you allow yourself to be in such a place? And these things start small, and there are long-term effects that, there's no confidence in the system. So what we have to do, let me use that opportunity to mention that there's a short code number that anyone can call in to ask any question with respect to HIV. So I want to be able to say that we can empower people with information. If you give people the correct information, it has a long-term benefit of correcting those myths, busting those stupid things that we have, ingrained in society. So we have to start small. It's not there's no quick fix to it. And I like the term, the long-term effect. A healthy society is a wealthy society. Well, how are we going to make ourselves wealthy if we haven't started from the unit and say, okay, people who live with HIV, have they been tested? Do we know the numbers? Are we able to say that in the long term that the numbers are going to go down? Because we placed everybody who is positive on treatment. We have also looked after the key populations, and we have to be. I know that I speak for government, but we have to also be real, and that's why I said I'll just like there's no point burying your head in the sand about certain populations. They do exist. It's better that you accept that they do exist and you program towards them so that you can protect future generations. Because if you think about it, we want to keep, and it was going to be one of my parting words, but I'd like to make sure that happiness remains happy, that she doesn't become unhappy. Because that is the next generation. So if we can at least tailor our programming towards key populations, if we can have preventive mechanisms in place, preventive programs, we have about 4 or 5, sort of prevention pillars that we program for in the country. We think we use things like condom programming and read them, because Professor was very, he said it's used for pleasure. Anyway, but when you're doing that pleasure, please be careful, because that is one way of preventing the next generation, future generation from getting HIV. We have key population-based programming. We are targeting adolescents and young girls. We're also targeting adolescents and young boys. And before we talk about the biomedical aspects, where we talk about PrEP and PEP, these things have long-term benefits, but we have to, first of all, accept it. We have to educate ourselves and make sure that we've got appropriate information for ourselves. And once that is taken on board, ensure that the long-term thing is that we'll be ahead of the curve for that scourge of HIV that's affecting the nation. Thank you very much.
Thank you so much for words of wisdom. So yes, there is a potential long-term benefits. First and foremost, we have to accept it. I like that. There's no need burying our heads in the sand. We need to accept it and then program for it. And like we've established already, you have to be a multifaceted approach. Okay, so that we are programming simultaneously for IPV, for HIV, and other intersecting vulnerabilities. Okay, so we are running out of time. So for the panelists, just 1 or 2 sentences. How can we hold ourselves accountable? Because we need an action plan when we leave this space. So let's start with Idala. How do you think we can hold ourselves accountable?
I wanted to go first.
Oh.
So a way we can be accountable is when we have set measurable goals and regularly assessing all of these goals. Ensure that there is also a way of keeping track of what we have said and what we say we're going to do, and also ensuring that we maintain a transparent communication with this community that we serve, to tell them that, okay, this is what we said we're going to do, and this is how we're doing it, and this is where we are, to ensure that, yeah, this and this and what we do, and this is where we are. So we are also open, or you also use open to other innovative ideas from other people to try to strengthen what you're doing or your services, so that you can be able to provide appropriate services and tailored ones for them or for the different populations.
Thank you. Communication. Ma'am, how can we put that something?
I think we all need to take into consideration our own internal state, the internal state we have about mental health and mental health issues, about issues like depression, and about our ideas of what intimate partner violence looks like and what healthy relationships look like. We have to educate ourselves, our family, our friends about what a healthy relationship is and how to sustain healthy relationships. I think again, as a society, we have to work on gender inequity. We need to make sure that we understand what that is and how we can address it.
Wow, thank you. We have to start with ourselves because we cannot give what we don't have. Account with ourselves, your friend.
Police, your my family. So how can we hold ourselves accountable as police officers? I think we owe it to those victims that come to us to seek for our help. When they come, we should be able to carry out very impartial investigations, gather enough evidence so that we can put the perpetrators and make them pay for what they have done. So please, like I said earlier, we are not there yet, but we are doing everything possible to make sure that we put an end to this pandemic or epidemic of gender-based violence that is rapidly killing our adolescents in Nigeria. Thank you.
Thank you. We're not there yet, okay, but at least we're making progress in the right direction. So, we've heard how to make ourselves accountable. So, can you just help us paint the picture? Because, you know, when you have a bigger picture where you can see it, it's easy for you to walk towards it. So, what does success look like for adolescents and young people's health in Nigeria?
So, I have dreams for it. Do you understand what it means? That is really my dream, actually. That dreams is achieved by every adolescent and young person in Nigeria. In other words, they are determined, resilient, empowered, mentored, and safe. And this means a lot of work for all of us, everybody involved. Starting from those of us in programs that we plan with them in mind, as we've already discussed here, to make sure that we mainstream all we can do in terms of IPV prevention and also IPV plus IPV or GBV care, and also again engaging the communities to make the change, the social cultural changes that will eliminate all of this gender-based violence. We need to make sure we are doing this. And of course, empowering them as a sub-population themselves to stand for themselves, to be able to defend for themselves, to be able to speak up in situations where they think they are being violated in any way, or they are being violated, so that it's prevented appropriately. So basically, making sure that we have a safe environment for them, whether it's legal and policy environment, all of those, and then also cultural background or environment. So it's all up to us to make sure that we actually are determined, resilient, empowered, mentored, and safe.
Well, thank you. So we safe environment for our youth and adolescents. Any final words for them?
Okay, so I think can we stop looking at this as us and them? When we say that we're programming for them, or we have them in mind, why can't they be the ones to program? You can't tell me that you come to my house and tell me that I need X, Y, Z. I will tell you what I need in my house. Involve them in your program. Let them be the center. Let them be the ones to say, I want X, Y, Z. The only thing that we can do really is to say that with the benefit of experience, that what you're thinking may not work, but let it come from them. Let it not be prescriptive. We can't be loading ourselves over there and saying we know what's right for them. We are the ones that know what to do. That's number one. The second thing, and I like to champion that because I've had personal experience of it. I've never said this anywhere. We see that thing called mental health, it is real. You can go to the pubs, in this country we call them taverns. You can go anywhere else and you can use anything as an outlet, but you know what? That thing called stress is the beginning of depression. That thing called sniper, people actually use it. And people have been guilty of the suicide. They haven't been guilty of that attempt, they've actually succeeded, committed suicide. So we need to embrace mental health. And let us also embrace the youth and say, we understand what you're going through. That's the only way that you're going to affect change. And once again, please involve them, let them be the ones to do the work. They will always look at you that there's a subtle, non-altruistic reason for you to embark on the program. But if they're part of the program, they will know that they are the ones that are going to plan. And, you know, one last thing. The sooner we start thinking, you know, let's not just take the things from other clients. Somebody who's 16 or 18, let's say if you're 18, you're responsible enough to hold office. Don't look at this way, you're a small boy, you're a small girl, what do you need? Or what do you know? I'll tell you what you know, I'll tell you what you need. Let us treat them as, you know, people who are upcoming, who have the future in their own hands, rather than us handing it over to them. Thank you very much.
So in conclusion, we have so many take-home points from here. Early screening for IPV or GPV is key. Okay, we need to detect it early so that we can provide interventions on time. Empowerment for all stakeholders, education for all stakeholders. We need to also realize, like she said, so this is your friend and your family, okay? We're not there yet, so we're making progress. So, and then let them program for themselves. A young person reminded us that they're not just the leaders of tomorrow. She said they're leading today too. So let's remember that. They have agency, so let's treat them. Let me even stop saying they. Adolescents and young persons have agency. So let's treat them with the dignity and respect that they deserve. It's been an absolute pleasure moderating this session. I learned a lot and I hope you did too. Thank you so much.
Thank you so much, So the time has come again for us to interact. Just another round of applause. Haven't they done an excellent job in a very short time? So we're going to open up the floor for a few comments, questions, so the panelists will remain as the moderator, just in case there are any direct questions to you, and then we can tackle that. So any questions, comments? Yes, I can see. Oh, wow, you're in for it. Okay, so let's go. So I'll take you first. Sorry, first.
Good afternoon, everyone. What an interesting question and a very well contribution from the panelists. So, from Vidala, am I correct? Joseph Andrew, I was expecting much from you on the gender-based violence faced by the LGBT community, because I'm trying to see that what protection measures is being put in place to secure the life of the key population who openly express their sexuality in the public. Just a few weeks ago, we heard about the Mama area, Abuja Mama area that was killed within the Abuja city, and also another news after that was 2 days after the Abuja area Mamas for the victim. So the national chairman of the KK population was also killed in Benue State with his two other staffs. So, and I believe this came up because people were public figures. So that is why you can hear about it. They can believe that a lot of things be happening within the LGBT community. So how do you think how can you initiate protection measure for the kid population so that they can be prevented from the public harassment and also from harms? And I also have a question for Dr. Bola Salami. What measure of security or safety do you have in place for the victim who reported rape cases? Because I believe that most people or most people who are proved for victims of rape, they are being afraid to come up to report rape cases because they believe that if the case is not well handled, the perpetrator can easily come back and retaliate on them. And I've encountered a case in the community whereby a 12-year-old girl was raped. And we tried to follow up this case with the family of the girl and they say no, that they should die it off. But we insisted. So before we do they feel out from the community because they are afraid that if this case is followed up and the perpetrator is being captured, maybe at the end of the time, the perpetrator is being released, so he definitely come back and revert back to the victim. So what security measure do you have in place to ensure that the victim life is being saved when they report their rape cases? Thank you very much.
First of all, I hear a lot of murder. We're not really doing about it. People are making it a crime. I think that's the first thing. People should not be just killed, on the street. So I'll let it down and speak. The police is here, friend and family. We need to know why are people being killed. There's no justification for anyone, no matter what, to just be murdered. So thank you for bringing those things up. Thank you.
Okay, thank you very much. And yeah, I can talk about, I really want to talk about, I will talk about it, well, in talking about it, I'll talk about my own experience. I have been raped earlier, and when I was raped, the police couldn't do anything. They even tried killing me from me. So when coming upstairs, I saw her, I had past trauma, just pictured in my head, and I tried calming myself down. So now for that of area mama, we know in the community that area mama till now, the police are still trying to be hesitant not to even push further towards it because she's of the LGBT community. The society or the Nigerian society does not support it. They say, or comment has been said that she deserves what happened to her. Even our KP's head, so also they are still making some comment that he caused his death. But no, it's not supposed to be so. Now, in this kind of case, what we as LGBTQ persons have to do is to increase our safety and security for education and measure to ensure that we don't put ourselves at risk. There are places we know we can't go, so we should refrain from going to those places. There are things we can't do because if you are and are true to yourself in being an LGBTQ person, even in Nigeria, you know that there are some certain things you cannot do. Especially when you are very expressive. Some people say when you're gesticulating, you have to be very careful as to who you mingle with and who or where you stay at. Unfortunately for Area Mama, where she stayed at wasn't a very conducive place for her. But then again, it was what she could afford. But she felt safe in her place. But it was because she went to meet someone to sell what she was providing her services to, then that was her short. Now, we'll still say this, we'll try to, as much as we can, to keep a strong collaboration with the police to see how they can help in situations like this, because this is a human right violation. You have no right to kill anyone. Everyone deserves a right to live, a right to express themselves, a right to even vote too, and a right to be who they truly want to be. Because if you look at it, people, or if, I'm sorry to use the word, for lack of better word, ignorant people always want to tilt towards the XMPA law, but XMPA law never says that it's a crime to identify. It's just talking about same-sex prohibition act on the marriage itself. So we have to still continue to have strong collaboration with them and also identify organizations or motivate organizations that are very equipped to know to help tackle this kind of situation. And when you're reporting this case, they're able to take it up and try to ensure that your own rights are being seen and are being heard, and your voices are also being heard and not trampled upon. Because in Nigeria here, I am sorry to say, if you're a member of the LGBT community, you have no money, you have nobody, you are nothing, you're done from the country. Let's be honest. So that's what we just have to do. Increase the awareness of safety and security, to keep on strong collaboration with organizations and also the state actors to help to help tackle infringement of our rights as persons. Because like I said, we're human beings first before any other thing. Well, one. So don't see because you're a heterosexual or heteronormative man that because I'm homosexual or I'm from LGBT community, I have no right. I still have a voice. I have an ability to contribute to that, to contribute to the country that we're in. We have. If you see yourself as a member of the LGBT community, or if you identify yourself as a member of the LGBT community, you need to know that you have so many potentials that you can bring to the table. Forget the fact that the society sees you as just one being. See yourself as more, and you'll be more. Thank you.
Thank you so much, Ivana. Dr. Wapek.
So, your question, how we can ensure safety of victims of rape when they report. Well, I wouldn't want to talk about other states, but I'll talk about Lagos State where I am serving. I know that in Lagos State we have laws that are investigated in the states, and the police is forefront in promoting this law. We have the Domestic and Sexual Violence Agency that partners with the police for prompt reporting, investigation, and prosecution of the perpetrators. Like I mentioned, the police also has the gender-based center. We have officers that man that center, that are investigators, that are lawyers, that are social workers, we have psychologists, we have the medicals, that we try to give holistic care and support to the victims. We also engage in efficient referral systems where the victims are taken to homes. And then also, for example, the one I have done, I know that there are instances where we keep the victims in my hospital, give them their food, feed them, clothe them, while the perpetrators are remanded. So in Lagos, I can talk for Lagos, I don't know about other states, but I know that the police will definitely do something. I don't know if that's okay.
Thank you so much. I have comments here, right here in front, and there's another one, and then there's another one. So that's three. So I'm taking three. Any more hands? So I just count. Well, I've gotten that. That's 4, 5. So I've ended 5 comments. So number 1. Go ahead, sir.
Okay. Okay. Thank you very much for the very instructive conversation. My reflection is actually on the point concerning early screening or screening and early detection of IPV. I'm wondering how many of our public health facilities are equipped with the tools, maybe the skills to be able to do routine IPV screening. Because based on the WHO clinical guideline for routine screening, it specifies that facilities must have certain standards to be able to do that. And that is the entry point for addressing issues related to IPV, including reproductive function. So rather than wishing so the facility is really ready to be able to accommodate or be able to, respond to these issues we're talking. So that I don't want to be deceived by the balance of we're making progress. I want us to come back in the 5th annual scientific roundtable series or conference, and we're saying we're making progress. This progress will be measured. So I really want my two big government people to support us with that response.
Thank you so much, sir. That's so passionate. But one of the things I think is he's ready for the 5th annual scientific record. And I'm excited about that. The round of applause. So our Dr. Jerry will make quick comments to that, but let's hear Dr. Francis's comment so that they just align with the camera. So really short and sweet.
Very good. First, I want to thank all the panelists for the enriching session. I also want to commend Dr. Bosse and the Lagos State Police Command. They've actually done a lot. CIP had collaborated with them to train officers on GBV response, I think last year. But my question for Dr. Salami is the police considering incorporating GBV response into pre-service so that officers that are coming through training actually equipped? We've identified the gap, but how are we trying to capacitate the next generation of officers? Thank you.
Thank you so much, Dr. Francis. He also was part of our SCOPE project that also focused on training pre-service health workers, and that really went a long way in how they work post in their practice. So Dr. Salami, keep that question. We'll come back to so you can respond. Number 3, that's about Nirela. Madam Amba, the question, please.
Okay, good evening, everyone. Dr. Francis, thank you. You just asked my question, so I will ask that again. I'm just going to say my comments. Thank you all. I quite agree with all the comments because in this session we were looking at community strategies and in reducing gender-based violence. And as a community worker who works in the community, I also think that one of the things that it's important that we must look at, and we have actually from our end started working with, is not ruling out issues around faith-based in reducing gender-based violence. Because the truth is, a lot of gender-based violence happen in the faith communities, whether in the church, in the mosque, and thereabout, and a lot of religious leaders, because they want to keep the name, the identity, they tend to, let's keep it close, let's settle it amicably. And you see that this is reoccurring, like we said, because there's nothing being done to it, it's being covered, and it will happen again and again. So I think that it's for us, one of the things we started doing was to consciously start training religious leaders on reducing gender-based violence and looking at the right approach, looking at the law aspects and bringing it also the mental health into it. This also as we go a long way to help in reducing. And another thing also where we also need to consciously look at, I know we are doing a whole lot of programming for our girls. Now, when we have done all that for our girls, who are we preparing them to in the future? Now, what are we doing? There's not so much like we are doing for our girls, our young girls, like we are doing for the boys and men. And those are the perpetrators. Now, after we have trained our girls, be a good girl, be this, they are decent. Now, who are they going to meet? Because they will definitely have a boyfriend tomorrow, they will be married tomorrow. And it's those boys that we have left behind that they are going, those will not be, I'm sorry to say, the monsters that they are now going to meet. So I think our programming also, the same way we put those strong energies into programming for young girls and adolescents, it's also the same way we need to program for men, young boys and men. Thank you.
Thank you so much, Madam Namba from Venezuela. That's one of our partners because we identified that we can't do this our community work without the religious leaders. They are the gatekeepers. So we collaborate with Venezuela and across our states to help support our community project. But just to mention, I think the reason why there was this focus on the girls. Well, the disparity was so wide. So I think what we're trying to do immediately was to try and close that gap. But it seemed like the gap is not yet closed. So I think that's why I'm saying that. Okay, so if we're trying to first of all close the gap, then we now know, okay, the boys and the girls are on the right footing, then we'll take them together. I believe that is the next phase in the journey of reaching adolescence. So let's put that in perspective. But it's also what you're saying is very important. On the project, we're also thinking about that because the no means no focuses on both boys and girls. If you heard during our presentation, our hubs, we're thinking about that already. Dr. Dorcas made mention of hubs for boys that already exist in Mushi in Lagos State, and some others that want to set up in Kogi State. So we have this in mind, we shouldn't forget that, but we need to close that gap first, and we can move together in the same direction. So thank you so much, Madam Amber. The next, number 4, yes, Mr. Shola, please go ahead.
Thank you so much, Rachel and the panelists. I got interested when Dr. Ujam spoke about let them program and we program for. In the science environment, we do usually have an idea of the end result because we have to be scientific even before the project program. My concern is, are you saying you are expecting a level of equipping the AYPs or the vulnerable, considering the fact that the vulnerable, there's access to education and some other factors that position them in that light. So are you referring that rather than say, when we say program for, is it equipping them for them to be able to program? Because we all understand the level of technical know-how it requires to carry out all of these activities. And yet again, just like I said, putting into consideration that this requires a level of professionalism. Would you just want to push them there when they are the victim? Thank you.
All right, thank you. I think Dr. Oja will give context to what he was saying. But before that, let me just take the last 5. That's Dr. Bola. Yes, that's your number 5. So you do, I give the number. Thank you.
So I join others to thank the moderator and the panelists for an excellent job done. It's not always easy to talk about IPV and gender-based violence. And for me, I think one thing that I think Dr. Jerry touched upon it, but you see a lot of IPVs actually happen across all strata of society. And it's amazing that across the strata of society, even amongst very well-educated people, there are usually 3 determinants of what happens. Just as you said, the social. So you are looking, you are the wife who's being beaten perpetually every day. But the social construct is that you have to stay in that marriage. Life cannot continue if you leave that marriage, and you will lose all your social investments, your social standing. So I've seen women who would rather die in a very bad marriage than just come out. Not because they don't want to, but they do not have resources, they do not have the support, they do not have the enabling environment. So every woman you see that comes out of such a marriage, it is amazing to know what price they have paid to come out of such a marriage. As people are sharing, I will say today I'm one of such women. Now, the second thing is also to talk about when you look at the cultural perspective is that whatever happens, and I'm going to come back to Minirella, whatever happens, you stay there. And religious, I've been in churches where pastors will preach, God hates divorce. And you cannot divorce, you cannot leave, you cannot do anything. You must stay in that marriage. You sink, you swim, or you die. So it's really, how are we making sure that within this environment, and coupled with the fact that as we talk about intersecting vulnerabilities, we're not just talking about just marriages, we're talking about young people who are in relationships that are mirrored of such backgrounds. I have a 30-year-old son, and he comes to me sometimes and says, you know, the things I hear men my age talk about in terms of how they would deal with their wives, despite the exposure to education, or what they expect their wives to do, or things like that, you know, it tells you that there is a lot to be done. So I really want to hear from Norella, what are you doing, especially in terms of the religious leaders? Because they will say we're helping, but actually, I see them as passive perpetrators. Because if you are not standing for something, then you are standing against it. Because if you are telling me in church that God hates divorce, so you are telling me if somebody is beating you, you are dying, you must die silently in that place because God does not want you to divorce, but God wants you to die. You know, so those, and we've seen it happen in a lot of the churches. We have incidents now where people are killed, where women, a lot of women, and there are men who are, there are more women, but there are men who are facing, and for men it's even worse. Because within the social cultural milieu, you don't want to say your wife is beating you. And that's what it's they don't want to say their wife is abusing them. You know, and it's really painful. So you think it's double shame. You have a wife who can beat you, and then you cannot even talk about it. So I think for me, one of the things we need to also do is that all these groups, the police, even when you go to the police station, I've had times go with people to the police station, and if it's a man, the first of all start laughing. Hey, your wife beats you. Which kind man you be, sir? You know, that's when you go just connect, snap, left, right, center. The person will just go sit down somewhere. Sorry, it's PG to say that. You just slap her, and just go and sit down somewhere. You must be a weakling as a man for her to be able to beat you. So what exactly? Because these are serious issues, and it cuts across, whether it's from with all apologies, out of assembly, anywhere, to schools, to teachers, to educators. What are those things? How can we change the narrative? Because it's a silent epidemic and people will find it hard to bring to the table. The second thing I want to talk about is when Dr. Ulan talked about people coming out to really talking about involving young people, getting young people. It's been done. And I think, Dr. Uwen, you should just share your experience because one of the things that has stood Action Health Incorporated out is the fact that they've actually nurtured and empowered young people. I'll give examples of them. For people working in the US government circles, DollarCo is a product of Action Health. Adeola Lawyer is a product of Action Health. There are so many products like that of how they've empowered young people, getting them to sit in and program. So it's done, but how do we bring such positivity to scale very, very quick? Thank you.
Thank you so much. I round of applause for your These are the hard conversations. I know we wish we started these, maybe 3 hours because that's why we're here. What Dr. Bola has done is to just get us back. For those of us who have drifted, looking at the numbers of emails we have waiting for us when we leave here, she's bringing us to the reason why we're having this discussion. We need to chart a course to really deal with the real issue, because if not, we'll just leave here, we'll be like we came to gossip, and then we're done and we go, but no action has been taken. And I thank you so much from Aiden. You brought that, that first call to say what some things need to be done, some things need to change. So thank you so much. So before I come to you, Madam Amber, I'll just piggyback to the panelists. I'll start with Dr. Uja. You have a lot. So just quickly just tie them together, respond, make sure we don't leave just the big people that are there, You're able to respond quickly to that, and Dr. J and then Dr. Salam.
Okay, so thank you very much. I don't consider myself a big person. Is it fair to say that Dr. Oyedele has answered your question? Because at the end of the day, I was minded to say that it was one could interpret it as being a tad condescending. If you think that you are the professional, if you think that you know it, that they do not know it. What I did say was that we need to get them to provide guidance from the benefit of experience. Okay, I'm happy that there are people who have experienced it, who have programmed it, and championing it now. So I'd like to just leave it at that. But it's just to say, let's move away from the youth and say, in a broad perspective, in HIV work, you dare not program without the people who are living with HIV. So why then do you think you can program for the youth without the youth? That's just the question I just want you probably to do. I'm sorry that as a Nigerian, I'm going to answer your question, but I'm going to put the question back to you. Okay, why do you think you can program for the youth without the youth? All that you can do is just say, I've been through this, I've been there, I've done that, got the scars, but I've still listened to you because things change. I think that when we were growing up, we didn't have mobile phones. Now there are mobile phones, and tomorrow there's going to be something else. And if we're thinking that, that we have to involve the youth, we have to see their own perspectives. And, dare I say that some of the things that they are involved in now is what actually helped us. If we think about when we were all in lockdown, it's the innovation of the youth, being able to reach each other at home and stuff like that, that helps us in our program, being able to get people to go to places and get the medication and continue. Because we had a vast drop in the numbers during the lockdown, and I'm surprised that those data came through. So you can't do anything without involving the person when you're doing it. Now I'm going to move to the other question about shall we call that integration? I'm going to be, I can play to the gallery, but I think I'll be real. The problem with intimate violence is that it is criminal. And if somebody has made an assertion, an allegation that they have been sexually assaulted, it has to be treated in a specialized manner. So we do have safe spaces to protect them. But what about the examination? I was telling again my friend and family that in a different client, I used to work as a forensic medical examiner. So we call them police doctors. You have to take them to a rape center because you're going to take samples. You can't do that in a hospital. You can't do that in a general hospital because of the chain, how they put the chain of evidence, isn't it? So because of the chain of evidence, you need to treat them with sensitivity. You need to take them to a place where I'm happy the police have them. You've got the psychologists, the counselors, and then the people who are going to enable them to talk freely about it openly without withholding information that could be used to actually help that perpetrator get his sentence. So you have to do that in specialized places that you cannot do in hospitals. Unless there are certain hospitals that will have a wing for such things. But remember that all eyes will be on that area and they could be on gene influences. So we have these friendly centers that abound. And we also have, if I'm not mistaken, quite a few interest groups who support the provision of care for people who are victims of violence, domestic violence. So I don't know whether that kind of answers your question.
It does. It does. Thank you so much, Dr. Jam. So, Dr. Jerry.
Yeah, so I think we'll share that question. So I'll just add a little bit in terms of what we are doing in the CDC program. I speak for CDC because I know in our program we've really done our best to integrate gender-based violence care and routine screening across all of our supported facilities. We currently are in about 18 states in the country, and we've trained practically all of our care facilities that we support in terms of routine screening for violence, gender-based violence. Now, when we talk of the IPV or gender-based violence, we are not only talking of sexual violence, it includes all the other aspects, physical and all. So they do those screening and can provide the medical aspect of the care. That is the critical part, especially the issue of preventing sexually transmitted infections and HIV. The post-exposure prophylaxis where it is needed, all of those are provided at those facilities. And we have reporting chains that people report on different kinds of violence that have been screened and we found. So we have data on this. Ideally, other third parts of the state should be doing the same because we generally have the same template. So, but I really can't, as I said, I want to speak to what we are doing with the partners that truly through our partners, implementing partners. We've also helped the country develop a gender-based quality assessment tool that helps. And in terms of the question you talked about, the WHO requirements for what needs to be in the facility. There are certain small parts of it that can be done to keep the quality which we have, and the training of healthcare workers in ways that they can actually do the screening in a friendly manner, and that helps the client to get confidence in sharing that kind of very sensitive information. Now it's up to the survivors of violence, to the slide, whether they want to take it to section where friend and family is from, and that's their decision, not ours at the site level, because our best care is to do all we can to support them medically and socially, and then where they need further, issues about pursuing legal redress and all of that, that's something that we can now refer them for those services. So the other bit is about referral services generally for several other things, and I think we have a list of referral centers that we can refer them for all other social needs related to this, including the support you mentioned. There are certain organizations that provide. So we usually share those referrals, they have them, and everybody knows where to send who needs what. So those are the way it is. So I would have loved it to be much bigger, that we can say the entire country and all the facilities are doing this. I'm sorry, it's not that much. There is still something to hold on to. And hopefully, as the country program will continue to go further with it. The Ministry of Women Affairs, I think they've really been pushing a lot of these things about GPP and making sure things work, and we support them. So they have a lot of things that systems that have been developed that are helping to push forward to make it as national as possible, because we are not there. Thank you.
Thank you so much, Dr. Jerry. Just to emphasize, we are still saying these centers are not enough. And the staff are just not enough. And then you will be so surprised. You set up one at Prince and you just start seeing the numbers. So it's not that they're not there, it's just that there's no access to these services. So we need to continue to advocate. We need to be very deliberate. I think that's the word in saying that in our programming, how are we ensuring that we're mapping these spaces, we're looking at the data and making the services accessible. Thank you so much.
So Nerella.
Yeah, Nerella will speak to that. But Dr. Salami, she's been waiting. She's been like, hey, the police. Yeah, go ahead. Yeah.
Try to say AYB, adolescent and young persons, because we don't want to leave out the young boys and young men. They are all important. And in our youth hubs, we don't have places for all of them. Most of the places we've established through CDC funding. But it's not enough. And that's why we keep saying the things we have to go back to those systems that the Bola mentioned, which is a little wider because in their own approach, it's everybody in the community. And that means parents also have a role, the professional institutions have a role to raise boys differently, to help them know they need to be protective of ladies, just like their sister, different things like that, that need to come in. And those are much bigger than any of us here can say.
Thank you so much, Dr. Salami. It's your time. Great.
All right. So to answer your question, I know that recognizing and identifying that the bad image the police has stems from human rights violations of the citizens, ranging from profiling to illegal arrest and lawful detention. We propose to the police authority to incorporate human rights as a cause at entry level at all police training schools, which you are looking at. But now that you have mentioned GBV, we can also tweak it and add to it. But I know that in Lagos State, again, we have the GBV HIV response team, where the police is a member. So I will definitely go back and then also make my proposal. Then also, Dr. Bola also mentioned that there will be a team going with the IG. They can also mention this to the IGs to add to the human rights, which is going to be a course at entry level law police.
Thank you so much, Dr. Salami. You really spoke a lot about it. The police is really friend and family, but it's your friend because she didn't address all the case, the slamming. So, the police, your friend, your family. Thank you so much, ma'am, for just sticking to the real issues. And thank you, Dr. Francis, for raising that up. Ninirella.
Thank you so much, Dr. Bola, for bringing this back to us. Just to quickly say that, like I said before, if you notice, a lot of this gender-based violence happen in the faith communities, in the faith congregation. Yes, because we saw that, and that's why our response is targeted towards religious leaders. Now, what we do as Ninirella is training and retraining religious leaders on issues around HIV, gender-based violence, health issues, because we notice that they know so much of the religious book, but when it comes to issues around health, we have professionals here. You cannot beat a religious leader to his or her religious book. They are so inclined, but when it comes to what we are doing here scientifically, they are lost. They don't know about them. We just finished a state dialogue in Kogi and Kaduna, and exactly this panel discussion came where we brought religious leaders. And the good thing about it was the religious leaders were able to come up to say, yes, a lot of religious leaders, they say that they misinterpret the religious book. So therefore, there's need to be trainings and more trainings for them. And that's one of the things that we are doing. Because most times someone will bring them in for training. You see them like, wow, are you serious? A lot of them, the good thing is, they don't even know that there's anti-discrimination law. Issues around HIV. Now, Ninirella is also pushing through the faith institutions to see issues that are around in churches and mosques today. There's you must do HIV test before marriage, and your test results are being sent to the pastor, to the religious leaders, to the imam, and not to the couples in charge. So that has been an issue, and we came up with that. We brought in a whole lot of religious leaders. The head a month ago, where we had a conversation meetings with them, and we brought this out, and we showed them the anti-discrimination law, and they said they never knew about this. In that meeting, they were able to come up with an affirmation to say, we religious leaders will not do this again. And I'm happy to tell you that while I was here this morning, the camp director called and like, please, can you share again with me that affirmation we did? Because we're having a meeting with the camp chairman right now, the camp president and secretary, and I'm sharing it with them because all the they need to cascade it down to the different faith congregations. So that's one of the things that we have done. Secondly, you can see that CIHP has also, thank you. CIHP has also helped us to develop a seminal guide on HIV and gender-based violence. So in that seminal guide, it helps the religious leader. It's not a bulky thing because they will not have time to read, but there are short messages that they can preach on issues around gender-based violence, issues around HIV. That Ninirella and CIHP through CDC funding has just finished with that document and will be rolled out soon, which is a beautiful thing that has done. So thank you so much.
Thank you so much. I saw Dr. Bola speaking to Reverend Sean. You want to say something to this? Because you're this thing. Just to mention it, I will just whisper to Dr. Bola that issue of, premarital counseling, when you have your test done, it first gets to your imam or your pastor before you get to know. And I've been privileged to be in a situation where I'm being called to say a couple that try to get married in the church, and one has, HIV, what do we do? And they get confused because they're not even trained to handle that. So they get confused, and because maybe they're hoping they'll all be negative. And then all of a sudden, one of them, the zero discolored couple, and they have no clue, even with hepatitis B. So please, there's something we have to put. And somebody mentioned something about accountability, and he was giving the points. We need to know how, after we train the religious leaders, how do we hold them accountable, or they just sit back into their, their ways? Because the same people who are preachers are also in this environment. They have this background. So they, first of all, have to be, disabused from their own minds on how this should happen before they're able to help their congregation. So a lot of conversations talk about, we will not meet here, but we must meet here. So I'll just let Reverend Sean, maybe just 30 seconds. What are your views on that?
So thank you. I think what we're seeing in the US is a lot of pastors who are tone deaf. So one of the responses to HIV and AIDS in Black churches, particularly in the South, where Black pastors were being tested in their pulpits, which they thought was a good idea. However, people living with HIV was informing them that one, that was stigmatizing, particularly because they were only asking pastors who were presumably heterosexual to get tested in their pulpits, which you would know the outcome, presumably, of that test, right? They don't ask queer pastors or pastors who are sage 11 to be tested in their pulpits. But what it does is it also did not move the needle in increasing HIV testing within faith-based institutions, because it just didn't. Pastors are supposed to be trusted voices in the community, however, are perpetuators of some of the violences that people experience, right? So as a pastor who is going to seminary and who had to unlearn a lot of stuff in order to build up myself so that I can build up the people that I preach to, that took a lot of work, intentional work. And pastors are not, so most pastors, excuse me, are not interested in doing that type of soul work, right? So and then some pastors are struggling or wrestling with it because this is generations of irresponsible biblical ideology that they have to work through in order to produce a gospel or preach a gospel that is liberating, right? So there's two sides, that people who do not want to, and then people who say, I just don't have the capacity to do so, right? But that's where we come into play. So I'm really interested in this sermon guidebook that is being produced to give to faith leaders. These are conversations and surveys you can preach to your congregations around gender-based violence, HIV, and or other things. So I was telling somebody earlier, next year when we're invited back, I'm going to bring a whole bunch of faith leaders just to be a part of these conversations. That's really important. And so thank you.
Thank you so much, round of applause. So it's definitely, this is the second person ready for the fifth annual. So get ready, get ready, get ready. Thank you so much, Reverend Sean. So panelists, this, it was good. You see, that's a good thing about this conference. It started, but it's, getting to the climax, and you guys brought that on. Thank you so very much. You've really just been amazing. Now, around the applause. We're just coming by, just like we did, I don't want to have a great picture with you. Yes, together, Dr. Ujam, Dr. Jerry, Pharmacist Sano, amazing moderation, Dr. Salami, friends and family, and then we also have family there, and then we have Idala. Thank you so much. Amazing. Thank you. And also thank you to the audience for your amazing contribution. Around the applause for yourself. Okay, so we're winding down, and we'll quickly just call on Dr. Bola will come up. We just want to give a leadership award as we start winding down. And I saw that you were giving some papers with you as part of the next session where we will be having, as we close the post-scientific roundtable survey and breakout session. We'll just be running that shortly. But before that, we would like to just give a leadership award quickly, leadership award presentation, and Dr. Bola will be doing that. A round of applause as Dr. Bola comes up.
So thank you very much. I can see based on the IIT, we're doing very well. The rate is still very low, and we're going to wrap this up very quickly, very soon. And I know we would see crave your indulgence. I'll keep this very short. But we also need to plan for next year and also do a short evaluation of what we've done. So we've done a lot of discussion, but as scientists, let's also document and see how well this has worked. And what are the things we need to keep moving on. So for us to do this, I'm going to also invite Dr. Jerry to come and join me here for the leadership award. So we started earlier because it was supposed to be this time, but we gave the AIG because of his compelling duty and because he had such short notice. So we're going to give the next leadership award to
sorry, just a minute.
So it goes to Madam Emily. Madam Emily. Come up. So as we hand over Gombe State, we've been programming in Gombe State for the past 14 years, where we started first at ICAP, Columbia University, and transitioned to CIHP. Madam Emily started, and I would say Madam and I started way back in the Federal Ministry of Health. And we used to work, I remember we did an assessment for the then Delta states for UNFPA while she was vice principal at the School of Midwifery in the then Bauchi state. There was no Gombe state then. So I really want to salute her. And then she came on to join CIHP. She was our first PMTCT focal points and technical officer in Kaduna State, where she started the program. And when we got into Gombe State, she went on to become the state program manager. And she was pivotal in leading that team to get it to that point where they were able to shift the needle from that, from epidemic into epidemic control. Gombe State is one of the states that moved from there to May. And we want to recognize Dr. Emily for the exceptional job. And I think it's so apt that Dr. Jerry is here with me to give that award to her.
Thank you. What a privilege. Wow. For my big sister, Emily, it's my pleasure to give you this award on behalf of the AIP. Thank you for your work and really for the programming on this. Excellent work.
Thank you so much. This is in recognition of her extraordinary leadership and unwavering commitment to public health. We honor Emily Medina, a distinguished health professional whose contributions have significantly advanced the HIV response in Gombe State. With over 30 years of experience in healthcare, Emily has demonstrated exceptional skills in coordinating HIV and AIDS services, both at facility and community levels. Once the Associate Director of State Program Operations and ART Surge Incident Commander Emily has, over the last 13 years, led multidisciplinary CIHP program teams in scaling up HIV testing services and increasing ART uptake, contributing to Gombe State's remarkable achievement of greater than 100% ART saturation and 95% viral load suppression. Her strategic oversight and advocacy efforts resulted in crucial state government support and collaboration, including the provision of rapid test kits, laboratory reagents, and deployment of human resources, thereby strengthening the local healthcare system. Emily has been a beacon of excellence, from initiating the first PNCT site in Kaduna State to improving healthcare quality in Gombe State. Her dedication to process improvement, creative problem solving, and capacity building has left an indelible mark on the healthcare landscape, reducing HIV prevalence and enhancing the lives of countless individuals. For her outstanding leadership and profound impact on public health, Emily Medina is deserving of this leadership award. Her work exemplifies the high standards of professionalism, dedication, and compassion in public health. So we give you this leadership award in recognition of your excellent service to the people of Gombe State and significant contribution to the HIV response and exceptional leadership to the Gombe teams of CIHP in the state for 14 years. Ladies and gentlemen, Emily Medina, CIHP. A round of applause, please. So pass the mic for her to say a few words, if she can. She doesn't know it, but she can. Go ahead.
Good evening, everyone. Honestly, I'm humble. I really don't know what to say, but first of all, I want to thank God, because He's the one that made us instruments and just channel to do what we've done for the past years. I want to also thank the leadership of CIHP for giving us the opportunity and the privilege to lead in my own state. And I also want to thank the Gombe State government, the Executive Secretary of Primary Healthcare Development Agency is here, and NASCAP, and my brother here. I wish I can ask my children fund so that we take my children, please. Like I said in one of the meetings in Gombe, when they were saying all that you were saying about me, I said, that is not fair, because we did this together. On my own, I could have not. I'm sure that it was a community and a team effort that gave us the success that we had in Gombe. I also want to sincerely appreciate the Gombe State government, because, you know, for everything that we put to them and ask for, is like it's given on the platter of gold. So the credit goes to the state government and to the dual team in Gombe. I'm so proud of the dual team in Gombe. I think that God will give us another opportunity to do it again, and I'm sure we can do it again. So thank you very much, everybody. We are humble and we are happy. Thank you.
Thank you so much. Well, and really just to acknowledge the Executive Secretary of the Gombe State Primary Healthcare Development Agency. Please, sir, if you're here, thank you so much, sir. Thank you for coming. And then we also have representatives from the State Primary Healthcare Development Agency and the Ministry of Health from the states that we work in. For Gombe, if you're here, just you can rise so we can acknowledge you. Yeah, thank you so much, sir. I can see Pharmacist Eric is somewhere here. Yes, thank you so much. Thank you so much. For Kaduna. Director of Public Health, you're here from Kogi State. Dr. Francis Akar, thank you. Yeah, that's great. And then Kaduna State, are you here? Thank you so much. Thank you so much. Lagos State, our representatives from Lagos State, from the PM. Thank you so much. Madam, thank you so much. Thank you so much for being here this year.
So we still have one more leadership award. And this goes to a person who is a public health professional with over 9 years combined clinical and health programs experience in Nigeria and Ghana. He joined the CIHP program in 2018 as a clinical service associate, and over the years has continued to show exceptional work ethics and a drive for excellence. He's currently a member of the grants unit. His work in the unit as the acting senior grants manager has provided growth and reinforcement for the organization. His dedication as promoting the vision of the organization and maintaining partnerships on behalf of the organization. Despite becoming a new dad very recently, his can-do attitude is worthy of emulation and will continue to prove to be an asset in any room he proceeds to enter. We at CIHP are incredibly proud of your achievements, and we want to express our reserved appreciation for your commitment and impact. Thank you, as I welcome Dr. Emeka Kanimba.
I don't think I've ever been surprised before. As part of the committee, I do not know if this was happening, but thank you very much.
So, on behalf of the leadership of it's my pleasure to give you this for all the reasons they've given, and congratulations. Thank you. Down, so right, thank you very much. Oh, that's from you.
No, okay. I've been speaking the whole day. I just want to thank everyone, but particularly the work that Dr. Bola has described. One of the core values of CIHP is really inspiring leadership, and that has come from my immediate boss, Dr. Bola, who has continued to inspire the work that we do at CIHP. And this really just goes to every body who works at CIHP and lives and works and thrives under the leadership of Dr. Bola. She's making us to be what we will be in the future already today, and just already practicing. It looks like a small scale, but you see us in the future. The future is just bright. And I want to thank everyone, and we continue to move. More work from tomorrow. Thank you so much.
Yes, a big round of applause for Dr. Jerry.
Thank you so much. So now, back to the work. Okay, so we have Dr. Collins. Imario will take us through the next science session. And that will be one of our last, just basically to close this. Welcome Dr. Collins Imahriabe, who is the Director of Strategic Information, and with Dr. Banky Olatosi from the University of South Carolina to take the next session. So a round of applause, please.
All right, so good evening, everyone. We'll make this very quick. One of the things we realize is that we all talk about how we want to change the narrative, but we don't put out a lot of information out there for people to reference, to look at. So some of the things that we capture here, there's just any of the reports that are not disseminated widely. And like for this mentioned in the morning, we'll be looking for examples. You say the Lesotho experience, the Ghana experience. You don't have the Abuja experience. You don't have the Lagos experience. You don't have the Nigerian experience. So we need to do all that. So please, this few minutes we're still going to indulge your present, and we're going to appeal that please participate very well. We are all tired. Looking forward to the call to quickly do this. So we are going to do this in two sections, but the very most important one is to have us the group. So the banking just really tell us how that setup will be like. We have a team of facilitators who will work between the different groupings and will make this very, very simple. More importantly, is that we're able to contribute to identifying the barriers, creating the adolescent program, looking at the strategies to improve these, and also be able to determine what are the approaches to sustainability. Where we tend to publish this and circulate widely, and we will expect that all participating in this, so that all of the things we've discussed from the beginning of this program to the end is captured properly and is sent out there. When you come to the scientific conference next year, you'll be able to make that reference and we'll be able to go and do these as we move on. So I'll hand back to you. Sure.
Good evening, everyone. We're going to do this really quick, but I want you to know that you're part of making a big difference by doing this. This is a scientific exercise that will be published. Your inputs will go, so essentially what you say today will go around the world. So on your table, you have different post-it notes. I ask you to pick one color. There should be a color different from your friend. So pick one color first, as the first thing I'm going to ask you to do. Now that you have picked one color, this is what I'm going to say. If you're green, stand up. Green, all greens. Up, yeah, awesome. You're number one. You're green, you're number one. Grab your bags and go with me to the left side where Dr. Francis is standing. Go sit around that area. All right, let's go, quick. All greens. Go to Dr. Francis, you're already standing. Take your bags. Just move that way. We'll do it real quick.
This way to the left.
All greens. To that area. Thank you all. If you have the color orange, please stand up. You're orange. If you don't know what orange is, this is orange. Just check it. If you're orange, stand up, orange. Okay, whatever. Orange or pink. They said it's pink. It's pink. Okay, whatever. If you have peach, this color, you're number two. You're number two, you stay right here. All peach, come to this side. All peach, grab your things and come to this side. We want your voice. All peach, come to this side. Thank you. If you're yellow, all the yellows, you're number three. All yellows, go to the back of the room on the left side. Number three, just go to the back of the room on the left side. And if you're pink, all right, if you're pink, please stay at the back on the right side. Please sit, grab your things, get comfortable, make the circle wider.
To match the tables.
You can match the tables. We're not looking pretty anymore. We're getting down to work. Go ahead. We're gonna have a voice. All right, go sit in your colors areas. Awesome. For those of you who might not know what we just done, we just randomly put you into a group. So we've done randomization. So scientifically it's sound. All right, sit, get to know your group. Go closer to your group, please. The orange. What color are you? Yellow. Yellow is there at the back. Don't change your group, don't mess the randomization up. Yes, yellow, go. All right, everybody sit down. Sit down. We have my facilitators at the table. All right, do I have all facilitators at the table? Awesome. Facilitators are at the table. Everybody sit. We're good. We're gonna do this quickly, I assure you. Okay, everybody has a sheet. Everybody should get a sheet. Get pull the tables together.
Okay, so thank you. So while you're settling down with that, just to let you know that on the screen, there's a barcode, and also on the tables, you have a piece of paper that has a barcode. So immediately we are done with the group section, I will also invite you to please scan the barcode and answer a few questions that are there as part of the evaluation for this process. So there are two levels.
Yeah. So don't scan the card yet. Don't scan the code yet. That's for the end. That's the end of survey. Right now, we're doing the nominal group technique. So you should be given a paper. So if you don't have a paper, raise your hand. Okay, there are 4 or 5 people there who don't have papers. Facilitators. No. A paper for writing.
Please give to everybody 1 copy each for everyone. You get 3 copies.
All right.
1 for the barriers, 1 for strategies, and 1 for
one first. All right.
Yes.
Does everybody have a sheet of paper in front of them? All right. Everybody has a sheet of paper in front of them. All right. We're good. Everybody has a sheet of paper. All right. All right. Okay, we're good to go now, right? All right, this is what I want you to do. And this is you only working alone in class. There's no copying. Don't look over your friend's shoulder. No discussions. Write the 5 barriers we have to improving adolescent health in Nigeria. Whatever comes to your mind. Your 5. Write it down. 5 barriers. Don't look at someone else. Just write what comes to your mind down.
So you can represent that just 1 word on your phrase. So look at the top of the page or the sheet. The question is also written out there. So you could have 10 in your mind, but want you to just list out the 5.
If you need a pen, let us know.
There are pencils, and if you need a pen, you can also share. There are pencils on the table. Just write out. Thank you.
Right after 5, you don't need to include your name. I can see brains working. You're all doing great. There are no wrong answers. Right after 5. We're going to make this even bit more competitive. So the group that finishes early, we will celebrate them. But everybody in the group has to have finished. 5. All right, which group is done? My facilitators.
All right, so please, when you just list out that 5, pass it to the facilitator in your group. You pass it to the facilitator in your group, and they'll hand you another form.
All right, hand it over. How's everybody doing? People are still writing? Almost done? I would say take your time, but we don't have time. So, yes, facilitators, someone there, someone wants to hand over? All right. Everybody has finished that? Now we're going to go to assignment 2. Facilitator, there's someone here, please. Someone needs to give a paper. All right. So we're going to get the next round of the assignments. Facilitators hand over the second sheet.
So the next sheet is on the strategies. We talked about the barriers strategies You take the prioritize the strategies you want to see implemented. So you just list it out on that form as well. You're part of this group, right? So when it gets to the group, there's going to be a group discussion. You need to come closer.
So you're doing the second sheet. You're also doing it on your own. So go ahead and write. If you don't have the second sheet, raise your hand up. The facilitator will come. If you don't have the sheet, raise your hand up. The facilitator will come. So now you talked about the barriers. Think about what the solutions should be or the strategies. Whatever comes to your mind first. 5. Five, keep living. Thank you for your participation. You're going to be part of Nigeria Research in the World. Sorry, you continue to work, but there's no free lunch. So we've already paid you with lunch. So you should work. You're doing fantastic, by the way. My facilitators, how are we doing on number 2? Once you're done, just raise it up and the facilitator will come grab it. Facilitator, there's someone's done on the back, please. Grab that there. Fantastic. You're all doing phenomenal. You're all doing great. You're all doing great. Just raise it up once you're done. Raise it up. Phenomenal. Once you're done, raise it up, then someone will come grab it from you. Yes. We're all good? Yes. Yes. Awesome. There's one there. You're all doing great. You're all doing great. You're all doing great. Do we have everybody has submitted the second sheet? Everyone has submitted the second sheet. Awesome. Second sheet is ready? Great. All right. Everybody's done on 2? No, we still have a few people, so please hang with us, everybody. A few people still thinking. How the group's doing on this side? Is everybody done now on 2?
If I'm still writing 2.
No?
Are you done? Two, group one, group two, group three, group four. Awesome. So what you've done now is you've identified the problems. You provided ideas and strategies to solve the problems. But we all know that with programming, what kills us is how do we sustain those solutions. So for assignment 3, you're going to talk about sustainability. How will you sustain the strategies that you came up with? So go ahead and share paper 3 for that. And sorry, I have to make you pay for lunch. So free lunch anyway. Sustainability. How will you sustain the strategies you came up with?
So just drop it on the table and then we can split it out.
Sustainability. You talked about how you solve it. Now, what you came up with. I know for some of you, you might have traumatic experiences from your former exam, but you don't have your name on this paper. So you have no problems. You're doing great. You all doing fantastic. If once you're done, raise the paper up. Someone will grab it from you. You're all doing great. Great job, great job. Great job. Okay. You're all doing phenomenal. Thank you. You're all doing great. You're all doing great. Once you're done with paper 3, assignment 3, raise it up. Raise it up. There are people who need to grab their papers there, please. Grab their papers. Assignment 3. You're doing well. Just raise it up and someone will grab it from you. Awesome. Now facilitators, how the table's doing? You're doing well? Doing great, doing great. Everybody's doing great. Just raise it up. Awesome. This is actual science. You're participating in science right now. Keep going. Awesome.
Okay, so there's also an attendance, I'm sorry, like a sheet to just document the group information and distribution. The sheet that will come around, just indicate your name and tick your area of expertise, your profession, whether you're research, community, whatever. What will be the distribution of the group? Yes, an attendance sheet. So it's going to come to you, just fill and pass to the next person, or 3 or 4 copies into my table. Please pass the attendance sheet out so we know the group.
No. So what this sheet that you're going to be filling out will do is it'll let us know
who participated in this exercise. So as a stakeholder, are you a community worker? Are you a researcher? Are you a programmer? Are you from the CDO? That kind of thing. So just help us. We don't need your names. No. We don't need your names. But we need it for each table. So don't mix the groups up. For your group, just keep it. Just choose one of the professionals. We don't need your names. Nope, I don't need your name. I just need each table was the representation. If there's a missing category, please write it down.
Please just write it up.
Write it at the bottom. Sorry, we apologize for that. On that, just write it there.
You can skip that. But if you write, it's fine. It's not. But don't do anything with the names.
Just don't put your name.
Just pick the profession after.
All right, we're doing well. Now, just to give you context, even as we're doing all of this, we're tallying the results and we're going to bring it back to you. And we're going to rank order the results in the top 5. And we're going to have a quick discussion and then we'll be done. So please sign it. If you don't think any of those represent you, but whatever you want to be represented on the sheet. You're all doing good.
So what I'm saying is, if you look at the box list where you have whether you're a researcher or from the community, anyone that does not represent you, feel free to just write it by the side there. We'll pick it as well. Thank you.
Just keep it by for each group.
Yes, please write your group number. The facilitator, make sure the group number is written on the sheet, so it's not mixed up.
All right, so while they're still counting, since we have the QR code up, grab your phones.
And on the table as well.
And on the table, grab your phones, open the QR code, talk about the conference, talk about what you'd like to see in the 5th upcoming conference, while we tally up the results. Thank you so much. It's on the table and it's on the screen. Use whichever one works best for you. You're such a wonderful crowd. You're staying extra time, overtime. You're doing great.
Just hang on, we'll fix that. Hang on, we'll fix that. I guess some people are killed in there. Yes, we will open it up. Just hang on, please. Hold on, we'll hang on.
Sorry, it looks like we ran into technical glitch. They're going to open up the scan codes. Thank you. Please bear with us. And I have from good authority that the CIP CEO will pay double what they paid for you to come here today, which is nothing. Thank you.
Please try to quote again. All right. I'd like to have a volunteer leader for each group.
because I'm gonna ask you to do something for me. Anybody wants to volunteer? Someone to lead the discussion. Now you big guy. You're gonna lead the discussion. I'm gonna give this to you. All right, everybody. We're gonna have a group.
Listen up.
We're gonna have a group, please.
One, I know you're talking already. Just hang on. We need one.
Excuse me. Hello? Just 1 minute, just 1 minute. You're gonna get back your sheets with the ranked top 5 unranked. Top 5 things your group said was important. So now you get it back. Your group should then agree which of them should be in order. 1, 2, 3, 4, 5. So your group leader will read out everything that came out of your group as most important 5, and all we need your group to do is to rank which is the top 5 in order. All right? Yeah, we counted it. All right? Good job. So my boss, whoever is the leader, has to read everything out to everyone. So you know which is the rank, because if you just share the paper, it's going to take a long time. So, for example, this is group 3. Ignorance, culture, and poverty, political will, community, stigma was what came out of your group as most important. Within those 5, rank it as most important to least important. Barriers.
There's a scale on the paper that shows from 1 to top 5. So you rank it from 1 up to 5, right? With 1 being the least, just that they are top 5 you're doing. So you need to have a group conversation. Hello, you have to discuss it now and you're on the same page, and then you are on the ranking. What we've done is to tally your responses. Some of you wrote sentences, or we pulled out what the state was from what you have talked about. Thank you.
So if you have a leader in your group, you should have your 5. You decide what you've done. Then you have the next one. All right, so group folks that work very fast and very hard. They've already finished. How's the discussion going? Decide what's the order of the rank. Which one should be 5? You're doing phenomenal group. My police and family group is needed. Police and family is needed. What's happening at the back here? They don't have their tally. Mr. Dr. Francis, Dr. Collins, yes, this group has not even received their tally.
Wow. What's that group? That's not the one with barrier.
Sorry, barrier should be done already. All right, someone lead and call it out. Yes. Rank order them. Who wants to speak? Yes. Yes, please, can you tone it down? I know you're very passionate. We're gonna pay double. All right, come on. So now you should be on.
This kind of production, yes, no.
My screen there, except you're asking me to draw this guy.
What is that progress?
You don't send them a single.
Nah, image. Nah, image.
You know, like, you just copy and drop.
Okay.
Because I'm not sharing my computer. But then I'm telling you,
Put the announcer and the start.
yes.
You're all doing phenomenal. Thank you for all the work you're doing. Awesome. It looks like the police and family are just on the roll. They're almost done. Police and family group by the lead. But just to make everybody understand, look at how wonderful the young person's taking charge is. Wonderful group, very coordinated. Okay, the winning group is already taking a winning picture. Yeah, they're gold medalists. They're gold medalists. They're gold medalists. Please, the young person led this group. A young person, before this picture, a young person led this group. Share the young person. For those who have finished, the barcode is active if you want to take a survey. The gold medalists and the silver medalists here, led by a young person, silver medalists, the yellow team. Stand by. Silver. Silver. Why silver holding green? Silver medalist. There's one medal left for bronze. They got Ali. The government Olympic Committee of that group is not working well. And the silver medalists are gone. Thank you, silver medalists. We appreciate it. It's now left for bronze. Okay, okay. Bronze, 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 bronze. Okay, wait. By the order of CIHP, if you want to contest whether you are bronze or silver, take it to the court of arbitration. And the bronze. Yes, and the bronze. Bronze. Okay. We have the quadruple group. Congratulations. The best shall be the first shall be the last, and the last shall be the first. So you are by default the last first. Come and take the pictures. Thank you for participating. You have not finished. You have one. Please, if you need to discuss, we can discuss and wrap it up. We need a consensus in the group. Thank you. Thank you so much. Thank you so much. Congratulations. Actually, you should all be proud. We won bronze. We figured out the group was cheating. They are not finished. So you won bronze. You found the group was cheating. So they won bronze. You have been disqualified. You are not finished. Don't worry, we'll settle it in court. For now, the result is an start. We'll settle that in court. The group has been awarded already. Let's just hold on for the next group to finish. We really appreciate you spending all the time. It's a very helpful process. So for those part, please check out the barcode again. It's working now. Please check out. People are confirmed. You can quickly do the survey. Thank you very much. Very good. Thank you so much. Great job, great job, great job, great job. Great job, great job. Great job. You came first from the last. Great job. Great job. This is the last round. You finished, you did barriers, you did strategies, and you did sustainability. So now you have finished your work. And you haven't done sustainability. Your everything was. They didn't give you. I know. Please give them the paper. I know. Sorry. David. This person is that. Yeah, without moving on in 5 minutes, we're trying to wait for the last group. So please, hello, we're about to close there, we're about to wrap up. Please take your attention. Thank you very much. For those who are finished, please check out the barcode now. It's working. Quickly fill the survey questions. We'll take more than 5 minutes. Thank you very much.
Just hang on, we have some announcements for you. Yes, what just take it out. We have some announcements for you and some stuff also. Emeka has a package for everybody. So please just hang on. You know, the only group stays better at the end of the thing than what? The beginning, there, so this is coming to the end. But it will be better.
Hello, hello, hello. So the barcode is up there.
All right. I think we're done, but I want to especially recognize the group that just finished. They were the largest group. They truly went through a consensus building. They come through.
They did wonderful things. So we thank you for the time and the effort that you put in. A special round of applause for them.
Thank you so very much. A round of applause for everyone. A round of applause. Yes, 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 yes. Remember the deal. Thank you so much. So quickly. Yes, all right. Thank you so much. On behalf of the Chief Executive Officer, Dr. Bolali, I want to really thank the team that has organized this session, Dr. Colin Timariabi and his team. A round of applause, please. And then our team, led by Dr. Banky Olatosi from the University of South Carolina. A round of applause, please. Thank you so very much. Please do not leave. We're about to finish. Please do not. I know it's almost well, it's end of business, but we're almost done. So I'd like to call on Dr. Francis Ogirima to tell us our next steps and the way forward. So we're just looking ahead. The next few slides, please. Please settle down so we can close. The end of a thing is better than the beginning. So let's end well. Thank you so much.
Thank you, Dr. Emeka. I promise you this will take all of 5 minutes to ask your indulgence. We've got feedback already. I've received personal feedback. We've received feedback on the floor. People are already looking forward to SRT 5.0. So, what are we going to do? What are we going to expect next year? The first thing is analyzing what you just told us. We've heard you, you've given us your feedback. So we are going to look at the feedback and we are going to incorporate what you suggested against 2025 SRT. We'll also be publishing the exercise we just finished as a process paper. You'll be just be part of a scientific research organized by, championed by Dr. Banky and Dr. Collins. So we took your consent, and Banky's randomization was very unique. Thank you, Dr. Banky. So we continue to curate cutting-edge topics. This year was very important, talking about adolescents, and we had very engaging, enriching conversations. But that's as far as it goes in terms of similarity with this year. Next year, we are going to go bigger. We will be calling for abstracts. I think we began a round of applause. It's an evolution of the Scientific Roundtable series. So keep your emails open, follow us on social media, and expect our call for abstracts well ahead of the conference, and we will look forward to your submission. Closely related to that, we will be recognizing outstanding abstracts. There will be awards for outstanding submissions, outstanding presentations throughout the conference. And last but not least, we want to use the opportunity to expand our partnership. So we will be reaching out to you. We encourage you to reach out to us as well. We are open for collaborations. We are open to joint publications. I was just having a conversation with the ES Katsaka, and he has promised to share a protocol to work on gender-based violence in Kaduna State. I will be taking that forward. Thank you, Dr. I just had another feedback from yesterday from the state that this is the best scientific round we have attended so far. Particularly taking out the keynote speech, which really set the scene for the conversation. Thank you for that feedback. So on that note, I'd like to just wish us all, okay, well, I'll leave that for the vote of thanks. But I want to just say that next year, this will be bigger. We look forward to receiving Reverend Sean and his colleagues who will be coming in next year, as well as sexual partners that will come in. Thank you, everyone. I just to say that it's not the last slide. I can have 1.5 slides. Last slide. So the closing slide has info at CIHP. So if you want to reach out to us, it's info@cihpng.org. We expect your call for collaborations on that video. Thank you.
Thank you so much, Dr. Francis. So I want us to do something very quickly, okay? A lot has been ongoing. There's been a lot of posts on social media
So I know a lot of us, we're all leveraging technology. So let's bring out our phones and let's go on Instagram and search for CIHPNG. The communications persons are they here? And let's just go there and follow CIHP. Please let's do that. Just quickly go on your phones. For those of you on Instagram, it's CIHPNG, and follow us. So you see our work and you can also share that as well. We're also on Facebook, we're also on YouTube, we're also on LinkedIn, and you can reach us. Please share your ideas, that will just be excellent. And we're really, really grateful that we could do this. So thank you so much. Please, before you leave, we would like to take a group picture, and we'll be doing that right in front here. So please, before you leave, we'll just set up for that picture before we go. So I'd like to call on a very special lady who's working with the Center for Integrated Health Programs. She works as a key player at the Strategic Information Unit as an officer. Please make welcome Ms. Evelyn Urue for the vote of thanks. A round of applause, please.
Good evening, everyone. Good evening, everyone, and thank you so much for being here all of this time. On behalf of Dr. Bola, the board of directors here, as we close out the fourth series, we'd like to say thank you. We truly appreciate you. First and foremost, I want to say thank you to the keynote speaker. Everything you've said set the stage for all of the discussions that we had here today. Thank you to the panelists. Thank you to the presenters. Thank you for your insight. We truly appreciate you. We are immensely grateful. Thank you to everyone in the room, all of the guests here who have stayed up to this point. We appreciate you. We understand that it was all because of the love that you have for us and all of the immense work that you do in this field that you have stayed up to this time. We appreciate you. We appreciate our partners locally, internationally, CDC, everyone in the room, all the different partners here. We appreciate you. Thank you for the audience online. Look at the time you've been here up till now. So we truly appreciate you. The organizing committee, we cannot thank you enough. Look at all of the people in this room. Look at everything that has gone into this up till this time. We appreciate you. Every single guest here. Have yourself. Thank you so much for being here with us. And like we always say, 5.4 is coming, right? So please, as you have been here with us, we look forward to seeing you again next year. We wish you safe travels again. Thank you.
Thank you, Ms. Evelyn. Dr. Uwem, I know you're engaged in big conversation, but sir, please could you come forward back to your high table? Would like to really, a round of applause for Dr. Uwem and yes, a standing ovation for Dr. Uwem. So I have the privilege, yes, let's give the round of applause away. I have the privilege of eating with Dr. Webb at the restaurant, and I really just, we're all enthralled by his presentation. He really just set the tone for the conversation that we've had here today. Like I said, we started a little bit, but once he came on board, we really now knew why we were here. He changed the course of the whole event. I really want to thank you. Dr. Webb really stepped in, not just for his wife, but for CIHP as well, to come in. He's not based in Abuja, he had to come in from his base in Lagos. He's been working for over 3 decades with young persons, and that has kept him youthful. We have those in so we really want to appreciate you. So we have a certificate for you. It's not here now. We'll be sending that to you shortly. So I appreciate you for just setting the tone here and really your collaboration and friendship and partnership with the Center for Integrated Health Program. And you see, 5.0 guarantee. The CEO just said, and we want to see you again for 5.0, the annual scientific roundtable series. And we don't know where it's going to be. It could be outside Abuja, it could be Mars Nordic, it could be outside, it could be regional, it could be global. Yes, ma'am. You say it can happen. So thank you. Expanding, but like we said, we want to really appreciate you and those online for staying here to this time. And to Dr. Bola is a true Nigerian. So you know how we end events. We're going to do 3 GOSA. It's our tradition to say we're hailing not just the organizers, but really the event and yourself. So we're doing a 3 booster for the conference and for each person. Because it goes, man. That's the American version. So we're gonna go, yeah. So we're gonna go goes, man, at the end of it, okay? But again, yes, Madam Emily, please come. I think you're the champion for all your trainings and all your, well, you know how to do the thing of the goes, and then goes there. So do that. So while Madam Emily comes up quickly, I really want to thank Dr. Bola Oyedele. A round of applause for Dr. Bola. Like we say, you know, she initiated this and look how far we've come. And I really want to thank God. I want to thank her for taking that, you know, initiative, and we keep getting better. Thank you so much, man. A round of applause again for her. So great. So, Madam Emily, you are the specialist in the movie. So let's do that. Thank you so much. And then a group picture afterward, right here. And exactly, what else do at the camera, all those things, we're ready for you. Thank you, ma'am.
Finally, we are going to American Booster. I think that's all I know. What? Okay. Boss, man. Okay, can we go after man? Let's go back to and then somebody will give you. Okay, if I say Atama, Atama, and then Lavabo, and then finally, Aparina, so let's go. Atama, Lavabo, Aparina.
And thank you so much, Madam Emily. So we're going to do the ghost start because Madam has said we'll do it. So this is how we do it. All right? I think why I think we thank you, sir.
Right, so, you know, in the US, we say thumbs up. Yeah, it's Goza. So when I do Goza, you like 1, Goza, 2, Goza 3, then it goes, man. Yeah, yeah. All right, so let's go. 1, 2, 3. Goza. Goza. Goza.
Thank you so much. So let us come forward quickly for a quick group picture so that we can document this. So quickly, yes, please. So let's come quickly. So some people will stand at this point. Well, you can please the background. All right, so please come forward for the group picture. Let's do this quickly. So run. You can also climb up onto the podium. So we have 2 levels. The organizing committee is Kima, Madam Grace Black, Blue Black. Jack. Blue Jack, please. Mr. Dochide, please come forward. Mr. Tamara is here, our city director, and then Sam. Oh, Miss Bo, yes, no. All right, so before you take the picture, please turn your body just a little here so that you can have more people accommodated. Yes, oh, that's amazing. Come. Thank you so much. Please make sure you capture everyone. Some people can come here. Some of us Organizing committee, Gala. Young person, Aya,
I go tomorrow. You don't come tomorrow.
Organizing committee, please wait behind. Organizing committee, please wait behind. Organizing committee, please wait behind. Ellen said. Miss Kima.
Thank you so much. Thank you so much for your support. Thank you. Thanks so much.
Now you can bury some stuff here. Thank you so much. Thank you,
Thank you, sir. God bless you, sir. Thank you, sir.